कीर्ति एसी भी बोलना पड़ेगा।
inside. The first team member will come inside. The rest of y'all will be out till your chance comes, right? After that, y'all can sit here and watch the rest. Any more doubts? Any questions? So we have our esteemed guests here. Good question. We'll get to know soon. So we have our esteemed guests here, Dr. Ketan Patel, the head of emergency department Zydus, and Dr. Ankur Masani, the head of department Sterling. So can we start off? Yeah, and judges. So I think you all must have done your work. Let's start. The first team. First team, right? अच्छा first four को अंदर ही.
Yeah, I don't know what they're selected. How many of you have seen Squid Games? What's the first round? What's the first round? That's not the first round here, so relax. Okay. So shall we move out? Keep your belongings safe. Be careful of your team members, they might disappear. हाँ पता है. Check. Prasad, ready? Ready?
둥글게 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 빙글빙글 돌아가며 춤을 춥시다. 손뼉을 치면서 노래를 부르며 랄라랄라 즐겁게 춤추자. 링가링가링 링가링가링가링 링가링가링가링가링가링 손을 잡고 모두 함께 즐겁게 뛰어봅시다. 둥글게 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 빙글빙글 돌아가며 춤을 춥시다. 손뼉을 치면서 노래를 부르며 랄라랄라 즐겁게 춤추자. 둥글게 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 빙글빙글 돌아가며 춤을 춥시다. 손뼉을 치면서 노래를 부르며 랄라랄라 즐겁게 춤추자. 링가링가링 링가링가링가링 링가링가링 손을 잡고 모두 함께.
You're only. So, team, good morning. You all are receiving a 40-year-old man who is complaining of giddiness, right? So, you all have 5 seconds.
Okay, team. So we have,
Your
just been,
timer starts now.
we have just been informed that we are receiving a 40-year-old male who's complaining of giddiness. We don't have any other vitals of the patient. We don't know the BP. We don't know the airway
The
status. We don't know
patient is
anything.
here.
Okay. Excuse me, sir.
Hey,
Excuse me,
hi.
sir.
Why are you hitting me?
Yes. Okay. So can I get the vitals of the patient? Dr. Pradipta, kindly attach the monitors. I need the blood pressure. I need the heart rate and the saturation, please. Sir, can you talk to me? What is your name? Can I have the vitals on the monitor, please?
It's getting loaded.
Okay.
Leads have been attached, BP curve has been attached, and pulse ox also has been attached.
Okay, I can see heart rate of 76, saturation is 98, and blood pressure is 126/70. So he's able to talk, and his saturation levels are also okay. So airway is patent, and breathing wise, he's okay. It doesn't seem to be in distress. Dr. Pradipta, can you get large IV bore cannula on the right ventricular fossa and draw bloods for basic labs biochemistry? And yeah, can I get the sugar of this patient, please? HGT?
HGT is 60.
Okay, HGT is 60, so patient is in hypoglycemia.
Placed an 18-gauge large bore
Yeah.
IV cannula.
Okay, so
Collected the blood.
you collected the blood sample. Can I give 25% dextrose 100 ml to be given this patient immediately? And can you please attach the ECG leads? I need to know the rhythm on the monitor.
25% dextrose have started bolus.
Okay. Can you attach the ECG electrodes, please? I need to see the rhythm on the monitor. Okay, the rhythm seems to be normal sinus rhythm. And the patient was in hypoglycemia when he came. We are giving 20% dextrose to the patient. Let's see if he's showing any improvement. Do we have any relative of the patient to know why any background regarding patient's diabetic history or any intake?
No, there's no relative. You have the patient there.
Okay. So can you talk to me, sir?
Yeah. Why are you hitting me?
Okay, the patient is going in Brady right now. Please keep the crash cart ready. Patient might go into arrest also. It's a Brady card, yeah. Okay. Yes, excuse me, sir. Can you talk to me?
Yes, yes, yes.
Okay, I can. Okay, patient is responding. I can get a pulse also, but there is Brady.
So I'm feeling very giddy.
Okay, he's feeling giddy. Can I load a atropine 1 mg? Patient is probably going into block.
So is it because I popped in some medications right now? I had a fight with my spouse.
Okay. What medications have you taken?
So I've been having some medications
Atropine 1 mg.
for my raised heart rate. It usually goes around 220 and then gets back. So I've been put on a medication.
Okay. Beta block for the heart rate, you have seen.
For the heart rate, yes.
Okay. So yes. But does the patient have any history of any irregular heart rate, atrial fibrillation or something?
Yes.
Okay. The patient probably might be a case of known atrial fibrillation, and they have taken some pills, and this heart rate is going on 38 is right now. Yeah, you have taken already. No? Okay, can I have the ABG? You have sent for ABG, right? Can I have the ABG?
Yeah, you'll get the ABG.
Okay, ABG is on the way. BP is maintained, saturation is maintained, but the heart rate is going on down.
Can we have the gas, please? What do you want in the gas?
Want to see if the patient pH and the bicarb and
pH
potassium.
is 7.38.
Okay, and
Bicarbs are 18.
potassium?
Potassium is 4.1.
Potassium is 4.1. What about the PCO2?
PCO2 is 32.
Okay, BG is more or less normal. So we need to think of the possible medications you would have taken. Yeah, you can repeat a dose of atropine, 1 mg bolus, you can give one more. 1 mg IV. Repeat it. Okay, now the patient is gone. Yeah, blood pressure has dropped. Sir, can you talk to me? Hello, sir. Hello, sir, can you talk to me? Can I feel a pulse?
Time's up. Time's up.
Time's
So, can you all brief me of what's happening?
So we had received a 40-year-old male who had complaint of giddiness.
Okay.
Okay, when he came, his airway was patent, BP was holding, heart rate was also fine. But then he went into Brady. Initially it was normal sinus. Yeah, SGT was low, it was 60. Then we gave him dextrose. Then he went into Brady. And then it seemed normal sinus, Brady, sinus Brady only. Then ABG was also normal. Then as per the history, he had taken some pills for his high heart rate.
Right. So, what could
Most
that
likely
be?
would have an overdose of
Overdose of?
beta blocker.
Right.
Yeah, so
So, you all know the antidote?
bicarbonate.
Sorry?
Beta blocker overdose.
Yeah, it's glucagon. And what if it doesn't settle down with glucagon? So we have to be ready for the refractory as well.
Refractory beta blocker overdose.
Okay, good to go.
Okay,
Thank you.
thank you.
Hello, mic testing.
Yeah, ready? Five people. We'll have to brief them.
Hello. Hello.
Hello.
둥글게 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 빙글빙글 돌아가며 춤을 춥시다 손뼉을 치면서 노래를 부르며 랄라랄라 즐겁게 춤추
Hello. Yeah. So,
Yeah.
like Squid Games, except one googly. Y'all are how many?
Mike?
5. So, only 4 are allowed in the first round. One can wait back. Okay. Who's the person? Right. So, you're getting a 58-year-old man. Mike. एक. 3. On है.
Hello.
There's a 58-year-old man who's come to your ED. He's had a history of fall in the washroom today. So he's had a forearm laceration, which has been sutured by a medical student. And he has a neck of femur fracture. So he's here in the ER. He's complaining of some giddiness.
Who is giving the handover?
The patient is here.
Your timer starts now.
Okay. So team, we have received a 58-year-old male who has fallen in the bathroom. I went to outside hospital and has forearm laceration, which has been sutured by outside medical student. So the patient is here. We will get on with our primary assessment. Dr. Praveen, you will be the primary assessor. Dr. Sifra, you will be on monitors and IV. Dr. Darshit, you will help out wherever needed. Okay. Please connect the monitors.
Sir, what is your name?
Neol Fernandez.
Okay. So, what is your age?
I'm 56.
Okay, airway is patent. So,
Okay.
I'm exposing him his chest. Okay. So, looking for the trachea. Is trachea central?
Trachea is centralized.
Okay. What about the chest movements?
Chest movements are equal.
Okay. So, I am
Switch on the monitors.
in the person.
Yeah.
Right upper quadrant.
What are you checking? Aerotory. Equal.
Left
Equal.
lower. Right lower.
Equal.
Left lower.
Equal.
Okay. Doing a quick percussion.
Yeah.
Right upper.
Normal.
Left upper.
Normal.
Right lower.
Normal.
Left lower.
Normal.
Okay. What about his RR?
RR is 16.
Okay. What about the saturation?
Saturation 99. Is he on room air?
Yeah, he's on room air.
Okay, I'm seeing any scars or bruises over the chest.
No scar or bruises.
Any equipment?
No equipment.
Okay. So going at breathing seems to be fine. Going at the
Airway is patent. Breathing is adequate. Saturation 99 on room air. Go ahead with circulation.
so checking for the pulse,
Pulse is equal.
both the pulses.
Yes.
Checking all for pulses.
Peripheral. Sorry.
Peripheral.
Warm.
Okay.
Peripheral pulse is present, all four.
Yes.
What about the BP?
It's
Pulse present.
coming.
So then
Go ahead with
I'm seeing
disability.
any external injuries that is actively bleeding. Looking at the head,
No external injury.
looking at the upper limbs.
You can see what you see.
Okay, there is a suture. It is actively oozing or something. I'm seeing.
No, it's suture.
So just doing the
Quick exposure.
exposure. Wait. I'm seeing any.
Close the curtains. Maintain the dignity of the patient.
Patient is seizing.
Please put on the left lateral position. Dr. Sifra, get Midas spray. Give intranasal Midas spray. We have a established IV.
IV is established.
Give Midas spray. Okay, give IV lorazepam 4 mg. We have a established IV. Start with the fluid bolus.
There's a transient seizure has stopped transiently.
Okay, I'm going at with the quick assessment again. So
We have given Midas spray.
Yeah.
okay, seizing has stopped.
Transiently.
Okay.
Okay, put back on the.
Putting back the patient, I'm checking for the airway. Then is the patient talking now? Sir, what is your name?
Postictal.
Please put NRBM 15 liters. Heart rate is 140. Start with a fluid bolus.
Okay. Checking for any secretions. There are any secretions?
No secretions.
Okay. So
Is the patient conscious?
Arousable.
Okay.
checking the again auscultating.
Air entry is equal.
Okay. So checking for the disability. So what is the eye opening? Sir, what is your name? He's opening.
He is. Voice.
P4.
Okay. And sir, can you
To
lift
voice,
your hand?
He's trying to lift.
Okay. So he's obeying commands.
M6.
What is he speaking?
Yeah.
Sir, what is your
He
name?
is speaking. So I can hear some numbness.
Okay. He's in a post-ictal state. Saturation still not improved. Put a NPA.
So checking the pupils.
Pupils bilateral equal.
Okay. So what about the temperature?
Temperature is 98.6.
What is the HGT?
HGT 76.
Okay. So HGT is 76. Okay.
Start with a 25% extras 100 ml
Okay.
bolus.
So head, any scars, any bruises?
No.
Upper chest,
No.
upper limb?
That is what you see.
Sutures.
Okay. So what about the lower limb? Any exposing?
Deformity.
You have femur neck. Yeah. So there's a deformity. Left femur neck of
Back
frac.
femur neck. Okay, feeling the peripheral pulse?
You have peripheral pulse.
Warm.
Okay. So I am seeing any hematoma here?
You see a dressing that is done.
Okay.
Opening the dressing.
Okay. Now,
You just see a needle prick.
so
Okay. Put the dressing back.
that's in that and
Time's up.
Put a thermos slip.
Can you brief me? What's happening?
Yeah. So we'll do the debriefing. So we had a 58-year-old man presented after a fall in bathroom, complaining of dizziness. So on arrival, his GCS was 15 on 15. His airway was patent. Breathing seemed fine. Saturations were normal. Blood pressure was around 156, slightly higher.
So is hemodynamically all right?
Yeah.
So
So
what
we had
next?
gone ahead with deformity. There was a left lower limb deformity, and the patient was complaining of dizziness. Post that, he had a seizure. So we had done seizure management.
What do you all
post-
think was happening?
Sorry.
What do you all think was the cause?
There, because there is a history of fall, there might be a internal bleeding. Sugars were also low, so it was not that low. So,
Was it low enough to be corrected or
No,
cause this?
it was not needed. But since the patient was altered, it is better to give
Can
the
you all
correction.
think of any other differentials for your
I
patient to seize?
SH, traumatic SH,
Okay. There was another complaint.
neck of internal bleeding.
So he complained of some perioral numbness.
So perioral, so can we also,
Any other differentials? That's giddiness, perioral numbness. Okay. Should I give it out?
so
No.
it can be like,
Okay. Time's up.
We didn't ask.
Just team 1 second for a photo. Best one. Mic check. 1, 2, 3. Can you hear me? Can you hear? Yeah. Clear. Thanks. ठीक है पूरा ही लेते हैं ना थोड़ा आगे ले लेते हैं थोड़ा आगे ले लेते हैं so that they have place. Yeah. Okay. Next team. Let's have applause for them. Why so sad? So welcome team. I'll quickly brief you. Okay. How many of you are there?
5.
There will be 4. Okay. We'll add 1 player as impact sub after some time. I'll let you know. You can choose which one wants to be the impact sub.
DNA.
Okay? Just have a seat. I'll call you. Okay. So I'm giving you a scenario. You have a 60-year-old male who's complaining of giddiness, nausea, and vomiting. Your timer starts. Yeah.
The patient is here.
Yeah, the patient is here.
Dr. Amlu, please take care of the airway. Assess the response first and take care of the airway.
And Dr. Amalu, I'm checking the response. Is the patient is responding?
Yeah, he's very giddy.
Okay. Is the patient is speaking in sentence?
Yes.
The airway seems to be patent for now. Dr. Amlu, assess the breathing and circulation as well.
Yes. No.
Please send CBC, LFT, RFT.
I can only hear one person at a time, so your request may not get registered.
Sure.
Yeah. Thanks.
Please complete the assessment.
Yes. RR, I'll put it on the screen. Okay, monitors are attached. Okay. Equal bilaterally. CRT is 2 seconds. Peripheral pulses felt well.
Blood pressure on both arms.
Yeah, you're attaching the monitors. You should have the monitors in some
Skin
time.
color.
Nothing obviously that you're seeing.
Okay. Let's assess the GCS of the patient. And Dr. Aditya, please send CBC, LFT, RFT, urine routine, urine tox screen, and a troponin as well.
Is the eye opening spontaneous?
Yes.
Is he able to follow my commands?
Yes.
Okay, and is there speaking in full sentence no any problem?
Completely.
Dr. Amlu, meanwhile, just let's get a 12 lead ECG for him.
Bilaterally?
Equally reacting, equally reacting.
Exposure, any obvious injuries.
Nothing obvious that you see.
Skin temperature.
Temperature is around 98 Fahrenheit.
Sugars we have checked, Dr. Aditya.
Sugars are 100.
Okay. Primary survey. So what we'll do is, Dr. Aditya, if any relative is available or he can tell you, just take the sample history.
Sure.
Dr. Akash perform the secondary survey for this patient. Dr. Amlu will need a 12 lead ECG. Okay?
She can speak. She is conscious enough.
Hi ma'am, Dr. Aditya. Can you tell me what happened exactly?
Just been feeling giddy and nausea and vomiting since some time.
How many days?
It's almost been 2 weeks.
Okay. Did you have any allergies to any medications?
Nothing obviously that I know of.
Okay. Any routine medications?
So, okay.
Yeah, I've been taking some tablet for my irregular heart rate. I think I've been taking it daily since almost a month now. Yeah, this is what, April?
Okay, patient
Yeah.
is going bradycardic, guys. Check for response, airway, pulse.
Yeah, I'm okay. Why are you asking me again?
Dr. Shivanshu, please get the defib.
Where's the impact sub? Where's the impact sub?
He's here already.
Yeah.
Get the defib, attach pads.
ECG is away.
Do we have a 12 lead ECG?
Yeah, you can see it on the monitor.
So BP is also falling, then we can start the fluid side.
So we'll just give a 100 ml bolus first.
Okay.
And keep bedside atropine ready. Dr.
100 ml
Aditya,
bolus
100 ml
given.
bolus given. Push 1 mg of atropine for this patient.
1 mg atropine given.
Meanwhile, Dr. Akash, can you get the list of medications? Any new drugs started?
Yeah, the patient is saying he's on digoxin.
Okay, guys, we could be looking at digoxin
No, it was
toxicity.
started 2 months back. I've been taking it regularly every day.
Any response to atropine 1 mg?
No,
Okay, do we have the labs?
not yet.
So it could be hyperkalemia induced bradycardia considering he's on digoxin. So we'll push a calcium gluconate, guys, 30 ml over 5 minutes.
I think resorptive toxicity, calcium gluconate is, we can avoid this. There is a chance of increased calcium.
Dr. Prasad, can I have the labs?
Calcium gluconate 10 ml.
Okay, calcium gluconate given.
Do we have the potassium with us? Meanwhile,
We'll do the secondary.
Potassium is around 7.5.
okay, calcium gluconate we have given. Start the GI drip, 10 units and 100 ml D25. We'll start that. Salbutamol nebs, 4 respules. We'll do that. We'll start that. We'll wait for the K-bind for now. And we'll send the digoxin levels too.
Okay.
Do we
Unfortunately, they are outsourced. You will not get the values.
Okay. 1.9.
Is there any DigiFab if you
Do we have DG
Yes,
Fab? Okay. Do we know the dose of digoxin the patient is on?
he is taking 0.25 microgram daily.
So one vial is 40 mg.
And when was the last dose taken? Any
Today,
idea?
before
Today
coming to
itself.
the hospital.
So we'll have to give the digibind.
Okay, time's up, time's up, time's up. So what do you feel is the problem here?
Digoxin toxicity.
And what would you want to kind of enumerate the etiopathogenesis? Why is it happening?
Possible
Okay, and how do you want to go about treating it?
digibind.
Okay, fine. Thank you.
And-
Yep, that's it. Thank you.
Thank you. Thank you. Okay, sorry.
We'll need to take a quick photo with the team.
उसका साइड का
Thank you.
तो ठीक है ना
손뼉을 치면서 노래를 부르며 랄라랄라 즐겁게 춤추자 링가링가링가링가링가링 링가링가링가링가링가링 손을 손을 잡고 모두 함께 즐겁게 뛰어봅시다 둥글게 둥글게 빙글빙글 돌아가며 춤을 춥시다
Good morning.
손뼉을 치면서 노래를
Good morning.
Hi, sir. Good morning.
So I'll be pre-briefing you, okay, about the rules. So how many of you are there right now?
5 of us?
5. So there's going to be 4. There's going to be one impact sub, which will come later on. You can decide who would be the impact sub. So who's sitting out for some time?
I think Franklin.
Okay, just have a seat. Okay, giving you a scenario. You have a 40-year-old male brought by his parents complaining of drowsiness.
Okay.
Your patient is here already. Yeah, and your timer starts.
Okay. Good morning, team. I'm Dr. Nikita. I'll be the team leader for the day. Dr. Vishal, you will be taking care of the airway. Dr. Shiksha, you'll be taking care of the breathing and disability. Dr. Rizvi, you'll be taking care of the circulation and exposure. Let's quickly take the patient on a high acuity bed and start with the primary survey, starting from the airway.
Is my patient talking percentages?
Yeah, pretty drowsy, just answering in single words.
Okay, any gurgling secretions that?
Nope.
Okay, fine. Let's give a head till chin lift position. Put the patient on a NRBM 15 liters of O2 and connect on monitor. Chest lead, keep the defibrillator standby. Keep an airway trolley standby. Moving ahead with the breathing, Dr. Shiksha.
Yes. Yeah, it's coming up on the monitor.
Okay. Meanwhile, we're still waiting for that.
So saturation is around 98%. You've started on Hycon.
Yes.
And the RR is around 12.
Okay. Moving ahead with the circulation.
What is the capillary refill time of my patient?
3 seconds.
What is the heart rate on the monitor?
Heart rate on the monitor is around 70.
What does the rhythm look like on the monitor?
Sinus.
What is the blood pressure on both arms?
Blood pressure is 110 by 18 both arms.
Alright. Can I request for 2 peripheral angiocaths, preferably 18 gauge? I want you to draw all blood samples, CBC or CMP. I want a blood gas with lactate. Can I also call for a portable chest X-ray, a sonocyte machine, and a 12-lead ECG?
Okay.
Okay.
So that's going to take another 5 minutes for everything to be executed.
And the heart rate has come to 45 right now.
No, it's getting readjusted. Give it some time. It's
Okay.
70 right
Moving
now.
ahead with the disability meanwhile.
Yeah, only to painful stimulus.
Verbally, the patient confused, talking,
Answering in monosyllable words.
and localizing pain.
Yes.
Pupil reacting to light.
Bilaterally equally reacting.
Okay. What is the sugar of the patient? Sugar.
100.
Okay. Temperature.
98 Fahrenheit.
Patient in pain.
No.
Okay, fine. Quickly exposing the patient. What do we see?
What?
The patient, do we see anything significant?
What are you looking for?
Are you looking for any open wounds, lacerations,
No.
bruises?
Any pedal edema, any rashes around the body?
No.
Okay, fine. So let's connect the patient on a liter of fluid, and we will move ahead with the secondary survey. Before that, I want a history
Your
of
impact
present
sub
illness.
is here.
Yeah, okay. Franklin, you'll be administering drugs in this case now. So I need a history of present illness for my patient.
Premorbidly healthy.
Okay.
Right now, was found in the bathroom, and the parents had to bring him to the hospital because he was not responding.
He was not responding.
Yeah.
So he was lying on the floor flat.
Yes.
Any vomited surrounded?
Nothing
Was
obvious.
was he conscious?
No, he was drowsy. That's why the parents got him here.
Okay. Any medicines which were lying around? Any empty packets that we have seen?
Nothing in the bathroom.
Okay. Do we know any kind of medicine that he's on?
He is pre-morbidly healthy, not on any medication.
Any social history that we should be knowing of?
Nothing obvious.
Okay, fine. Okay, any event prior while the patient was in transit to the hospital?
He went to the bathroom for 1 hour. He wasn't coming out. That's why the parents broke the door and got him here.
Okay, fine. So we very much could be dealing with seizure. We are not aware of it yet. Okay, the only history that we have is the patient was lying flat on the ground and he was altered. Okay, so no, that's not required, Dr. Vishal, right now. So let's just reassess the primary survey. I just need, is the airway patent, Dr. Vishal, right now?
Is my patient talking?
No.
Okay, any gurgling secretions?
Yes.
Okay, the pooling out of secretions happening, connect the young cover, do a gentle oral suction, and after that, keep the airway open. After suctioning, has the airway got patent again?
Yes, but still there is pooling of secretions happening.
Okay, and what is the saturation at this point?
Yep, it is around 94.
Okay, fine. So we will be doing gentle oral suctions.
Dr.
Okay.
Prasad, can I have the labs? Next, please.
Sodium, potassium chloride. 7.2, lactate of 5. Okay. Carboxy, HP is 25%, methemoglobin, fine. Okay. So the lactates are on a higher side. Okay. Let's do one thing. We have 218 gauge peripheral lines, Dr. Rizvi. Let's load the patient with levetiracetam right now. This could be an anti-epileptic. We have to load him. This could be a seizure episode that he must have had in the washroom. Okay. So we are running in with 1 liter of fluid. We'll also have to have a urine for tox. We don't know what exactly has happened. We'll have to
Time's
get
up.
Okay.
Time's up. So what do you feel was wrong with the patient?
The patient was altered, so of course, toxidrome is one of the things. He must have had a seizure episode we are not aware of. So
Okay.
either one that we were dealing with.
Okay.
Yeah.
And okay. And how would you want to treat this at this point of time?
So if we go according to this, then for the toxidrome, the pupils and everything were fine. He was vitally okay. His ABG looked fairly fine. So
Okay.
anti-epileptic. So we were thinking about seizure over toxidrome, and we already loaded him with fluids and anti-epileptics for the same. His
Okay.
airway was maintained, so we did not have to intervene much. Only the pooling of secretion, but he was having his gag was present, and his saturations he was maintaining.
Okay.
The rest, his ECG and everything looked fine to me.
Okay. Fine. Thank you.
Thank you so much.
Yep. We'll break for 10 minutes. Thank you. We'll break for 5 minutes. Yeah. ब्रीदर रखा है क्लास टीम को नहीं ना हाँ जेंट्स का लेफ्ट साइड पे
स्क्रीन के बाद लेफ्ट
क्या हुआ नहीं 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 मिला
Test. Mic check. Mic check. मैं यहीं खड़ी रहूँ.
둥글게 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 빙글빙글 돌아가며 춤을 춥시다 손뼉을 치면서 노래를 부르며 랄라랄라 즐겁게 춤추자.
Good morning, team. So, we planned for one googlier. There's one impact player. Who's the impact player? Waits back. The first four go for the first find. Who's sitting back? You all can decide. Please wait back. Okay. So team, there's the 40-year-old man who's coming to you with complaints of giddiness. You have 5 seconds.
Okay, so good morning team, I'm Dr. Shifana. We're expecting a 40-year-old man who's coming with breathlessness. So Roshni, please be at the airway end and assess the
Patient is here.
giddiness. Okay, we have everything ready. Assess the response.
Monitors attached.
Excuse me, hello? Hello, is there a response?
Is the
Yeah,
patient
he's talking to you.
okay?
Yeah.
Fine.
Are there any oral secretions?
No oral secretions.
Please assess the breathing, Vivek.
Trachea centralized.
Monitors.
Sorry, I can hear only 1%.
Is there any engorged veins in the neck?
No.
Chest rise is good.
Chest rise is good.
May I see the monitors, saturation, BP?
Yeah, coming up. Air entry bilateral equal. No added sounds.
Okay, and BP and rhythm.
BP is coming up.
How is the peripheral pulses?
Good.
Capillary refill time?
Less than 2. Blood sugar 60.
Do we have a relative available now to get a brief history?
You have the patient who's talking to you.
Yeah, take an IV cannula. Vivek, mean.
IV cannula taken.
ठीक है, so what are you
IV
feeling
cannula
exactly?
taken.
Huh?
IV cannula is taken.
What are you feeling exactly right now?
I feel a bit giddy.
Okay, so BSL was 60. 60. You give a D25 100 bolus. And any chest pain or anything you
25
have?
given.
Any chest pain or anything?
No chest pain.
You feel breathless?
Not really.
Okay. May I see the rhythm?
Rhythm is coming up.
Okay. We'll get a 12 lead ECG also if it's available.
Have a 12 lead ECG coming up. It's taking some time.
Okay. Meanwhile, we'll get a. A patient is sick, giving the history.
Was there any headache?
No headache.
No, any vomiting?
No vomiting.
Any fever, cough, history?
No fever.
Any focal neurological deficit?
What are you looking
Difficult
for?
to move any of the limbs?
No.
Any gait ataxia?
No.
Any previous comorbidities?
The heart rate rises around 220 and then it comes back. So I was put on a medication.
What does he take?
So the history is yet to come. He doesn't know the name of the medication.
Okay. And so you took, while you took IV, please send for all the samples.
Impact clear.
Blood.
Impact clear. Go in.
Patient is very giddy.
But rhythm is, patient is going braddy. Is the patient still talking to us?
Drowsy.
Do we have a,
Any drug history? Patient is on any beta blockers?
Yes, he is. So
This might be secondary to drug
Yes.
toxicity that he might be having bradycardia?
Okay,
You can
please
go
get
ahead.
ready with the atropine dose. If we have to give it, if it's going down and he's going unstable, please get ready with
So
it.
I've taken some medications that I had, around 10 of them today.
Please, lavage. Please do a lavage for the patient. Around what time did he take? Do we know?
45 minutes prior to arrival.
Okay. So we'll do an orogastric lavage for the patient.
Nitin, can I have a rice tube, please?
RT taken.
Inserting the RT.
Lavage given.
NS.
Start with a slow fluid also. The patient his BP is coming down.
IV fluid started.
IV fluid started.
Gastric lavage done.
Gastric lavage done.
It's not a block.
Is the rate improving?
Atropine nahi diya. We'll give atropine when
Rate
the heart rate
is
is
not
down.
improving.
Heart rate is 78.
Restarted.
Heart rate is 78. We'll
Sorry,
send
sorry,
his
sorry,
toxicologist.
it's recordings.
Okay, his heart rate is now below 40. Please give one dose of atropine.
Atropine given. Injection.
Do we have the pulse?
Injection atropine given.
We have
You
the
have
pulse.
a pulse, yes.
Yeah. We have given injection atropine. One dose. Have you given? Yes.
The
Please
heart
be
rate
ready
is-
with the pacing paddles also meanwhile.
Get a consent also.
I'll take the consent to the relatives.
Yeah, we be ready with it. We are not going to do it right now. We'll
The patient is having slow heart rate. Secondly, maybe due to the excess of drug intake, he might be able to drugs, but he might need a pacing.
glucose देना है.
You have the
It
consent.
can be a beta blocker overdose.
Recheck vitals. Blood sugars, it's 70.
I suppose it's a beta blocker, yeah, CCB overdose. It possibly can be. So meanwhile, we'll be ready with the calcium gluconate and glucagon. Yeah, we'll be get ready with that as well.
Yes, calcium gluconate.
Calcium gluconate given.
Do you have a VBG available? Like
Yes.
any blood gas? Can
Can
we
we
see?
have the VBG? Time's up.
Thank you.
Can you tell the diagnosis?
PSVT, for which she was taking some beta.
Some beta blocker overdose, yes.
What could be the drug of choice?
You're asking the toxicity.
Glucagon,
antidote.
how much
Yeah, glucagon.
dose?
Yeah, she's asking what is you doing in the overdose. Glucagon.
Okay, don't fight among
Fine.
each other. It's
Good,
not the
good.
final. It's first round.
Done, done.
Thank you.
Thank you. Stand for a group photo.
दुकान डालो बाहर स्टैंड लगा मैं बताता हूँ तब भेजना रेडी रखना सिर्फ इंदुजा रेडी रेडी
Good morning. Yeah. One impact player stays out for the round.
One.
One out of the 5 stays out for the round. So y'all can choose one person who sits back.
Huh? Stay one.
Yeah.
Okay.
Impacts up. Yeah. So y'all have a 58-year-old man who's in your ER, who's had a history of fall today, and there is a forearm laceration which is being sutured by a medical student, and he has a neck of femur fracture as well. So the patient is here. He's complaining of some giddiness.
Okay. Team, take your positions. We have a 58-year-old man who has laceration in his upper arm and it's a trauma to the leg. So, hi sir, I am Dr. Deepak. How are you?
I feel a little giddy.
Okay. Dr. Yash, please proceed the primary survey.
Okay. Hello, I'm Dr. Yes. I will be assessing you. May I know your name?
I am Miss Neo.
Okay. Patient is able to speak sentence.
Dr. Kevin, please attach the monitors.
Can you open the mouth for me?
Yeah, opening.
Am I seeing any obstruction, any foreign body?
No foreign body, no obstruction.
Am I hearing any abnormal sounds like stridor, grunting?
No abnormal sounds.
Monitor attached. Okay. Dr. Kevin, will you attach the C-collar?
C-collar attached.
Before C-collar, I want to see any injuries over the neck. I'm examining.
No injuries over the neck.
Okay. With patient's consent and maintaining patient's privacy, I'm exposing the chest to see the breathing part.
Breathing is equal.
Okay. Am I seeing bilateral symmetrical
Kevin,
chest
please
rise?
step in.
Yes, you are.
Okay. I'm doing percussion.
Normal.
How's the percussion sound?
Normal.
Normal. Okay. I'm checking the all 6 regions for air entry. Right upper, left upper.
Equal.
Right middle, left middle.
Equal.
I'm checking all 4 pulses.
Pulses are equal.
Okay. Capillary refill time.
Less than 2 seconds.
Okay. Checking for the BSL blood sugar levels.
Dr. Kevin, at this time, we
70.
can insert a large bore
Okay.
IV
Checking the
cannula.
pupillary reflex bilaterally.
Equal.
Okay.
Preferably 16 to 18 gauge.
So for exposure, I'm again exposing.
16 gauge large IV bone.
IV bore taken. Taken.
Okay, I'm checking exposure. I'm checking the rectal thermal temperature.
98.6.
Okay. Am I seeing any wound bleeding?
That is what you see.
Is the blood coming out of the wound?
There's no wound where you're touching.
So there is wound, they sutured here.
Okay.
And you see a dressing on the left side.
Okay, is the blood
The
oozing
neck
from
of
the
femur.
wound?
No.
Okay. So Dr. Deepak, will you think of stabilizing it with?
Yes, we will stabilize. We have a femur fracture. Yeah, we will stabilize it with the Thomas
The
plane.
patient
Dr.
has
Kevin.
started to seize.
Yeah.
Keep
Dr.
putting
Kevin.
the patient on left lateral position with manually like stabilization.
Dr. Avinash, left lateral position. Suction, please.
Suction done.
Yes, please proceed. Please suction the tube. Suction. Dr. Kevin, you can give 4 mg lorazepam to the patient.
Lorazepam given.
Injection lorazepam 4 mg IV given.
The suction's done. Is there any gurgling secretions?
No.
No.
Patient is still seizing.
It stopped.
Okay. Reposition the patient, please. With manual inline stabilization, reposition the patient, please.
On count of 3, reposition the patient. 3, 2, 1. Okay, reassessing the primary survey again. Checking for the any secretions.
No secretions.
Okay, any sounds like stridor?
No,
grunting?
no striders.
Dr. Kevin, at this time, you can put one more IV.
Equal.
Give samples for ABG, CBC, blood group type and screen,
Dr. Deepak,
and
saturation
ABG.
is falling.
Okay. Please take care of the airway. Dr. Avinash.
Yeah, he's making some sounds.
Okay. Reassess the GCS, please.
Large IV bone and insert
Hello?
on the left.
Why there's some numbness over my mouth?
So the patient.
For all
Okay. The patient is having some. Yes. The patient is having some perioral numbness, and he has been sutured. So this will be local anesthetic systemic toxicity. That's why he had a seizure also. So at this time, we will plan for an intralipid. Okay, first take care of the airway. He is maintaining airway. Check. Is there any gurgling sounds? Any tongue fall black? Is there anything like that?
No.
No. You can put an NPA right away right now and start with 50 liters of oxygen for now. Dr. Kevin, you can administer 100 ml of intralipid IV bolus.
Can you tell me the dose?
Yes, Dr. Sunila, you can apply the Thomas Splint observation. You can start with IV fluids also because the patient is a trauma patient. You can start with the renal lactate, 500 ml please. The weight, this is BP.
Sorry. It's
Patient
140.
started on IV Ringalati 500 ml IV bolus.
Okay, we'll proceed with inline stabilization of the Thomas Splint. Please proceed.
Yes, Dr. Sunila.
Time's up. So you all were right. It was
Local anesthesia toxicity. So drug of choice, like you all said, lipid emulsion. Right. Is there anything else? Apart from lipid emulsion? Is it available everywhere? That's the question. Right, time up.
Yeah.
We'll discuss later.
Yes. Come. Come here.
हाँ नहीं सिर्फ केस के टाइम Good morning, team. How are you doing?
Fine, sir.
How was the wait? Do you know what's the case? Good. So, how many of you? 5. So let's make it 4. One as an impact sub who joins us later. Who's the scapegoat? Okay, just have a seat. We'll call you in some time. Giving you a scenario, you have a 60-year-old male who's complaining of giddiness, nausea, and vomiting, brought to the emergency department. All yours.
Okay.
The timer starts.
How are you?
Yeah, I'm fine. Just having some giddiness and nausea, vomiting. I don't know why.
I'm Dr. Raghu. You're attending today. So when is the symptoms have started?
I think I had some symptoms on and off since 2 to 3 weeks.
Just connected the monitors.
Okay.
And the airway is patent right now. He's talking.
Yes.
Okay. Monitor connected. What are the vitals?
Yeah, wait. They are being displayed.
By the meantime, you have you start the wide bore put the wide bore intracat, take the venous blood gas and take all the routine samples.
So 2 large bore wide cannulas inserted.
Okay.
Blood gas is sent.
So the heart rate is 70 and BP is 130 by 80. Saturation 98 on room air.
Okay. Blood, vitally he's stable, so I'll go for breathing part. So did I find any obvious deformities over the chest area?
No.
Any neck swelling?
No.
Any deviation of trachea?
No.
Okay. Inspection, any other findings?
What are you looking for?
Any chest rise?
Equal, bilaterally.
Okay. Palpation, do I feel any tenderness?
No.
Okay. Any obvious deformities?
No.
In percussion, did I feel any?
Yes, in percussion, no. Normal, resonant note.
We want a 12 lead ECG in this.
Yeah, it is showing the same rhythm what you're seeing on the monitor.
Okay, it's a flutter kind of thing. Okay. By the meantime, you get a sample history.
No, he's conscious enough to tell things by himself.
So, do you feel any chest pain?
No chest pain. It's just giddiness and vomiting.
Giddiness and vomiting. Okay. So, blood sugar levels?
100.
GCS is 15 pupils or reactive?
Yes.
Okay.
So the airway is patent, the breathing seems to be
Normal.
fine, circulation also widely stable, capillary refill and
2 seconds.
okay, so there's no circulation problems. So when disability is conscious oriented, we get a blood sugar level.
100.
Anything on the blood gas?
You have sent a blood gas. Report is not coming up.
Okay. So we open up the monitor. I think maybe we can get a point of care. Do we have a point of care?
It's not functioning right now. It's going to take 10 minutes for it to switch back. Impacts up. All in.
Heart rate is 30 right now. Okay.
Okay, and can we have a
Repeat.
Yes, it's refreshing. It's complaining of severe giddiness. It's about to throw up.
Okay, we'll put on oxygen right now. Yeah.
Fine. So let's get the
Crash.
and keep it ready.
We'll take the cardiologist team and we'll keep the difficult electronic and crash cart ready.
Yeah. And
Cardiologists are busy in our angio. They'll be free after 30 minutes.
So we will go for atropine.
Yeah, we'll start with atropine 0.6 micrograms, 1 ml IV stand.
Okay, 0.6 mg, 1 ml atropine given. Yeah, he's alert. He's
Do
completely.
you have any history of blood pressure?
I don't have blood pressure history, but my heart rate is some irregular.
Irregular.
Yeah, so I've been given some tablet which I take regularly every day for 2 months.
He's in hypotension right now, so start IV fluids.
Okay, so we have given 1 mg of atropine has been given.
Yes.
Okay, patient is connected to chest lead also connected.
Yes. Your venous blood gas is coming up, what you had asked for.
Is there after the atropine, is there
Any change in the heart rate?
No change, same vitals.
So look like an
Yeah, it is.
it is an interfibrillation. So we'll go for it's bradycardia and hypotension. We'll go for synchronized cardioversion in this patient.
Okay.
So I'll attach leads.
I need to be.
Okay, you have repeated second atropine.
It is invalid the prayer and
Focus we have done.
do we have a
Focus, the machine hasn't come yet.
Okay.
Alright, so LTC patient is still talking.
Yeah, patient is still complaining, lot of giddiness. Can you do something about it? Okay, time's up, time's up, time's up. What do you feel? What's wrong with the patient? Unstable brady because okay, okay, fine, that's good. Thank you. Ravish.
Yes, yes.
So let's reduce your butterflies. We are going to reduce from 5 to 4. So sitting out for some time. Impact players are important players.
Okay, fine. Aman will be sitting outside for some time.
Given your scenario, you have a 40-year-old male brought by. So you have a 40-year-old male who is being brought by his parents, found unconscious in the bathroom. The patient is here, all yours.
Okay.
Let's start the timer.
Okay, is he responding right now?
In single words, yes.
Okay. Fine. I would like to connect the monitors for the patient right now. So
Okay.
I'm connecting the chest leads. I'll ask Harman to connect the chest leads.
Okay.
I'll also ask him to connect the BP cuff and the saturation probe.
Okay.
Okay. Can I have the vitals, please, right now?
Yeah, it's been connected. Give it a time. Yeah. So you will see the vitals coming up, BP as well as the respiratory rate.
Okay. Pulse is 78, BP 130, 78. Saturation is 98% and respiratory rate of?
14, 1-4.
Acha, okay, fine. ठीक है. Since the vitals are within normal range, I would like to go ahead with the breathing part. I'd like to just auscultate the patient once.
Present, present and equal, present, present and equal.
Okay, fine. Since the this is fine, I would just ask one of my juniors, Dr. Saloni, to go and ask the history once as to what is the correct history of, is there any history of consumption or no?
The parents deny consumption, nothing that they are aware of.
Okay, I would like to secure a cannula and send for blood samples. I would like to send a CBC. I would like to send for an ABG. I would also like to get a tox screen done for this
So
patient.
cannula done, toxic, screen sent, blood
Okay. And
sent.
also I would-
Reports will take a minute at
Okay,
least.
I would also like to get an RBS done for the patient.
Sugars are 100.
Okay, fine. Okay. I would like to start with the IV fluids right now. I
Okay.
would start at maintenance dose of maybe 60 cc per hour for the time
Started.
being. Okay, is there any change in the patient's sensorium or
Still
response?
answering in 1 or 2 words.
Okay, can I know the GCS of the patient, please?
Okay, what are you checking for?
Okay, so the eye response?
Painful.
Okay, on painful, he's opening the eye. Okay, verbal response?
Some disorientation.
Okay, and response of
Localizing.
localizing to pain?
Yes.
Okay, fine. ठीक है. Um,
Impact sub. Impact sub.
Okay, ठीक है. So currently, so is there any other change in the patient's
You need to check on the monitors.
ठीक है. Okay, the saturation is dropping. I would like to. Okay, I would like to start the patient on O2 first. Can I have Rishi, can you start the patient on oxygen via simple face mask?
Started.
Okay. The patient is also having a heart rate of 50. I would like Saloni to just load an atropine and keep for the time being. Okay. Is the saturation improving post the oxygenation?
Nope.
Okay. I would like to shift the patient on NRM at this point of time.
Okay.
Rishi, can you connect the patient? Okay, fine. Okay. Okay, the saturation is improving now. Okay, can I have the ABG report?
It's
still?
going to take 30 seconds
Okay.
and the blood gas report should be up.
Okay, ठीक है. Huh? 50. Can I get an ECG? This is only the ECG,
This
right?
is the
Okay,
ECG.
fine,
This
ठीक
is
है.
the rhythm that you're seeing on the 12 lead. That's the blood gas.
Okay,
We
so
could
there is-
manage only a VBG.
Okay, so there's a pH of so there's acidosis with a high lactate, bicarbonate hemoglobin, carbon monoxide. No, but saturation will not drop. Yeah, this is carbon monoxide. Looks like a carbon monoxide poisoning.
Okay.
Please click on the units. Can I get a little more detailed history of whether?
Yeah, what do you want to know?
Whether was there any fire in the house? If there is
No
any
fire in
closed,
the house.
was he in the closed car for some time? Anything
He
like
was
that?
found, he went to washroom around 1 hour back, wasn't responding. That's why the parents had to break the door.
Okay, so is the geyser had any problem in the house?
They have a geyser, yes.
Okay, so there's most likely that the patient is suffering from a carbon monoxide poisoning. I would
Okay.
start the patient on high flow O2.
Patient is seizing.
Okay, fine. I would like to give a left lateral position. Could you please give a left lateral position to the patient? And could you please load lorazepam 2 mg, please? And okay, can you please give the lorazepam 2 mg?
Given.
Okay. Is there any? Has the seizure stopped or still?
Yeah, the frequency is reducing.
Okay, fine. Can we please put the patient back down? Is still seizing?
No, it's
Okay, fine.
reduced.
I would just give a prop up to the patient at this point of time.
Okay, given.
And start suctioning also, just oral and nasal suctioning to be done.
Okay, done.
Okay.
Okay, that's it. Time's up. Thank you. So, what was the problem?
Patient was having a carbon monoxide poisoning.
Okay.
So he had a hypoxic episode also. So we gave the resuscitation. All the other parameters were within normal limits.
And what was the etiology of hypoxia?
Sorry, I didn't get your
The
question.
etiology of hypoxia.
Because of the hemoglobin that because of the carbon monoxide, hemoglobin's inability to give the oxygen
Okay,
to the
fine. Thank you.
Thank you so much.
Let's have a photo. Ravish. सांगितलं ना और क्या बोलना है और क्या बोलना है ये ऑक्सीजन है और क्या
all. We have a impact player. Do you all have impact player? He needs to sit out. He or she needs to sit out for the first
Check.
round.
Sorry.
One player out of the 5 needs to sit out
Okay.
for the first half.
Okay. ठीक है. Okay. Ravindra will be our impact player here.
Right. So you have a 40-year-old man who's coming to you with history of giddiness. Okay. He's complaining of giddiness. You have 5 seconds.
5 seconds for?
The patient to arrive.
Okay. So team, we have this 48-year-old man coming. He's going to come with some history of giddiness. I hope all of you are ACLS and ATLS
Patient
trained.
is here.
Sanket on airway, Simonthini, can you assess the breathing? And Aishwarya with IV and vitals. Can you also get the defib? Hi sir, how are you feeling right now?
I feel a bit giddy.
Okay. Are you diabetic, hypertensive?
I use some heart rate goes up, so I use some medications.
Okay. Aishwarya, can you attach the monitors for me and also get me the vitals? Sir, since when are you feeling giddy?
Since the last 45 minutes.
Okay. So airway is patent, patient talking, monitors attached? Monitors attached. How is the breathing?
Breathing, what do you want in breathing?
How is the trachea? How is the air entry? Are there
Trachea is
any added
central.
sounds?
No added sounds.
No added sounds. How is the air entry?
Air entry equal.
The monitor is attached, right?
Yeah.
Okay. And how are the heart sounds? How is the JB?
Normal.
Okay, so the saturation is 98%, blood pressure 130/80, heart rate is 130. Do we have a
Sorry.
pulse?
The heart rate is 76.
76. Okay, heart rate is 76. Okay. So the patient is diabetic, hypertensive?
Not diabetic, not
hypertensive. Is he? Sorry? Yeah. So, Dr. Aishwarya, can you establish an IV cannula for me? Meanwhile, Dr. Simonthini, can you get me a 12-lead ECG? Okay, and can you send some troponin eye test? Can we get a blood test, ABG with lactate, serum electrolyte levels?
It will take a while.
Yeah. Do we have any more history other than just giddiness? Like
He's
his
been
relevant
giddy
past
since
history?
the last 45 minutes.
He's just feeling it since.
Yeah.
What was he doing while feeling giddy? Like, what was he doing?
So he's had a fight with his spouse.
Okay.
And he's consumed a strip of medications that he has.
Okay. So probably some toxicity that we can think of. Do we have the sugars? Can we just check his?
Sugars are 60.
Okay. What about his pupils? Can we just see his pupils?
Pupils are bilaterally equal.
Bilaterally equal reactive. Do we have a relative with him who can give us some medication
Patient is
history?
talking to you.
Okay. Sir, what happened to you? What did you take? Did you take any medicines?
So I just took a strip of medications that I had.
Okay. Is the IV in place? Yeah. Can we check the pulse? Is there a pulse?
Yeah, you have a pulse.
Pulse is there. Okay. So, yeah. How is the blood pressure?
It's loading.
Okay. Let's attach the defib. Defib is attached. Okay. Blood pressure is dropping. So we'll go forward and give atropine. Dr. Aishwarya, can you load
Atropine
1
given.
mg, 1 mg atropine? Given, followed by flush. Sir, how are you feeling?
Very giddy.
Okay, so the saturation is also dropping. Dr. Sanket, can you attach oxygen by mask? BP is 80/50. Dr. Aishwarya, can you start IV fluids? Can we get a point of care ultrasound?
The ultrasound machine is not in the department.
Is the ABG available? And troponin, is it available?
We have a VBG.
Okay, can we get the VBG?
Can we have the VBG, please?
pH is 7.3, PCO2, lactate. Okay. Serum electrolyte. Okay. So heart rate is dropping again. We'll go forward and give. Has it been how much time since the first atropine was given?
It's been 3 minutes.
3 minutes. Is the patient responsive? Is the patient still with us, doctor?
Very
Okay.
drowsy.
Very drowsy. We'll go forward and give another shot of atropine, 1 mg.
Another
Meanwhile,
shot of atropine given.
okay. We'll also plan for transcutaneous spacing. And yeah, Dr. Aishwarya, can you attach the transcutaneous pads? And I would like to speak to any relative and just talk about the patient's
You have just
contention.
the patient.
Okay. Sir, your heart rate.
Time's up.
Okay. Thank you.
What do you all think? What do you all think was it?
Sinus. He had taken some medication. History is there. He was going into bradycardia.
Right. So they was taking some medicines that I said for something.
Beta blocker, yeah. So we should have
We'll
thought of-
discuss later.
Okay. Yeah. Behind or?
यहाँ पे आ जाओ. Tired?
No.
Great.
I'll just stand away.
There's a twist to the first round. One of the 5 members sits out for the first half of the simulation.
Okay. Dr. Hari, you can join after half an hour.
So you're going to be the impact sub. You can have a seat there. Team, you'll have a patient in the ER. He's a 58-year-old male who's had a history of fall. And he has a laceration over to the forearm. So a medical student has sutured it. And he has a neck of femur fracture. So he's here with complaints of giddiness.
Okay.
Good morning, team. I'm Dr. Sonali. I'll be the team leader. Dr. Harish, take care of the airway and breathing. Dr. Meenu, take care of the circulation and disability and exposure to. And Dr. Siddharth, obtain IV access or a IO access and give the medications as required. So we have a 58-year-old male who's coming with neck of femur fracture
already here.
laceration. He's already here. Please take the response, Dr. Harish. Meanwhile, Dr. Meenu, attach the monitors. And
feel giddy.
Dr. Siddharth, take 2 wide bore IV cannulations.
Full sentences. Is there any frothing or any grunting?
No frothing.
So airway is taken. I think so. How is the breathing? How is the chest rise?
Chest rise is equal.
What is the respiratory rate of the patient?
Have the monitors been attached?
Sorry.
It's coming up on the monitor.
Alright. Go ahead with the breathing.
IV cannula secured.
Go ahead with the breathing.
So, is there any auscultated findings? Any difference in the?
So the saturation is 76. I think Dr. Harish, please attach 50 liters NRBM, and Dr. Siddharth run 1 liter of RL IV. And is there any? Yes, go ahead with the.
You see what you see.
Let's expose the patient fully. Let's expose the patient fully. Okay, there's nothing. Okay, let's go ahead with the breathing.
To the proximal part of the femur, you have a dressing done.
Dr. Harish, are you done with the breathing part? Is the chest clear?
Chest is clear.
Is the chest rise equal?
Chest rise is equal.
Chest rise is equal. Okay, we have a laceration, any open wound over there? No, over the chest.
No.
Okay. Any tracheal deviation or any distended neck veins?
No.
Okay. Dr. Meenu, please go ahead with the circulation. Check for the CRT.
Less than 2 seconds.
Can we? Is all the 4 peripheral pulses felt?
Equal.
Felt. Okay. All right. Is there any hemorrhage out coming from the laceration?
No.
Okay. We should stabilize the neck of femur. Let's apply a splint over there. Okay. Do we have a splint over there? Okay. Let's apply a splint over there. And Dr. Meenu, go ahead with the disability. Okay. Put the splint over here.
Spontaneous.
Is responding to you.
The pupils.
Bilateral equal.
Cheating.
The patient has started seizing.
Okay, let's put in the left lateral position, and we have a IV access intact. Let's give 4 mg of midazolam. Okay. Suctioning. Yes. What is the saturation? It's 96. Okay. Okay.
Midazolam given.
Okay. Maintaining the BP right now. All right. So
BP is coming up.
okay. We should apply a pelvic binder too. We don't know the mechanism of injury, and let's order some blood also. Okay.
Seizure has stopped.
Okay. Let's put back in the recovery position. How is the GCS right now?
Postictal.
Postictal. Okay. Let's put a NPA for the breathing part. Yes. Okay. And what about the laceration over the hand? Is it bleeding? No, right?
No bleed.
No bleed. Okay. All right. Let's go ahead with the disability. Are we done with the disability? Pupils equal? Yes. Okay. Any wound over the head? Any raccoon eye or battle sign we can see?
No.
Okay. Go ahead with the exposure. Exposure only neck of femur and a laceration. Any other wounds? Any bleeding over there?
No.
Should we go ahead with the log roll too? Yeah, we should do a log roll. Please do the log roll and check for the spine and go for a PR examination also.
Patient is making some sounds.
Okay.
No tenderness.
Okay. What sounds? Can you just
No
auscultate?
tenderness. No tenderness. No.
Okay. PR, anal to normal?
Numb.
Okay. What sounds is the patient making? Please auscultate the patient.
I feel some numbness.
Okay. The patient is having slurring of speech. Could be postictal too. Is the chest clear
Some
still?
numbness.
Sorry?
That's on the equal.
Okay. I think we should go ahead with reassessment of the primary survey again. So just check for the airway once again.
Airway is airway patent.
You just saying says perioral numbness.
Perioral numbness. Okay. All right.
Is there any deviation of the face or anything?
No.
You should send some blood test, hold some blood test for the labs and send electrolytes, blood gas. The patient's heart rate is going to 45.
That's
so
wrong. It's 76.
Okay. Okay, it's 76. All right.
Breathing, respiratory rate and chest rise is equal?
Yes.
Is the patient moving all the 4 limbs now? Able to move?
Left is not.
Right tricep because of the neck of the femur. Okay. All right. We have applied this splint. Disability done.
Time's
BP
up.
is fine.
Time's up.
So where were we?
Sorry?
Where were we? What was the history?
It was giddiness. Giddiness and fall, neck of femur.
And?
Laceration with the wound.
Okay. Okay. So there was seizure and there was perioral numbness. Any clue?
Hyperpicality.
Okay, we'll talk about it.
Okay. You stand.
निकाल देना वो थॉमस. Round one. Can the teams be seated? Sanket, just be seated now. Let's not stand. I think you should give a louder applause. It's a big challenge to sit for 10 teams to perform and then... Are you awake? Are you okay? Sorry, I'm checking your GCS first. Okay. So 5 of you. Who wants to be Rohit Sharma today?
The TL.
Impact sub. Who's sitting out?
TL.
So only 4 players will start and the impact sub will join them after some time. So who's sitting out?
हीनल की बैठी ठीक है
मैं तो खुश हो जाता यार for letting me sit for 2.5 minutes. So have a seat there. Okay. You have a 60-year-old male who is coming complaining of giddiness, nausea, vomiting. 60-year-old male, giddiness, nausea, vomiting. He's here. Your timer starts.
Hello. Is the patient responding?
Yeah, he's responding.
Can you tell me your name?
My name is George Clooney.
Okay. So the airway is patent. Can you attach the vital cardiac monitor, please?
Blood pressure attached, pulse oximetry attached. Can you see the monitor, please?
Yeah, they are attached. Give me a minute so that you will have all the
Can you
readings.
also calculate breathing?
IV.
So, sir, what made you come to the hospital today?
So I'm feeling giddy and nausea and vomiting since couple of weeks. Just today it was getting worse.
Okay. And was this nausea giddiness was associated with vomiting?
Yeah.
And how many episodes of vomiting, sir?
Almost 2 or 3. Not able to eat well since morning.
Okay. And any stuff? Saturation. Okay. So yeah, we'll take an IV cannula.
Okay.
So Any regular medications are going on?
Yeah, I think I was prescribed something for my irregular heart rate. I've been taking since 2 months.
16 calls. Which medications on?
I think it's digoxin or something, it's said.
Okay, so this could be cause. Yeah, we'll better get an ECG.
Okay,
Do we have
ECG
this?
showing the same rhythm and the rate, what you're seeing on the monitor.
If you 12. If you PV, examination, neuro examination.
CNS
Yeah.
examination.
We'll go ahead with the CNS examination.
Okay.
So, can you just get like? Can I just check the power of the patient?
Yeah,
Like
power
upper-
is 5/5, left upper limb,
Romberg sign.
negative,
Pupils are equal.
equally reacting,
Okay. And cerebellar signs.
negative,
Negative. Okay. What is the sugar level?
100,
Fine. On auscultation, can you just help me with the auscultation, please?
clear, clear and equal, impact
Hints
sub,
Hints
impact
examination.
sub,
Hints
you can join
examination.
them. Yeah, what do you want?
Nystagmus. and-
No nystagmus.
So, is the patient responding?
Yeah, he's saying his giddiness is slightly worsening.
Okay. Check for the pulse. Patient is responding. Drop to 80-50. Yeah, with unstable. So this is unstable. We'll attach for the pads. Defib is
Yeah? Yes, attached.
Yeah, we'll go ahead with injection atropine, 500 mcg.
Okay, atropine given.
Yeah.
What consent you want?
So right now I can see the patient is having unstable vitals, low blood pressure,
Okay.
After IV fluid, yeah. Hinal, can you arrange for IV fluid?
Okay.
500 ml of NSPS.
Okay, consent given.
1 mg atropine again loaded. If you want to repeat.
Yeah. We'll repeat one more.
Okay,
Atropine.
1 mg atropine given, second dose given.
Pacing, yes. Transcutaneous pacing. Yeah.
Okay.
We'll go till 3 mg. Isoprenaline. Yes.
50 mcg of fentanyl.
Yeah. Arrange karwa do.
50 mcg fentanyl given followed with flash.
Okay.
Everybody clear?
Yes.
Yeah.
Yes.
Yes.
Shock given.
Okay, shock given.
Shock क्यों दे रहा है?
Same, no change of vitals at all.
Transcutaneous pacing करना है.
Charging mode to 150 joules.
Okay.
अरे
Okay.
Charging. Shock.
Yeah, shock given, no change of vitals at all.
Pacing कर दिया.
We'll go ahead with transcutaneous pacing.
Okay, go ahead.
So attach the pads. Attach the pads.
Pads attached.
We'll pace the
Okay, so tell me the settings.
60.
Heart will keep the heart rate to
Heart rate 70.
Okay.
And we'll start with 5 milliampere
5
and
mil.
then we will increase the voltage.
Okay, what are you trying to look for?
Is there an increase in heart rate?
Heart rate.
No, no,
Yes.
We will increase the milliampere to 8.
no response to 8,
So we will increase to 12.
no response to 12,
15.
no response to 15.
Okay. Then we'll go ahead with transvenous pacing.
Okay, time's up. Thank you.
So initially he came with giddiness, with no neurodeficit apparently. So on Hin's examination, it could be a peripheral cause. So like symptomatic management we could have given, and then the patient went into brady. Shock क्यों दिया भाई ना यार. इसको बोला था छू बट. अच्छा अच्छा. Thank you. अच्छा अच्छा.
So that's with round 1. Which is more scary, this or this? Just trying to be less intimidating with wearing this. So how was it, round 1? I should be doing that. Nice? Bad? Horrible? We are grounded? Yeah? So one line struck me before we thought that we should do SimWars this year also. So I would prefer you guys completing the line because it's very obvious. Some are going to win, some are going to... Nah. Some are going to lose. But we all are going to... So is there any learning? So what was the learning? So let's start with what Hinduja took. 40-year-old male giddiness. Actually, everyone was giddy today. Even we are giddy, I am giddy. So what was the giddiness? 40-year-old giddiness. He has some heart rate issues, goes to 220. Beta blocker, you have, I think all of us are working in tertiary and quaternary centers. Yeah? They are up, what do you say, given with too much of beta blockers. Yeah? Everyday thing? Okay. Easy, confusing? Antidote? Glucagon. How many of you have glucagon? Everyone has it? Should we do a random ghost audit right now, calling up our hospital right now and ask them to keep glucagon ready? And the response we'll get from pharmacy is only 1 mg hai. Chalega? Yeah. So the idea is this is a very common affair you might land up seeing. So you need to be ready where you keep it. You want to keep it in your department, you want to keep it in pharmacy, up to you. So case is simple, beta blocker, toxicity, antidote. Yeah? Simple. Then the second case, that was amazing. I mean, we had ATLS, ACLS, but not toxicology. I think hardly one team caught it. What was that? Yeah. So why worry so much with... so one thing I couldn't figure out, all of your patients were pretty stable to start with. And everyone was ordering battery of test. If I am the relative, I'm going to sue you for sure. I don't have so much money to do everything. Yeah? Blood gas, CBC, renal profile, liver profile, ECG, point of care ultrasound. I'm stable patient. Why do I need all these? What do I need? Which no one took. No. We need history. No one bothered asking. What happened with you? बस किसने बोल दिया गिरा हुआ है अंकल तो I mean he had a fall, not गिरा हुआ है uncle, sorry. It didn't come out right. So if you had a fall, fine, ATLS is good, but your patient is too stable, he's talking to you. Okay? So always have a detailed history. So local anesthetic toxicity, how do we treat it? All of you have it? I see hands reduced. Don't worry, the next thing I took, everyone's hand will go up. Okay. Not the next, next to next. Okay. Then I took a case, giddiness, vomiting, everyone giddiness again. So what was the history? Clear cut. I take something since 2 months every day. What is the dose of digoxin? 5 days a week, 5/7. So that very clear cut you will need to ask when you have. So again, quaternary center, lot of patients with cardiomyopathies, low EF, they are invariably going to be on digoxin. So you'll need to ask. Antidote? How many of you have it? Is it available in India? What do we do? We have? You show me where we have. I don't know where we have. So that's your learning point. You're going to find out, is it available in India or no? And the cost of it. And the dose of it. There is empirical dose, there is weight-based dose. Okay? And last case which I took, that was the simplest case. Every emergency department in Mumbai, Navi Mumbai has seen that. Gas geyser syndrome. Yeah? Easy, history is very clear. Correct? How do you treat it? Sorry? hyperbaric oxygen. But to start with, how many of you have it? Are normal oxygen. Okay, now learning point in this. So one of the teams caught it rightly, but they could not justify the etiopathogenesis. Will carbon monoxide cause hypoxia? I don't see a confident answer. Yes or no? So there's a difference. So what was the etiology of hypoxia? The patient was getting drowsy, pooling of secretions. Simple things first. Rare things only come in exams. Yeah? Okay. So we've had beautiful judges who were sitting patiently, quietly, maintaining their input-output. So now we'll take their insights about how do we get better. Toxicology, how comfortable are you guys? बोलो नहीं यार, performance दिख रहा है हमको, इसलिए तो रखा. So we are not. So we try to learn something which we don't know. We all know organophosphate poisoning, yes? Yeah, we know it, no? We know burns. We will be rushing to intubate the patient as the patient comes. So now we need to focus on things which are more common. Ketan sir, your inputs.
Good morning, everyone. Good morning. Charged up, come on. Good morning.
Oh, ready?
First and foremost, thank you to this Akshay, Hinduja, and Nitins to have organized lovely SimWar. And I'm sure that you're learning significantly over here. The bottom line, what he's right now narrated, this stick to the basics, right? Unfortunately, if I'm not exaggerating, one person only introduce and say this, what's your name? Nobody asked the patient's name so far, right? So certain basics and then sticks to your basic that you got a clue, but unfortunately nobody utilized that clue. One of the teams, everything there, they have a fight with husband and wife, they consume medication but not reach to the conclusion. So the moment you got something, please figure it out. And the most important thing, the history taking and how exactly started. And thus, you know the ICE, right? What is the idea concern? So understand that what you are looking for this one right now to deal with the emergencies. And level of suspicious must be in the higher side that is my patient is dealing with what? Am I dealing with toxicology? Am I dealing with a cardiac? And unfortunately, everybody is trying to watch on a monitor and treat the rhythm. Please treat the patient, not the monitor, because it's not going to help you much, because the monitor shows something different, but your patient's actual conditions you need to assess overall and then treat. You need to treat the underlying cause rather than treating this, what you're seeing in this on the monitor and that, right? But you are pretty good job by everyone, and hoping more exciting rounds further in that. Thank you all.
Good morning, everyone. Yeah, so I want to add one thing that successful management of poisoning patients start with clinical suspicion, never with confirmation. So within 5 minutes, you to suspect there's a clinical there, maybe with the history, primary survey, and the vitals. And maybe available support by the ABG or ECG. And that you get the clue, the toxidroma within that. And then you can just make a diagnosis of what's happening, and you can treat the patients. That's it. Thank you.
So I know you all want the results, but you have one more thing to make up. So you all might be feeling a little bit down now, but that's why there's a coffee break now, tea break. You come back, you should have your phones ready with Kahoot. Okay? The score of Kahoot is also going to count into what you did performance-wise. Okay? And some of you already know it. The good news is there are 11 teams and 6 will go through. Okay? So you have more than 50% chance. So get yourself refreshed with tea, coffee. Identify one phone, because we can't have all 5 scoring the Kahoot. Which phone? Your username on the Kahoot should be your number that you have chosen. Yeah? So let's have a quick coffee break, maybe 5-10 minutes. and have your phones ready. The Wi-Fi details are on the group. So you can ask the team leader if you need Wi-Fi. They have everything on their phone. So we'll call you back in 5 minutes.
एक empty है बाकी सब
मंत्री के साथ आने वाला
इधर तो नहीं, उसके बाद इधर वही मंत्री है हमारा।
तो मैं करके भेजूं
क्या हुआ?
वाईफाई का पासवर्ड क्या है?
वो एपी
कौन सा है?
गेस्ट एपी कुछ गेस्ट आ रहा है। हाँ ये वो जाएगा, फिर यूज़र नेम मांगेगा, आप ही खुलना चाहिए। हाँ, तो MahaSimWar इज़ द यूज़र नेम, पूरा कैपिटल MAHA1 और पासवर्ड इज़ 123456। नहीं हो रहा है तो हो गया।
प्रैक्टिकल को भी मजा आएगा कि मेरी टीम प्रैक्टिकल को भी मजा आएगा नंबर ही क्यों मैंने ये नंबर लिया ये लिया
So you all have all signed in, na? Kahoot? 1 4 Serious maths. Maths is always serious. If it wasn't, then we would not be in medical. Roundtable conference. अच्छा, teamwork. Oh, good, good. Good. No teamwork in sitting in wrong. Wouldn't you form the answer and say no RQ? You have to form wrong answer. People were not participating in SimWar.
How many seconds? 20 or 30?
30 seconds. तू भी खेल सकता है. अगर तू हारा तो next time तेरे को participate करना पड़ेगा.
Done. मैंने हाथी सर के फोन से खेला था
लोगों को करवाया था ना. सर भी तो थे.
मैंने हाथी सर के फोन से खेला था सर को जिता दिया था पुणे में था सर बोलते तू ही मेरा खेल
Are you guys strategically settled? Those who are not in teams can also play. We have not kept, but we may get some prizes. Let the team not teams. We prize to arrange. माइक पहना तो आ गया. सही दिख रहा है. देखा मैंने. नहीं मेरा तो इधर. अच्छा मेरा ही पहना. सॉरी मेरा ही पहना. ठीक है सर्कल. क्या बोल रहा है? उसको बोल रहा है. माइक पे बोलना. माइक चालू ही चालू किया. क्या नंबर है?
Hello?
हेडसेट फ्री चालू कर.
लेफ्ट साइड का. रुक 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 मैं करके देता.
मेरे को कुछ दिख ही नहीं रहा है.
हाँ तो रुकना. अभी माइक चल रहा है. एक मिनट थोड़ा सा. और इसका फुल स्क्रीन. हाँ teams, first you guys join in please with the same team number what you have registered. Music on है वहाँ से. I think who is T? Who is T? Who is T? अरे Vanguard is. Let the team name नहीं, team number. Number. What is your number? So what is your number? Like Kim's have number of 100. So accordingly, what is your number?
100 is there.
Yeah. डिजाइनर को निकालो पहले. इसका आउटपुट चाहिए. Sound. MGM 10. You just put 10. That's enough. निखिल JR. अरे रुक रे बाबा, कितना घाई करेगा. निखिल JR को निकाल पहले. 100 आ गया है. 9 is here. Yes. अब 007 आ गया. 10 आ गया. 10 नहीं आया. 10 आ गया. Sorry.
MGM 10.
KDA 3 आ गया. Cancel. 22 7 आ गया.
9 total 9. 2 more.
22 भारती आ गया.
007.
Hinduja team is awaited. 333. Hinduja team.
333. 333 and 3.
अरे RCB, हाँ, you will win this year. Relax. Don't be so impatient. Triple three and 3. 333. Hinduja team, where are you? Hinduja team, not your team. And 3. KDA. Yeah, okay.
Now other.
कौन निकला? 10 है. एक कोई तो निकला वापस.
MGM 10.
MGM 10. Thanks. Now others want to join? Others, feel free to join. Yeah, please don't put numbers, but put your
name.
हाँ चलेगा, SG भी चलेगा. Anyone else wants to join? Last 10 seconds.
Okay.
Kirti, you're not joining? You're not joining? I think we'll start.
Sound. इसका sound.
Sound output.
Okay.
So the only decider is going to be hypotension of poor prognosis, not the age or anemia on arrival and all. Next. That's the problem. मध्ये मध्ये येतोय. ह्याच्यानंतर. So absence of gag. Absence of gag, it's not reliable. I can still have an absent gag and be perfectly fine not to get intubated by any one of you. Okay? Next. आराम से जा, क्या गई? That's easy. Don't prompt the answers. So there are I hope you know Kahoot, right? You know how it works. Fastest answer gets more point, but the answer has to be correct. So concentrate on both. Yeah. Next. Easy? Yeah.
Yes.
Ooh. I thought you would have expected this question. Pain on extension only. Wow, that was quick. Who was that one person? Okay. Easy, right and fast. Okay, not bad. Metropin. So what is the poisoning?
Cyanide.
Good. We are watching TV series. Divide by 1000. Automatically उसमें से हो जाता है. Okay. So when you have a patient of GBS coming, whether you want to tube, not tube, extubate, post-extubation, you will have all patients coming in different stages. You will need to check this before you take a call, yes or no. Next. What? Chronic stroke-related lesions will not cause. Hypomagnesemia will not cause. It's a part of workup we send now. Okay. I thought this was a easier one and high scoring one. 9, 1 and 10. Anyone has taken prophylaxis anytime? I have taken, that's why. What did you take? Not vaccine, prophylaxis. What did you take? Yeah, so if you wouldn't have answered, I would have asked you what was your urine the next day. So keep a watch on the rashes before you are intubating someone with altered mental status. They have a petechial rash. Rifampicin is coming your way. बहुत लोग गलत करेंगे. Definitive control. As expected. Why? Definitive, not initial. Okay, next. Huh? Spelling mistake? What happened? This was easy or tough? Mistake? Mistake or what? Arey, just because I have marked, don't say it's right. Even I'm a human. What was the canal mentioned?
Horizontal.
Aplis is for posterior. So what is for horizontal? Barbecue roll, not the one which we eat. Do we know how to do barbecue roll? Good. This is self-explaining. I think all of you got it right. दूसरा ही idea actually. Easy one. I think everyone should score well. Good. That's it. Thank you. What do we do? 11:30. Yeah. बताओ. हाँ कर.
Who's Hulk? Okay. So there is a slight change of plan. As usual, nothing goes to plan, right, in the emergency department. So we are still waiting for some of our seniors. So we will have to tweak the program a little bit. When I say tweak, it doesn't mean anything. We are just going to bring there's a second Kahoot for today. Okay, that is for the semi-finals. So your scores for this are locked. So we are going to add them to your performance and we'll decide the 6 teams. But we'll go ahead with the second Kahoot now. So you have one more Kahoot. So all of you can play again. All the teams log in. If you don't make it to the semi-final, you're still doing the Kahoot. Okay, is that confusing or? Basically, it's another Kahoot. Just play as it is because you're going to perform in the semi-final and this Kahoot is going to be added to that. Yeah? So it's still equally important, if not more important, because it's going to go with your semi-final. Everyone got that? So we'll put up the next game. Wait, that. So, yeah, so we'll just put in the second game pin on, and you can then log in with your team numbers like you did earlier.
Girl, you know I want your love. Your love was handmade for somebody like me. Come on now, follow my lead. I may be crazy, don't mind me. Say, boy, let's not talk too much. Grab on my waist and put that body on me. Come on now, follow my lead. Come on now, follow my lead. I'm in love with the shape of you.
Good morning. So the teams, can you please join? Come on, teams, you know the drill. No one wants HR in this room. Who is HR? Who's HR? All teams in? Hundred is here, 9 is here, 007 is here, 10 is here, 100 is Everyone in? Shall we start? Any of the teams yet to? Last 10 seconds. Anyone pending? No? Okay, let's start. Rash. It will be hypothermia. N-acetylcysteine. I didn't ask antidote, I asked toxic component. Read. You're losing out on scoring easy questions. So no one has any idea. Okay. I need to put some tough ones also, no? Everything can't be so easy. So next time when you're treating a septic shock, you have cardiac compromise, just follow up after 2-3 days what happens. You'll be surprised. This is easy, fast and no, someone missed out neonatal. That was easy to score. Okay. US is ultrasound, not United States. Sorry. You're using every day, na? Focus. You're doing every time. Good. We know who got it right and who didn't. Easy. Nothing new. Things which we already know. Wow. 333 is in. Something non-clinical also. Good. But do we communicate? Half of the feedbacks are for that only. Last 3 questions. just closest to the surface. Last two. Wow, that's nice. Alcohol intoxication. Saturday afternoon, you're at wrong place. Last question. It's very easy. As expected. Good. So that's with your. So which one was easy? First one, second one? First one, okay. So again, if any doubts, references, Rosen's, haven't picked up, made by self anything new. So that's it with the Kahoot for semis also. So now I would request Dr. Shweta Tyagi. I think we all know her. So she would like to share few things about something upcoming, and we are interested to hear that. Sent me the video, no? Yeah. I'll play. Want me to play later on, no?
Good morning, everybody. So I can feel and palpate the adrenaline actually as I came in. Everybody is so pumped up, right? How did the first round go? Yes, how did the first round go? Superb. Of course. I enjoyed it. I was on the way coming and I was listening, seeing it on the online link. It was amazing. Everybody was all into the scenario and a lot of good performances there. So I think a lot of more is coming up in the day. So it's amazing to be here on a Saturday afternoon and also continue till the evening, right? Okay. So as we are going through the MahaSimWars, which is wonderfully organized by Team Apollo and Dr. Nitin Jagasia, of course, taking the lead, and every year taking it a notch higher. So really kudos, and I think they deserve a round of applause for that. Masks, oh, that added a whole different element of drama to it, so wonderful. So taking it forward, 27th May is World Emergency Medicine Day, and we at Bharati Vidyapeeth are planning yet another competition inspired by MahaSimWars. So this time we will have a POCUS competition, a POCUS challenge. So all of us are so passionate about POCUS. We all do it in our departments for all critical patients. So now, not a workshop, but a challenge. So having scenarios and trying to figure out only by POCUS. So POCUS will be your only, what do you say? Yeah, tool. So POCUS will be the focus in this challenge, if I can put it. So I've made a small video for that, for you all to have an idea about what we are planning. Does it look exciting? Yes, amazing. So we will want participations. So each team will have 3 members, as is said. So first year, second year, third year, so JR1, JR2, JR3. So register as a team and let's make this POCUS challenge a success. So looking forward for maximum participation in that, and let's take the day forward. Thank you.
Okay. Just one more thing. So I think all of us agree that emergency medicine is a new field, still trying to establish. So we are still trying to find our foothold, do our bit, help out everyone. And obviously in this journey, I don't say it's a destination, it's a journey. Everyone is contributing their bit. So today, I would like to invite Dr. Kiran Shingote. He's our unit head of Apollo Hospitals, Navi Mumbai, instrumental in helping with Nitin sir in developing emergency to the best, to the state of art. So I would request him to come on the stage to felicitate someone, Dr. Preetham Gaikwad. He is the head of Department Emergency at Fortis, Vashi. And again, a pretty senior person, contributed significantly, and still continues to make things better for us. So let's give him a big applause. Thank you.
I don't know what I'm going to say. It's so engaging, so encouraging. I was attending morning event outside, and person next to me, sitting in one another conference, was saying to me, "Why you are seeing that video?" I said, "It's only because of Dr. Nitin, because there's something exciting going on there." Akshay very humbly said, I was part of this emergency beginning. But if I have to tell how much fight happens between all of us to ensure that thing happens, it's very, very different level. I'm part of this from so long, but I'm so happy that today we have more than 50 people here. Participants plus other people. So it's really beginning. I was talking to sir from Zydus. When it comes to education and learning, I'll give you a simple example. Please remember, if you teach and now collect the knowledge well, then only when you get the age where you need to get treated, you will be treated well. So if you don't pass the knowledge from you to other generation properly, please remember there will be generation who will not be treating you well. So this is what my mantra is. Please remember, take everything what you can take today. Thank you, thank you.
What's the plan? Patience is a virtue. Let's have food and then see who goes to semi-final. You're not hungry. I am hungry. I've lost 2 kilos since morning. Sir, it's such way, it's ready. Let's have food and then come back. Lunch, lunch.
you're the face of the future, the blood in my veins, oh, ooh, the blood in my veins, oh, ooh. But they never did, ever lived, ebbing and flowing, inhibited, limited, till it broke up when it rained down like.
So the bar is where I go. Me and my friends at the table doing shots, tripping fast, and then we talk slow. And you come over and start up a conversation with just me, and trust me, I'll give it a chance. Now take my hand, stop it, and the man on the jukebox, and then we start to dance. And now I'm singing like, girl, you know I want your love. Your love was handmade for somebody like me. Come on now, follow my lead. I may be crazy, don't mind me. Say, boy, let's not talk too much. Grab on my waist and put that body on me. Come on now, follow my lead. Come on now, follow my lead. I'm in love with the shape of you. We push and pull like a magnet do. Although my heart is falling too. I'm in love with your body. And last night you were in my room. And now my bedsheets smell like you. Every day discovering something brand new. Well, I'm in love with your body. Oh, I, oh, I, oh, I, oh, I. Well, I'm in love with your body. Oh, I, oh, I, oh, I, oh, I. Well, I'm in love with your body. Oh, I, oh, I, oh, I, oh, I. Well, I'm in love with your body. Every day discovering something brand new. I'm in love with the shape of you. When we came, we let the story begin. We're going out on our first date. You and me are thrifty, so go all you can eat. Fill up your bag and I fill up the plate. We talk for hours and hours about the sweet and the sour and how your family's doing okay. And leaving, getting a taxi, kissing the backseat, tell the driver make the radio play. And I'm singing like, girl, you know I want your love. Your love was handmade for somebody like me. Come on now, follow my lead. I may be crazy, don't mind me. Say, boy, let's not talk too much. Grab on my waist and put that body on me. Come on now, follow my lead. Come on now, follow my lead. I'm in love with the shape of you. We push and pull like a magnet do. Although my heart is falling too. I'm in love with your body. Last night you were in my room. Now my bedsheets smell like you. Every day discovering something brand new. Well, I'm in love with your body. Oh, I, oh, I, oh, I, oh, I. I'm in love with your body. Oh, I, oh, I, oh, I, oh, I. I'm in love with your body. Oh, I, oh, I, oh, I, oh, I. I'm in love with your body. Every day discovering something brand new. I'm in love with the shape of you. Come on, be my baby, come on. 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 I'm in love with the shape of you. We push and pull like a magnet do. Although my heart is falling too. I'm in love with your body. Last night you were in my room. Now my bedsheets smell like you. Every day discovering something brand new. I'm in love with your body. Come on, be my baby. Come on, come on, be I'm in love with your body. Come on, be my baby. Come on, come on, be I'm in love with your body. Come on, be my baby. Come on, be I'm in love with your body. Every day discovering something brand new. I'm in love with the shape of you.
We don't talk anymore. We don't talk anymore. We don't talk anymore like we used to do. We don't laugh anymore. What was all of it for? Ooh, we don't talk anymore like we used to do. I just heard you found the one you've been looking. love was a game. Now I can't get you out of my brain. Oh, it's such a shame that we don't talk anymore. We don't talk anymore. We don't talk anymore like we used to do. We don't laugh anymore. What was all of it for? Oh, we don't talk anymore like we used to do.
I just hope you're lying next to somebody who knows how to love you like me. There must be a good reason that you're gone. Every now and then I think you might want me to come show up at your door, but I'm just too afraid that I'll be wrong. Don't wanna know if you're looking into her eyes, if she's holding on to you so tight, the way I did before. I overdosed. Should've known your love was a game. Now I can't get you out of my brain. Oh, it's such a shame
that we don't talk anymore. We don't talk anymore. We don't talk anymore like we used to do. We don't laugh anymore. What was all of it for? Oh, we don't talk anymore like we used to do. Dress you're wearing tonight, if he's giving it to you just right, the way I did before.
I overdosed. Should've known your love was a game. Now I can't get you out of my brain.
Oh, it's such a shame that we don't talk anymore. We don't talk anymore. We don't talk anymore like we used to do. We don't laugh anymore. What was all of it for? Oh, we don't talk anymore like we used to do. We don't talk anymore. Come just you wearing tonight. If he's holding on to you so tight, the way I did before. We don't talk anymore. Should've known your love was a game. Now I can't get you out of my brain. Oh, it's such a shame that we don't talk anymore.
Been reading books of old, the legends and the myths, Achilles and his gold, Hercules and his gifts, and Spider-Man's control, and Batman with his fist. And clearly I don't see myself upon that list. But she said, where'd you wanna go? How much you wanna risk? I'm not looking for somebody with some superhuman gifts, some superhero, some fairy tale bliss, just something I can turn to, somebody I can kiss. I want something just like this. Oh, I want something just like this. Oh, I want wish, and they wish, and they wish, and they wishing on me. Yeah. I've been moving calm, don't start no trouble with me. Trying to keep it peaceful is a struggle for me. Don't pull up at 6 a.m. to cuddle with me. You know how I like it when you loving on me. I don't wanna die for them to miss me. Yes, I see the things that they wishing on me. Hope I got some brothers that outlive me. They gon' tell the story, shit was different with me. God's plan, God's plan. I hold back, sometimes I won't, yeah. I feel good, sometimes I don't, hey, no. I finesse down Western Road, hey, next. Might go down to G.O.D., yeah, wait. I go hard on Southside G, yeah, wait. I make sure that Northside eat. And still bad things, it's a lot of bad things that they wish, and they wish, and they wish, and they wish, and they wishing on me. Bad things, it's a lot of bad things that they wish, and they wish, and they wish, and they wish, and they wishing on me. Yeah. Hey, hey. She say, do you love me? I tell her only partly. I only love my bed and my mom, I'm sorry. 50 dub, I even got it tatted on me. 81, they'll bring the crashers to the party. And you know me, turn the 02 into the 03, dawg. Without 40 Ollie, there be no me. Imagine if I never met the broskies. God's plan, God's plan. I can't do this on my own, hey, no, hey. Someone watching this shit close, yeah, close. I've been me since Scarlet Road, hey, road, hey. Might go down as G.O.D., yeah, wait. I go hard on Southside G, hey, wait. I make sure that Northside eat, yeah. And still bad things, it's a lot of bad things that they wishing and wishing and wishing and wishing, they wishing on me. Yeah, yeah. Bad things, it's a lot of bad things that they wish and they wish and they wish and they wish and they wishing on me. Yeah.
I wish I found some better sounds no one's ever heard. I wish I had a better voice that sang some better words. I wish I found some chords in an order that is new. I wish I didn't have to rhyme every time I sang. I was told when I get older all my fears would shrink, but now I'm insecure and I care what people think.
My name's Blurry Face and I care what you think. My name's Blurry Face and I care what you think.
Wish we could turn back time to the good old days when the mama sang us to sleep, but now we're stressed out. Wish we could turn back time to the good old days when the mama sang us to sleep, but now we're stressed out. We're stressed out. Sometimes a certain smell will take me back to when I was young. How come I'm never able to identify where it's coming from? I'd make a candle out of it if I ever found it. Try to sell it, never sell out of it. I probably only sell one. Maybe to my brother, cause we have the same nose, same clothes, homegrown, a stone's throw from a creek we used to roam. But it would remind us of when nothing really mattered. Out of student loans and treehouse homes, we all would take the ladder.
My name's Blurry Face and I care what you think. My name's Blurry Face and I care what you think.
turn back time to the good old days when the mama sang us to sleep, but now we're stressed out. Wish we could turn back time to the good old days when the mama sang us to sleep, but now we're stressed out. Used to play pretend, give each other different names. We would build a rocket ship and then we'd fly far away. Used to dream of outer space, but now they're laughing at the face, saying, wake up, you need to make money. Yeah. We used to play pretend, give each other different names. We would build a rocket ship and then we'd fly far away. Used to dream of outer space, but now they're laughing at the face, saying, wake up, you need to make money. Yeah. Wish we could turn back time to the good old days when the mama sang us to sleep, but now we're stressed out. Wish we could turn back time to the good old days when the mama sang us to sleep, but now we're stressed out.
Used to play pretend, bunny. We used to play pretend, wake up, you need the money. Used to play pretend, bunny. We used to play pretend, wake up, you need the money. Used to play pretend, give each other different names. We would build a rocket ship and then we'd fly far away. Used to dream of outer space, but now they're laughing at the face, saying, wake up, you need to make money. Yeah.
want to say goodnight to you.
Holding me back, gravity's holding me back. I want you to hold out the palm of your hand. Why don't we leave it at that? Nothing to say, when everything gets in the way. Seems you cannot be replaced, and I'm the one who'll stay. Oh, in this world, it's just us. You know it's not the same as it was. In this world, it's just us. You know it's not the same as it was. As it was. As it was. You know it's not the same. Answer the phone. Harry, you're no good alone. Why are you sitting at home on the floor? What kind of pills are you on? Ringing the bell, and nobody's coming to help. Your daddy lives with himself. He just wants to know that you're well. Oh, in this world, it's just us. You know it's not the same as it was. In this world, it's just us. You know it's not the same as it was. As it was. As it was. You know it's not the same. Get headlines, feed internet. I don't wanna talk about the way that it was. Leave America to kids follow. I don't wanna talk about us doing it first. As it was. You know it's not the same as it was. As it was. As it was. I do the same thing I told you that I never would. I told you I changed, even when I knew I never could. Know that I can't find nobody else as good as you. I need you to stay, need you to stay. I get drunk, wake up, I'm wasted still. I realize the time that I wasted here. I feel like you can't feel the way I feel. I'll be fucked up if you can't be right here. Oh, 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 I'll be fucked up if you can't be right here. I do the same thing I told you that I never would. I told you I changed, even when I knew I never could. Know that I can't find nobody else as good as you. I need you to stay, need you to stay. I do the same thing I told you that I never would. I told you I changed, even when I knew I never could. Know that I can't find nobody else as good as you. I need you to stay, need you to stay. When I'm away from you, I miss your touch. You're the reason I believe in love. It's been difficult for me to trust, and I'm afraid that I'ma fuck it up. Ain't no way that I can leave you stranded, 'cause you ain't never left me empty-handed. And you know that I can't live without you. So baby, stay. Oh, oh, I'd be fucked up if you can't be right here. I do the same thing I told you that I never would. I told you I changed, even when I knew I never could. Know that I can't find nobody else as good as you. I need you to stay, need you to stay. I do the same thing I told you that I never would. I told you I changed, even when I knew I never could. Know that I can't find nobody else as good as you. I need you to stay, need you to stay. I need you to stay. Baby, this love, I'll never let it die. Can't be touched by no one. I like to see him try. I'm a madman for your touch, girl, I've lost control. I'm gonna make this last forever, don't tell me it's impossible. 'Cause I love you for infinity. I love you for infinity. 'Cause I love you for infinity. I love you for infinity. Well, darling, my soul, you know it aches for yours. And you've been filling this hole since you were born. Oh, 'cause you're the reason I believe in fate. You're my paradise. And I'll do anything to be your love. I'll be a sacrifice. 'Cause I love you for infinity. I love you for infinity. 'Cause I love you for infinity. I love you for infinity. Meet me at the bottom of the ocean, where the time is frozen, where all the universe is open. Love isn't random, we are chosen. And we could wear the same crown. Keep slowing your heart down. We are the gods now. 'Cause I love you for infinity. I love you for infinity. 'Cause I love you for infinity. I love you for infinity.
Feel your eyes, they all over me. Don't be shy, take control of me. Get the vibe, it's gonna be lit tonight.
Baby girl, you give me 10 ton of fatness, give me some of that. Thinks with the badness, look how she at. Shape like a death, but I'm not just that. It's a good piece of mentals under the cap. A piece of game, I'm love how you chat. Watching every step of the paper, the way you got. Staying in my brain, memory not detached. Mainly my aim is to give it this love. If not dig the way you move, let me acknowledge the way you do. Then I would not lie, baby. You be me up like Scotty. It's how hypnotic the way you move. That's why I wanted to get to you. And I would not like a baby. You moves how hypnotic.
No lie,
Girl, you never
I
meant
feel your eyes, they all over me. Don't be shy, take control of me. Get the vibe, it's gonna be
me bone it and let me own it, my girl. Give you all the style that I have myself. I say what baby girl, that's my word. Give you the good loving that is preferred. You deserve it, so don't be scared. It's hypnotic the way you move. Let me acknowledge the way you do. Then I would not lie, baby. You be me a black daddy. It's how hypnotic the way you move. That's why I wanted to get to you. And I would not like a baby. You moves how hypnotic.
No lie, feel your eyes, they all over me. Don't be shy, take control of me. Get the vibe, it's gonna be lit tonight. No lie, hypnotized, pull another one, it's alright. I know what you want, get the vibe, it's gonna be lit tonight. No lie,
how we do it.
no lie,
So we say do it.
no lie,
Seems how we do it.
it's gonna be lit tonight.
Put a bang
No
on.
lie,
Seems how we do it.
no lie,
So we say do it.
no lie,
Seems how we do it.
it's gonna be lit tonight.
Put a bang
No
on.
lie,
Get that body, let me see you just do it. Get 100%.
no lie,
Move that body, let me see you just do it. Girl, go and represent.
no lie,
Shake that body, let me see you just do it to the fullest extent.
no lie,
Move that body, let me see you just do it. Girl, you're magnificent.
no lie. Feel your eyes, they all over me. Don't be shy, take control of me. Get the vibe, it's gonna be lit tonight. No lie, hypnotized, pull another one, it's alright. I know what you want, get the vibe, it's gonna be lit tonight. No lie,
Seems how we do it.
no lie,
So we say do it.
no lie,
Seems how we do it.
it's gonna be lit tonight.
Put a bang
No
on.
lie,
Seems how we do it.
no lie,
So we say do it.
no lie,
Seems how we do it.
it's gonna be lit tonight.
Put a bang
No
on.
lie.
Baby, I'm playing on you tonight. Hunt you down, eat you alive. Just like animals, animals, like animals, moles. And maybe you think that you can hide. I can smell yourself for miles. Just like animals, animals, like animals, moles. Baby, I'm so what you trying to do to me? It's like we can't stop, we're enemies. And when we get low, we're on the other side of you. You're like a drug that's killing me. I cut you out entirely.
First things first, I'ma say all the words inside my head. I'm fired up and tired of the way that things have been. Oh, ooh, the way that things have been. Oh, ooh. Second thing, second, don't you tell me what you think that I can be. I'm the one at the sail, I'm the master of my sea. Oh, ooh, the master of my sea. Oh, ooh. I was broken from a young age, taking my soak into the masses, writing my poems for the few that look at me, took at me, shook at me, feeling me, singing from heartache, from the pain, taking my message from the veins, speaking my lesson from the brain, seeing the beauty through the. Hey, burn me up, you burn me up, believer, believer. Hey, burn me down, you build me up, believer. All the hate that you heard has turned your spirit to a dove. Oh, ooh, your spirit up above. Oh, I was in the ground, building my rain up in the cloud, falling like ashes to the ground, hoping my feelings they would drown, but they never did. Ever lived, ebbing and flowing, inhibited, limited, till it broke up when it rained down. It rained down like. Last days last by the grace of the fire and the flames. You're the face of the future, the blood in my veins. Oh, ooh, the blood in my veins. Oh, ooh. But they never did, ever lived, ebbing and flowing, inhibited, limited, till it broke up when it rained down. It rained down like. Hey, burn me up, you burn me up, believer, believer.
Spent 24 hours, I need more hours with you. You spent the weekend getting even. Ooh. We spent the late nights making things right between us. But now
No mobiles. MGM. KDA, which has two teams, KDA 9. कितने हो गए? नहीं, एक बाकी है. नानावटी. So leave your mobiles and everything. We are ready to kick off the semi-final. Either you are inside the auditorium or you are in the team or you go home. Okay?
She works the nights by the water. She's gone astray, so far away from her father's daughter. She just wants her life for a baby. All on her own, no one will come. She's got to save him. She tells him, ooh, love, no one's ever gonna hurt you, love. I'm gonna give you all of my love. Nobody
We're going to do a trial of the voting as well. Everyone's got one? प्रसाद, वोटिंग का उधर कौन देख रहा है? We'll have to display. हाँ, हाँ, आप, हाँ दे रहे हैं ना, आगे पीछे ही देना है, आगे का हो गया ना, एक इधर देना है. So life is not fair and life is not perfect. So some of you will feel that you all are here and you all may be biased towards a particular team, right? Because some team members have supporters here and some don't. So that can happen, but that's life. We can't be, perfect in all of that. Everyone's got a voting meter? Yeah? Can they press or how does it work? प्रसाद, हाँ नहीं, वो कौन है वहाँ पे, उनको पूछो. Because एक 10 seconds के लिए only they can press.
here. Normal saline, 60 ml per hour for now. Let's assess the disability now.
He's been just
IV access immediately, lab, CBC, blood gas, LFT, RFT, troponin, electrolytes, will take it from there. Atropine, keep atropine bedside ready. Dr. Akash, I will stabilize this patient. If you
she's
need me,
complaining of generalized weakness.
we need a 12 lead ECG too, guys.
So we start to 100 ml of IV fluid bolus.
For now, let's a fluid challenge 200 ml. For now,
200 ml fluid going on. CRT is around 5 seconds.
Pulse, all four limbs.
You are able to palpate feeble.
Bilateral up BP 80-50.
Yes. Felt feeble. No, the family will come in 5-10 minutes.
Going to the surrender check with GCS.
Are you being spontaneous?
Yes.
Is she able to talk clearly and
Yes.
aware of it? Can she follow my commands?
we'll try giving her atropine
checking pupils
1 ml for now.
reacting to light.
Equally reacting to light 3 ml.
PR interval is constant. Do we have a 12 lead ECG strip? Or this is
Showing the same what you're seeing on the screen.
Okay.
1 mg atropine IV given.
1 mg atropine IV given.
Do we have any labs available for her for now?
Not yet. Blood gas would be there in next 2 minutes.
History of any consuming drugs.
Nothing obviously that she is saying.
The rate is still 45. Did she respond to atropine?
No.
Okay. Blood pressure 80-50 of auscultation.
Auscultation. Is there is an added sound of
Reps failure.
Auscultation is clear.
Auscultation is clear. No added
Okay.
sound.
So bradyarrhythmia secondary 2.
So after
We'll do one thing. Can we wait for the labs? We'll put her on a dopamine infusion for now. We'll start by 5 microgram per kg per minute. Okay? We'll stabilize the blood pressure till we have further information with us.
Dopamine infusion started at 5 mg.
Okay.
Meanwhile, Dr. Akash, what is the update? Okay, so Dr. Amlu, please go through everything again. Primary survey, the airways patent? Breathing part? Okay, 97. Circulation, she is in shock right now. Bradycardic, symptomatic bradycardia for now. She's not responding to atropine. You put her on dopamine. What are we missing? So we have any other information available with us right now?
She's talking to you.
Please ask her in her medication history.
Yeah, my name is Maya Sarabhai. I'm just feeling very weak since few days. I'm not feeling that strong enough that I will be able to walk comfortably. I prefer to usually use support to walk around. I don't know when was the last time I had any fever. No, I think I'm passing adequate urine. Yes.
ECG do we have?
No.
Okay. Are you taking any pain medication which I should be aware of?
I was supposed to take, but I don't think I've taken it last 2 months.
Do you know the name?
I think I have that thyroid issue. I have not been taking medication since 2 months.
Since 2 months. Any recent additions or deletions in the medications apart from the
I've not seen, frankly, any doctor.
What about the extremities?
Feeble pulses and
VBG should come up in next 30 seconds.
Temperature. Her temperature.
The temperature is around 32 degrees Celsius.
She is hypothermic. We'll have to put her on warm fluids, warm normal saline for now. Cover her. And considering this could be edema coma, send T3, T3, T4, TSH. We'll have to give her IV, T3, TSH, a steroid to hydrocortisone 100 mg for now. We'll do that.
The VBG is on the screen.
IV hydrocortisone 100 milligrams given stack.
Going down, I think we have to start with vasopressors.
Do we have a focus machine with this?
Yes.
SSD fluid.
Where are you looking at?
4-chamber view for now.
Okay, we'll show you the 4-chamber view.
NS fluid connected.
She has a pericardial effusion, guys. Let's prepare for pericardiocentesis. Let's prepare for pericardiocentesis. Fluid, that's it enough for now.
Is there any muffled heart sound?
No muffled heart sounds.
Neck veins?
Is there neck veins?
No.
Okay. We have any family so that we can take consent, or just talk to her, explain the procedure, and take the consent from the patient.
Hi, ma'am, I'm Dr. Amaru.
Okay.
So there is fluid accumulation around your heart. So your heart rate is low and BP is also low. So we have to do one procedure to remove the fluids. So if you are give the consent, then you can go ahead with the procedure. So this is required and this is life-saving for your life.
Okay, that's it. Just
Patient has refused to give consent. She doesn't want a needle poke at her heart.
What are we missing, guys? BP is 70/40. She's already on dopamine. Heart rate is 45, not responding to atropine or dopamine. Then we'll have to think of pacing.
Yes, can we see the IVC on POCUS?
We can give her a 500 ml normal saline bolus for now, over 20 minutes, 10 to 20 minutes. Can we recheck the temperature?
Yeah, temperature is coming up to 34 now.
Okay, yes. Still. Next, what we can do is we have an external heater, basically a heating device, warm electric blankets for this.
Okay.
Can do that. Last option is we'll have to put in a Foley's and irrigation with that, if the temperature still does not come up.
So your patient, Maya Sarabhai, is suddenly seizing right now.
Recovery position, oxygen. Dr. Shivanshu,
And your
please
patient
help.
one has started to get agitated and start shouting.
Okay, take care of the airway. I'll manage that with Dr. Akash. Dr. Akash, please counsel him. If needed, call the security. Still does not.
What are you doing to my brother?
We focus that. You need my help, Dr. Amlu?
Seizures have stopped after giving benzodiazepines.
Let's reassess the airway for now. Dr. Shivanshu, we might have to call the security over there. Just try calming him down. If needed, chemical restraint, just inform me. Okay. We have given what? Midazolam, lorazepam, 4 mg. Airway is clear for now.
No.
Do we need an NPA for her? The blood pressure is still 70/40. We are continuing with. Is she responding to IV fluids? We almost
She started seizing again.
We can repeat initial lorazepam 4 mg once. But at the same time, we'll have to think of advanced survey at this moment too. So let's keep everything ready for now.
Advanced level. What all you need, ma'am? A size smaller, 8
Any other labs available with us for this?
Yeah. So can I have MahaSimWar labs put up on the screen? No, still ongoing seizures.
Status with the Levipil, 20 mg.
Given, Levipil loading given.
Sodium is 124, this could be secondary to hyponatremia. Or 3% LS, 100 ml over 5 minutes for now. We'll have to stabilize the blood pressure if we want to intubate her. She's not responding to fluids, let's keep post-dose pressure ready, Dr. Aditya.
Seizures are not stopping.
We'll have to intubate her. This is status epilepticus, not responding to basically a refractory status epilepticus. Then we'll put her on midazolam infusion. Okay. No relatives for the consent?
Relatives are on their way, should be here in 5 minutes.
Let's pre-oxygenate her. ठीक है, benzodiazepine should do. Just make him calm, that's it. If you need me, call me. BP is still 70-40, she might crash anytime. So fluids will start. Let's take a push-dose pressor or noradrenaline infusion for now, and then we'll take it from there.
Seizures are still not stopping.
We've given Levipil, a phosphonate oil, and we've given 3% normal saline. We can repeat one bolus, and then we'll repeat the sodium levels. 100 ml, 3% NS, 5 minutes. Next, what we can do is we can load her with phosphonate oil. Enough with pre-oxygenation. We already put her on noradrenaline infusion. Any response, take in the blood pressure for now. We can go ahead with the intubation.
Still seizing, airway not secured.
Let's look at the cord suction ready.
Not able to open any mouth. Seizures are not stopping at all. It's
We'll have to give her muscle relaxant. Okay. Active seizure. Let's go with succinylcholine for now. 100 mg. And etombinate 20 mg. Bolus. BP is 60-40. Pre-oxygenation is still at 90. Dr. Shivanshu, come help us.
Yes.
We already give steroids.
The given steroids we have given. Did we check the HGT for her?
HGT is 50.
50. D25 100 ml for now. The oxygenation is done. Is the series stopped now? We have practically we've given the muscle relaxant. Let's have a look at the cords.
So opening the mouth, lateralizing the tongue.
She might crash. Dr. Aditya?
Not able to visualize the cords.
Ball maneuver.
Not able to visualize the cords. Not able to visualize with cords with BG.
Now, element, can try with element.
Time is up. Thank you. So, single line, what was it?
Sedima, Kuma.
Okay, good. Okay, yep, thank you.
Decision now. Team decision.
Hello.
ड्रग्स नीचे है ना ऊपर है. Hello. Yeah. Hi team.
Hi.
So there's a patient. He's 26-year-old. He had an anterior shoulder dislocation. The shoulder was reduced using ketamine for procedural sedation, and his oxygen has reduced a bit, saturation. So the nursing staff has called you to see.
Okay. Okay, so please assess the patient. Aishwarya, please assess the patient. Meanwhile, please.
What is your name, sir? Hello? Patient is not talking. Is there any secretions?
Meanwhile, attach the monitors.
What is the trachea? Is it central?
Trachea central.
And how is the neck place?
Is the patient talking to us? Please start talking to us.
I'll assess the chest for the patient. Is the chest size equal?
Chest size is equal.
Okay. Is the palpation, is there any other tenderness?
No tenderness.
Okay. How is the percussion?
Normal.
And heart sounds auscultation?
What are you hearing for?
Like if there is any released breath sounds, any adventitious sounds?
No adventitious breaths.
How is the peripheral pulses of the patient? In the right
You can feel it.
May I see the BP also?
BP is coming up.
Please put it.
How is the blood sugar?
72.
How is the Jesus? Is he opening eyes?
He's responding to you.
It's not opening his eyes. Is he opening his eyes?
He's obeying your commands.
And what are the pupils?
Bilateral equal.
May I know the history? Like, did he have an RTA or?
No, he was just playing cricket, and he's a known case of shoulder dislocation.
Does he have any comorbidities?
No.
And how much dose of ketamine was given?
He was given around 45 mg of ketamine.
Only ketamine was given for this. Okay. Do we have an IV access? We have, right? Patient is already undergone procedure. He might have an IV access. He has an IV access.
Yeah, he does.
We'll start with this.
IV access is taken.
We'll get an ECG also done.
Yeah. Get an ECG.
We'll get an ECG as well as we'll get samples for a blood gas.
Okay, blood gas is coming up. Take some time.
Yes.
Saturation is picked up after the oxygen.
And do we have a pulse on the hand where he's got this wound?
Yes,
like
he does.
Yes. Any other history? Any fever? Anything else? Fever
No
or?
fever. What else are you looking for?
Only he came for only this complaint. He didn't have any other complaints on coming. No.
Any marks on chest? No marks. 98.
Any allergies?
No known allergies.
Should we? It's not a trauma. He just got a shoulder dislocation.
No, not on the X-ray. There's another patient that's wheeled in.
Okay. Vivek, can you please go and assess that patient? Okay, we have started him on fluids. We have started him on O2. His O2 has come up. His vitals look good. This can be some emergence phenomenon kind of thing because of ketamine.
She's talking to you.
Hi.
Hi. Hello.
How was
the pain now?
She's saying hi.
How
is the pain now? Do you have pain?
You want this one. Connecting the monitor to the second patient.
Since he is not talking to us, I think we have sent all the samples, right? We'll put an exhilarating airway also for him so that he keeps its airway patent.
Is he still talking? Yeah, he's obeying to your commands.
We can put an exhilarating airway. He is. That's okay. So, can you please? His heart rate is
Please get it loaded.
Yeah, we'll start with some, I think we should give some pain management also for him.
Your vitals.
Give injection capital.
Okay.
Give injection capital.
Okay, tramadol injection given. This is this patient's vitals.
This is this patient's vitals?
Yes.
No, he only has this on his collar.
He's talking to you. No?
Emergency.
Yes. Check. Clear. Equal. No.
Any associated limb injuries?
I think this patient is in emergence phenomenon because of ketamine. It might be dissociative anesthesia. I think so. Is that? Maybe we.
IV fluids?
We have started with IV fluids for the patient.
I'm getting a 12-lead ECG. That's the rhythm.
To give please assess the
No obvious trauma. No femur fractures. She's talking to you. I feel extremely weak.
Since when are you feeling this?
I've been having some loose motions the last 2 weeks. But I was just getting better. The last 2 days have been just vomiting.
Since the BP is low, please get an IV and start on the floor. Okay. We'll get a blood gas also for the patient. And she's 26-year-old female. Any comorbidities?
She's on depression pills, antidepressant. She's on escitalopram. Not yet.
Okay, we are getting an ECG for her. Can we get an ECG?
Okay. The ECG is getting loaded. They're taking a 12-lead ECG.
We have started on fluids. Start on IV fluids, please. This is this lady. And whose is this?
Yeah. Can I get the ECG? Electrolytes are coming up.
So I think she's on anti. Do we know like what exactly? Do we have this thing? Electrolytes?
Electrolytes is still taking time. I feel extremely weak. Transiently, it's 82/50.
Okay. Is there any abdominal pain? Is she having an abdominal pain or?
Complaining of abdominal pain.
We'll examine the abdomen. 26. Please examine the abdomen.
It was 2 days back. No, normal bleed.
Any abdominal tenderness?
No.
Is the abdomen distended?
No.
Any trauma?
No.
Is she passing filters?
Yes, she is.
Okay. And is she holding on any medication? Did she take her medicines too much, anything like that?
She says no. She denies.
Okay. Can we? She had fever. She had fever.
Not now.
She had issue back. 2 weeks back. She had fever. Is she able to move all her limbs?
Yes, she is moving. Pupils are bilateral.
Yes. If the BP is not coming up, we'll start with low dose of noradrenaline also.
What is the risk of GC? Is he obeying?
He's obeying to your commands. Open your eyes.
I think she had a strong fever. She's in shock also. I think we can take her this thing. We'll take her lactate, blood cultures. We'll take her blood cultures. We'll start with oxygen and we'll start with this thing also. Fluids and antibiotics. Please give him benzodiazepines.
Your patient started seizing.
Yeah, please give benzodiazepines. Yes, nothing is happening. Yes, listen to me. You are in the hospital. You had a shoulder dislocation. We have treated you for that. Okay? Yeah. I'm please give me a hand. Please give me a hand. Nothing is happening.
No, she's still seizing.
You are in the hospital. Yes. Don't worry. Okay?
It's still coming.
You had a shoulder injury. We have treated you for that. We have given you pain medicine. just go for the sedation. Okay? It's going on. How are you feeling now? Okay. Please give me that hand. Yes. Please give him a low dose of benzodiazepine as good as. Yeah. Still seizing. One gram level is going on. Okay. The electrolytes are up there. We'll put her on Ogo also. Yeah. Calcium gluconate given. Calcium 30 ml. We start with 10% units insulin with a 25% dextrose drip. We'll also give her a salbutamol nebulizer. She stopped seizing. Is she still talking to us? No, she's not. Do we have a pulse? She has a pulse. That's the vitals. Still close up, Mama. I think we have put her on level. Is there any secretion or anything in her mouth? No. Okay. Is she opening eyes on my command or moving lips on my command? No. What are you checking for? No, she's not. No. Is she producing any volumes? No. Okay, central. We've already started nalgene for the patient. We prepare for intubation. Yeah. But we'll prepare. Get ready for intubation. Have a relative consent. Sorry, have a relative consent. No, you don't have a relative. She's come alone. Okay. Is there? Do we have focus available? You have the focus. Which way do you want? I want to see the abdomen, right upper quadrant. Can we have the right upper quadrant, please? It's coming up. Patient started seizing. Please. Keep on the left. Yeah. Give a bit lower as a bump for MG. Okay, the patient is being shifted to the wards. Have your given lupus? Did she stop? She's still seizing. We'll intubate her. Please, we don't give her. We'll give it terminate. Please give it the terminate, please. Ketamine. We'll give a get ready for ketamine. We'll intubate her before pre-medicate with ketamine. Please get the laryngoscope from there. Can I see the focus once more? Which view do you want? The left upper. We saw the right one. I want to see that once more and the other place. First one, the right upper. Can we have the focus right upper, the left upper, please? You intubate. We have given fluids. She's not. Right upper. Right upper is okay. May you see the left upper? Same. And the subsifoid view, the heart. Subsifoid view. Subsifoid. She's still seizing. We have sedated her. We have intubated her. She's still seizing. She's not gotten intubated. She's not gotten intubated yet. Can we see the cords? No, she's still seizing. Yeah. We'll keep her. We'll wait for her to stop. We'll keep her on the left leg. We'll wait. Tube is not in. She's still seizing. We have to keep her on the left leg. We have given lorazepam. We'll also start with on levetiracetam 1. First, we'll have to make her stop seizing. We can give this thing. Levetiracetam will start. Yeah, take my She's seizing still now. We have to sedate. We have given her ketamine. We'll give her Midas also. We've already given her Loposin, right? Why is it? We knows hyperkalemia. We treated it. We treated the hyperkalemia. Yeah, do we have a ripetotacin? Not yet. 55 after your T25. This is the image of our patient. T25 repeated again. Stop seizing transiently. She stopped seizing transiently. Please secure the airway now. Vivek. Premedicate her. Bring him out. Sorry. She seizes again. She seizes again. She's still seizing. She's still seizing. Time's up. Time's up. So what was going on? No. What were you treating? Hyperkalemia, sepsis, hypovolemia, septic shock. We treated for septic shock. We did for hyperkalemia. Something that we've interpreted. Something that we've interpreted as hypoglycemia, as hyperkalemia. Anything else that we saw? We'll have a debrief later on. Thank you. Thank you. Do we have photo? Let's go meet up.
We have the voting. A is maximum, F is 0.
Can I have Dr. Sandeep Gore sir on stage for something special?
Good morning, good afternoon all. Yeah, getting parking here also, when I got parking here, I got the feeling of I won the MahaSimWar. It's so difficult to get parking around Apollo today. And I was watching all the scenarios and everyone performed very brilliantly, and we must give applause to Nitin for taking such relentless efforts consistently. Yeah? Yeah, but सबका नाम नितिन का लिया मतलब सबका लिया. You are state president, हमारा भी आ गया उसमें. Okay, so now the important is that this we can see this emergency medicine has been traveled long, and there is way ahead, and some people has contributed like anything to grow this specialty. One special person today here, Dr. Busare sir. Sir, please. Busare sir is a HOD of emergency medicine at MGM Washi, and under him 25 MD emergency medicine people passed out. So you can think how big impact he has given for the development of this specialty. And this 25 students means you can see they are working all across few working in Maharashtra, few working in India, and the contribution and whatever means the impact which was caused due to these things is huge, and he is associated with us. He has been very much associated with us. Many people, we have organized one national conference, Semicon, in 2018. That time, sir has conducted one quick examinations, mock exam, like on stage. And that was a very popular program in that throughout the conference. And his contribution is quite big. As a token of appreciation on behalf of Society for Emergency Medicine India, we take this opportunity to appreciate his contribution and give just a token of appreciation to sir. Shweta, come. आ जाओ, सब लोग देंगे हम देंगे, आ जाओ, प्लीज सर, तू भी आ जा। Thank you very much. Sir was very busy today, but he spared time and came here for 15 minutes. And we request sir to talk with us with a few words of wisdom and experience. Thank you, sir.
How many minutes?
Whatever you take.
Yeah. Good afternoon, everyone. On behalf of, I must congratulate the team today. It's a wonderful, I think, consecutive for 5 years. Yeah? Third year. Because it has been I know to organize such a small CME how much, and such a SimWar. We know it's a Maharashtra MahaSimWar itself. It shows it's need a relentless efforts for maybe more than 3 months. Because see, you need this a very coordinated approach. And first of all, I would like to thank our SEMI and Dr. Sandeep. We are associated with so many years, and as we have the same background of our region, so I'm very much thankful for giving me and as an honor for this. Let me share my things. Actually, you consider I may be the only super specialist maybe in India. There are few super specialists, maybe neurosurgery, who may be the HODM, but being a pediatric surgeon, being head, maybe I will be the only person, and afterwards also I will be the only person. I don't think, because, see, it may be the coincidence, it may be some environmental factors, so it was given opportunity to just, it was completely, I have finished 10 years in EM. I joined in 1st April 2015. So that was the days. We had 4 students. I was not aware about anything. They just told me, just you have to head the department. Nothing like that. And I know I am such a person, once I took one responsibility, I doesn't leave. So that's only thing is that, because see, there were 4 students. Next, again 1st May, again 2 students joined. So I have to first 4 and then 2. That was the journey I started. Then I still remember during that period, because nowadays their inspections are less physical, more of a correspondence. I started working hard each and everything. The factors, what are the things, because usually what happens, and these were the new department, as all of you know, it started in 2009. That was first few medical colleges, like in government, it was BJ and NHL. BJ Medical College and one municipal hospital where it was started. And there, after 3 months, I had a visit to these 2 departments. I wanted, like, I should be like those departments. So there should not be no queries. And luckily, let me tell you, we are the first to be recognized in Maharashtra as a MDEM. Started in 2013, got recognition 2016, and then it continued. And as you know, the journey continues, your hard work pays off. And our even students, see, it's not a teacher, it's a student environment. I always consider it is agent, host, and all 3 factors. So luckily the God, your blessings of God and everything, and that we again had increased seats 2020 to 5. So 2020 first batch of 5 was in COVID. That was in 2020, I had remembered, and that continued, and still it is on. So considering, so that is advantage also, because by being a pediatric surgeon, most of the time, maybe I have done PALS also, there are no boundaries for learning, I always say. It is like, always you should be, and I always say, in 2000, as Dr. Sandeep mentioned, that was in Pavi Hospital.
Yeah.
I remember there was a big, very big conference, and was wonderful, organized for 3 days. And let me tell you, even during that, I have still remembered, I sent my first year to that conference and making my lecturer to, and Dr. Sagar Sinha is not here, being now he is a professor, he did duties of a first year, and I sent all first year to Powai. Because see, more the exposure during first year, it is very difficult, I know, but I told he did the duties for them. And that's the opportunity. And today also our team is there. He's also very encouraging. So you need a team under you to go to this level. So now he joined us as an assistant. Now he's a professor since last 2 years. So see, he may be more knowledgeable because he's a medicine. So you will have, I think always this, you need all the branches. Medicine allied, everyone, surgery allied, and being a pediatric. And my wife is a gynec, so I know gynec. So if you consider, if you see general surgery, pediatric surgery, neonatal surgery, pediatrics, obs gynec. So as undergraduate, if you are very well, and at the same you have to just build your foundation on that. So, but only the thing is that confidence is the key to success. So being, no one will imagine, most of the, I used to go, arey pediatric surgeon, and how you are a HOD? If I go anywhere, see initially I still remember it. So it used to happen, but it is the journey, and that whatever for the last 10 years. I again congratulate all the participants. See, to dare to take part in. So that shows your efficiency, your knowledge and competency. That is number one. Okay, sir, some of them may be first, final, it doesn't matter. If I have those, I congratulate all the teams, those who have actively participated in this, and those who will be the winners. And again congratulate team Apollo and team Apollo for conducting such a thing. And thank you once again. Yeah, thank you.
Thank you. Thank you.
जल्दी ये बाजू आ सचिन सेंटर से बैठ जाओ नहीं गिरेगा यार में
Welcome back. So you have a 40-year-old who suddenly was brought to your emergency seizing.
40-year-old.
40-year-old.
Okay.
So you had a smart brother, immediately took a IV, gave midazolam 5 mg. He's hooked on. Now the brother is calling you because the oxygen levels are 90. Can we start the timer?
Yes.
Thanks.
So team, we have a patient who is on seizure and was arrived here. Now the saturation is low. So Dr. Avinash, take care of the airway. Put an NRB mask of 15 liters, please. Dr. Kevin, attach the monitors, please.
Yeah, monitors are already attached.
Okay. Check for response. Hello, sir. Hello.
Just been given Midas 5 milligrams.
Dr. Yash, proceed to the 5-minute survey of the patient.
Okay. Am I seeing any grunting stridor present?
Nothing.
Okay. Exposing the chest with patients maintaining privacy.
Okay.
Am I seeing chest rise bilateral symmetrical?
Yes.
Okay. I'm doing focus on
Normal, resonant, no.
all 6 areas bilateral air entry equal.
Yes.
Neck veins.
Not distended.
Okay. Respiratory rate.
Around 18.
Okay. Checking for peripheral pulses.
Are able to appreciate peripheral pulses.
Okay. Capillary refill time.
2 seconds.
Okay. For checking the blood sugar levels.
Blood sugar levels are 150.
Okay. Checking for pupillary reflex.
3 mm equally reacting.
Okay. Exposure checking for temperature.
Temperature is 98 Fahrenheit.
Okay. Exposing the body. Am I seeing any bite marks, sting marks?
No.
Any rashes?
No.
Any IV injection marks?
No.
Okay. Any smell?
No.
Okay. Dr. Deepak, I have completed my primary survey.
Okay, primary survey appears to be fine. Is the patient having any gurgling sounds or anything?
No.
No. How the BP?
BP
For pulses palpable.
Yes, all 4 pulses are palpable.
So till that we can order for the adjuvants to primary
Yes.
survey, we can get one ECG.
Yes. We can get a chest X-ray, total ECG, prepare for an IV line, get samples for ABG, blood group type and screen, CBC, LFT, RBT, please.
At the gauge, IV line obtained at the left angle to the fossa, blood culture for all basic reports including ABG, lactate and all investigations.
Okay, all investigations are sent. At the same time, you have a patient being wheeled by the triage nurse. The triage nurse seemed worried.
Okay. Dr. Yash, please take care of the patient.
Hello, may I know your name? Hello.
Her name is MahaSimWar.
Is she able to speak?
Yeah, she just said it.
Okay, will you open the mouth for me?
Why are you so stiff touching me? I don't like this.
Okay, will you open the mouth for me, ma'am?
Yeah, she's able to.
Am I seeing any obstruction of any foreign body movement or
No.
secretion? Am I hearing any grunting, stridor?
No.
Okay. I'm attaching the monitors.
Okay, monitors are being attached.
Okay.
Give me a second, monitors are being attached.
I'm sitting. Am I seeing bilateral symmetrical chest rise?
Yes.
Or am I seeing bilateral equal air entry?
Yes.
Checking all 4 peripheral pulses.
Yes.
Capillary refill time.
Capillary refill is 6 seconds.
So these are monitors.
Yes.
Okay. So Dr. Deepak, we had got one patient
Yes.
with bradycardia and hypotension.
Yes. Is there any engorged neck veins, Dr. Yash?
Am I seeing any engorged neck veins?
No.
Okay. Is any relative statement? Dr. Sunil, can you establish?
She can give the history herself.
What happened, ma'am?
Just feeling weak since couple of weeks and it's increased since couple of days.
Okay. Are you on any medications?
Yeah, I was advised something, but I don't think I'm taking since last 2 months.
Okay, Dr. Kevin, go and establish 2 dashboard IV cannulas for the patient. Start with IV fluids. The heart rate seems to be 45, it's in bradycardia, and the ECG I can see some pulses alternates also. If there is a focus, I would like to get a focus done.
Yeah, you have asked someone to get the machine. You should have the focus in next 2 minutes.
Heart sounds?
Yeah, you're able to hear S1,
Are they muffled?
Sugars?
No. Sugars are 50.
Sugars are 50. Okay, start. Dr. Kevin, you can start with IV 25% dextrose and IV stat.
Dr. Sunil, can you help?
Patient start with 25% dextrose and palatable IV.
Dr. Kevin, you can also start with lactate, 5 level IV bolus, please.
I've been having generalized weakness since 2 months. Since 2 weeks, it's not been able to make me do my routine stuff. Now it increased to a point that I can't even get out of bed. I have to come to the hospital. I'm MahaSimWar, I'm 60 years old.
The patient is having symptomatic bradycardia. You can proceed with giving an atropine. Dr. Kevin, you can give 1 mg atropine to the patient.
Yeah, I mean people say I'm fat.
Atropine 1 mg IV given followed by 10 ml IV flush.
No, I don't recollect when was the last time I had fever.
Can you tell me the series of today's
Like I told you, I wasn't even able to get out of bed. I was feeling so weak. Yeah, I have been taking routine
Blood
food.
collected for routine investigations, ABG, lactate, and sent to the lab for investigations.
No, that's it. No, I didn't take. In fact, my relatives were shouting me that I should have taken medication.
First dose of atropine.
No change. Same vitals. BP has been refreshed.
Yeah, you can proceed.
Thyroid medications, I've forgotten the name. It's been 2 months.
So the patient is a known case of thyroid disorder. He might not be taking the thyroid medication as of now. That's why there is bradycardia, hypotension and all. So we can.
She also mentioned that she is called fat elevated, so maybe she can take exhilarating.
The patient is called fat. So for that the patient might be taking extra dose of thyroid also. And also we'll see. So we should do a TSH for the patient. Sodium, potassium, everything, labs, any ABGs available as of now?
I think the blood gas is done. And focus you had asked.
Okay.
Next slide for focus.
Okay. Yes, there is free fluid around the heart. Yes, there is a pericardial effusion might be causing tamponade. So doctors will proceed for pericardial arrest for the patient.
Yes, I've drawn my degree. I'm preparing a sterile area in around the chest.
Yes, Doctor Avinash, you can proceed to the patient. You can start with NRB of 15 liters. Prepare for intubation also.
No, I don't want a needle poking into my heart.
Ma'am, is there any way to available to the patient?
Yes, in next half an hour.
Ma'am, this is very important
Yes.
that we do it so that we can save
Dr. Kevin, you can start with the IV fluids.
not have any pain.
She's refusing for pericardial synthesis.
Yes.
The patient is refusing to take that.
Ma'am, okay, ma'am. You have a condition in your heart in which there is collection of blood around your heart that's causing you to go into cardiac arrest. So the BP is coming down, the heart rate is going down. So I want you to consult for the procedure so that we can save your life.
Why don't you recheck my BP? Many times I've seen your cuffs give erroneous readings. I don't believe my BP is less. I'm too alert to talk to you.
Okay, I will check again on both upper limbs.
Same, 60-40.
Both upper limbs same?
Yes.
Both upper limbs BP is same 60/40.
Yes, and you see there is pericardial effusion. Yes. You have focus on.
Sorry, what do you want to check? Yeah. Can I have the focus images for aorta?
Yes.
We should reassure about the patient first.
Yes.
Yeah, that's your aorta. What you can see.
Just, Dr. Singh, I'd like to talk to you about the procedure again. I understand that you feel very afraid.
She's demanding for another doctor. She's not happy with someone pushing her to let a needle be poked. She's asking for some other doctor to see.
Yes, but I understand. I can get a single doctor to see you soon. I just want to reassure you that the needle will not be going to your heart, but only outside, just outside, just to get it pulled out.
Just as she's about to get angry, she goes into seizure.
Okay. So team put the patient left after position. Dr. Kevin, you can give forums.
Your first patient is starting to get awake and shout.
Lorazepam 4 mg IV given step followed by 10 ml.
आप अभी हॉस्पिटल पे हैं आपका रिलेटिव ने लेके आया है
कौन लाया यहाँ पे?
डॉक्टर यश कैन यू प्लीज हेल्प विद द पेशेंट
क्या कर रहे हैं मेरे साथ?
कुछ नहीं कर रहे आपको इधर लेके आया था
नहीं घर जाना है मेरे को.
हाँ आपको अभी भेजेंगे थोड़ी देर हो
यस
क्या कर रहे हो मेरे भाई को?
आपके बाइक को सीजर आया था इसीलिए आपने
सीजर क्या होता है? हिंदी में बात करो, इंग्लिश में.
but seizure is still going on.
क्या सीनियर डॉक्टर कौन है
Still seizing.
क्या हो रहा है कोई ध्यान नहीं दे रहा है मेरे पेशेंट के पास
Yes. Yes, yes, with the successful seizure medication, give Levipil. 3 grams IV we can give.
Given no
मैं घर पे सो रहा था
still seizing.
Yes, still seizing. Yes. So Dr. Avinash start preparing for advanced airway to the patient. Okay. Remotion patient start for advanced airway.
क्या हो रहा है देखो
Yes.
Patient is still seizing.
लेके जाए क्या हम लोग दूसरे हॉस्पिटल लेके जाते हैं आपसे
Suction has ran away.
It's fine. Come.
Still seizing. Mouth opening, one finger.
Yes, second line, third line, you're planning for individual intubation. Start with individual intubation.
Cannot extend the neck. He's fat, not laryngoscope not going in.
Okay.
Limited mouth opening.
You can start with at a secondary airway, IGEL or LMA if you are available. Please proceed. Yeah, this is IGEL and LMA. You can proceed.
IGEL not going in. One finger
Before doing that, we have given proper force for the patient. Now give a muscle relaxer to the patient. You can give Bedasolum, successful choline 100 mg IV stab.
especially sedated, we can plan for pericardiosynthesis
followed by 10 ml IV flush.
Sorry, what was given? Bedasolum?
No, successful choline.
Okay. Mouth opening improved. 3 fingers. Cannot visualize the chords.
Please give me the suction. After suction, am I able to visualize the chords?
Nope.
We can't visualize the chords. Can I see the epiglottis now? No epiglottis. Okay. Now we can put in the LMA right now. Put in the LMA. Am I able to ventilate the patient?
No. Don't see any chest rise.
Okay, the patient is not ventilating. So Dr. Sunila, prepare for front of neck acceleration. Prepare for the please.
Okay. No.
Please proceed with
BM. Audible. I'm trying to fetch it.
Okay, till that we will remove the patient.
Okay. With bag mask, is there an air entry?
Check the saturation.
The saturation is not improving.
No. You have asked, you want it? Okay, you have asked someone to get it. It will take 5 minutes.
Yes, team. The patient is still seizing?
Yes.
The patient is still seizing. So give Bedasolum 5 mg to the patient. Yes.
Injection Bedasolum 5 mg given IV stab followed by 10 ml flush.
Patient needs a secure airway. So is he able to ventilate the patient now? No.
Relatives will reach in next 45 seconds. It's on his way.
We have a video laryngoscope.
You don't have it in the department.
So ventilate the patient as of now.
Yes.
The saturation is going to be not able to ventilate the patient. I think we should go for emergency medical as of now, right away. Yeah, you can. Is the needle available? Yeah. Start with the needle decomposition. Can I get a flush I'm seeing in the.
Where are you puncturing? Where are you puncturing?
Tapping the thyroid cartilage.
Okay.
Over the thyroid.
Okay.
Just tapping.
Time's up. Sorry. So how was it? Sorry for making you work in a resource constrained. So how was it? Cases? Easy?
Challenge.
What was this? Okay. So what do you usually expect in mixed edema? What do you expect in mixed edema coma? That is the obvious. Yeah, that needs to be done. Okay, we will debrief that. And this case?
That was a patient positive face.
What was it? Who had the word with the angry brothers? So what do you feel it was? Your impression is important. Forget what it is. What do you feel? It's okay. Even I'm not willing for things if I come as a patient. What is your impression? What do you feel it was?
Regarding patient.
Clinical impression. Oh, fine. Thanks. वो बीच में रखना है वैसे बीच में रखना है अफनाज विल बी कंफर्टेबल ले लेना और वो बैठने के बाद करना
Voting. Those who have the voting fingers. You are pressing, huh? रेडी है ना सर
सावन सावन बगिया बगिया यूं भी होता है कि पत्थर पे भी है फूल खिले
My life is in this town, and I ain't going down. You think that I am crazy, but I don't want the crown. My life is in this town, and I ain't going down. You think that I am crazy, but I don't want the crown. Just an ordinary person.
आपको भी स्टेज पे जाना है आ जाओ 2 मिनट देखते सॉरी वी डिडंट नो द जजेस
Mic.
Hello. Hello, ma'am.
On. Huh. Hi team. So you have a 26-year-old male who's had an anterior shoulder dislocation. He was reduced using ketamine, and you were called by the nursing staff because the saturation was dropping down. So here he is.
Okay. First of all, I would like to allot the
Timer, please.
Okay, allot the team. Rishi be on the airway, Harman be on the breathing, Saloni be on circulation, Aman be on the disability for the time being. Can you please connect the monitors? Okay. Excuse me, sir. Hello. Can you hear me, sir? Okay, sir. Can I know your name, please? Okay, fine. Patients having a decreased saturation. Okay, fine. Patients having decreased response. Fine. Airway. Can you open your mouth, sir, once? Okay, fine. Airway is not able to phonate. Airway is patent. He is able to phonate for the time being. Can we know? Can someone please go and take the history once? Aman, can you please go and tell the history?
What is the mechanism of injury?
So he was playing cricket and he had a dislocation. It usually keeps happening.
He has recurrent dislocations. Yeah. Was he playing any sport when this happened, or just
playing cricket?
He was playing cricket and he just had a dislocation while doing batting or something like that. Okay, fine.
Bowling.
Okay, can we please connect the monitors? Okay. Can I please know the vitals, please?
That's on the monitor.
Okay. Can you please start oxygen via simple face mask for the patient at 10 liters per minute? Saloni, can you please secure an IV cannula and collect blood samples? Please get an ABG done, get a CBC done. Okay. Can we please put an NPA for the patient? Okay. Can we please auscultate the patient and let us know the findings, please?
What do you want?
Auscultatory findings.
Air entry is clear.
Okay.
Clear, equal, clear, clear and equal.
GCS.
You can check.
Excuse me, sir. Sir, can you lift your hand? Sir, can you open your eyes? Sir, can you open your eyes?
It's responding to deep pain.
Okay. So okay, fine. So the GCS is fine. Okay. Currently, we would also like to send for a tox screen with the blood samples. We are suspecting maybe a ketamine overdose right now for the patient. I would like to start the patient on IV fluids.
IV fluids connected.
Did he have a history of fall while playing?
No, he didn't have a fall.
He didn't. Vomiting?
No vomiting.
Loss of consciousness?
No loss of consciousness.
Seizures? Any bleed?
No seizures. No.
ENT bleed? Any ENT?
No ENT bleed.
Okay. Ketamine. Okay. Ketamine toxicity. Ketamine.
You can feel it bounding. You have a patient that you've received, another patient, a young female, seems weak and lethargic.
Okay.
That's your patient.
She's the patient? Yeah. Okay. Saloni, could you please go and assess the patient for the time being, please?
You can assess. You can ask her. She's talking. I'm feeling very tired. Extremely tired. So it was just okay 2 weeks back when I started having some abdominal discomfort, loose motions. And since I was just 2 weeks, since I was just, I thought I was getting okay, and then I started vomiting in the last 2 days. Not really. Monitor is getting connected. Your team, your ears.
Whatever the vital signs, common breathing.
It's getting recorded. 35 degrees Celsius. sent for investigation. It's getting loaded.
Tenderness is there.
No tenderness.
Insert to ideal alcohol, can you start the fluids?
Fluids connected.
Can I have the EPG please?
It's taking time.
I will just go and help them out since the patient is
Alright.
How much GCS?
GCS, you can check. She's talking to you.
Rishi, can you please give me an over for this patient?
This lady was not this
Nurse, what are you doing, ma'am? Just lethargic and tired. Why are you pinching her?
Where am I? Where am I? Who are you?
Your patient has started seizing.
What is that thing?
Can we have the lab?
Yes, sir.
2 mg of lorazepam, please.
Who are you?
Lorazepam, please.
What is doctor?
Level given.
Lorazepam given.
Don't care.
Lorazepam given. How much? Seizure is still continuing.
Okay, can you give another dose of lorazepam, please?
Okay, seizure stops. Yes.
Is
D25 connected.
have we started the patient on fluids?
Fluids is already being done.
Okay, how much? 30 ml per kg per hour? How much fluid has been given still?
You have given.
2 pints.
Okay.
We'll have to check the IVC first. We'll have to look for the fluid status of the patient and decide on that to start the 3% NaCl as well.
Okay. Lorazepam 2 mg for this patient.
Can we have the machine, please? We wanted to check the IVC for the patient.
Can we have the IVC?
Yeah. Can we please load 3% NaCl as well for this patient?
Okay.
So the IVC.
At what rate?
Okay, the IVC is collapsing. We would like to give him fluid for the time being now. We'll give another 1 liter of bolus and reassess and start the 3% NaCl at 10 ml per hour on an infusion.
3% saline connected.
Okay. Can we have the ECG rhythm, please, for the patient? The patient is highly tachycardic.
She has a PR prolong.
There is tall T waves in this ECG. We would like to give anti-K cycles as well. We would like to give 3 cycles of anti-K as well. That will be calcium gluconate along with salbutamol nebulizations and insulin with D25.
How much of calcium gluconate? Can you please
10
specify
ml
the
of
dose?
10% over 10 minutes.
Okay, calcium gluconate given.
Okay. Is there any?
Yeah, you do.
Okay. Yeah, we've started 3% NaCl. We've given fluids. Is there any improvement in the patient's status?
Yeah, it's coming up on the monitor. The patient starts seizing.
Again?
Yes.
Okay. Again, we'll have to give left lateral position. Can we get 2 mg of lorazepam? Again. And we've loaded the patient with Levipil already, right?
Okay. So total of 6 mg lorazepam has been given.
Okay. Is the seizure stopped yet?
No.
Okay. We would like to give another 2 mg of lorazepam. Total of 8 mg will be given then.
Given.
Okay. Has the seizure stopped?
Yes.
Okay, fine. So we'd like to keep the patient in left lateral position, give a prop up. Leveracetam has already been given?
Yes.
Okay, fine. We would like to load the patient with another anti-epileptic. Most likely sodium valproate. We would prefer sodium valproate for the patient right now.
Okay.
Okay, and we would like to continue with the resuscitation with IV fluids and
IV fluids is ongoing.
Okay, and 3% NaCl as well.
Yes.
Okay. We would like to secure a Foley's catheter as well to look at the urine output.
They are preparing for the catheter.
Okay, fine. Is there any improvement in any vitals for this patient?
No, the BP is getting.
Okay, I would also like to start
The
the
patient starts seizing.
Oh God. Okay, fine. Okay, we'll give up this again. Fine. Okay. We would like to give another. We would like to start the patient on midazolam infusion at this point of time.
Okay.
Okay.
Midazolam infusion is getting ready.
Okay. We would like to intubate the patient during that time
She's
as well.
seizing.
Yes. As this is status epilepticus, we would go ahead with intubation.
Okay, she's still seizing. It's still not come.
We will give propofol to the patient and get on the head and intubate the patient.
1 second. Yeah.
We will give propofol and we will sedate the patient and intubate the patient.
Propofol is given.
Okay.
Yeah, after the
Okay,
propofol.
I would go ahead on, I mean, Saloni, Rishi, can you go on the airway and intubate the patient?
Okay.
Yeah.
Can you please describe what you're doing?
Okay, Saloni, can you please, IV fluid is on, IV cannulas, and can you please load propofol, get the suction, get the laryngoscope, get a bougie, get a ambu as well for the patient. Is there a bougie?
No.
Also, please keep an LPA. Also, please keep a LMA also ready, just in case we're not able to intubate the patient. And start the patient on oxygen till then. Okay, take it.
Oxygen has been started.
There's no bag and mask. Bag and mask nahi hai. No, there's
The
no.
patient starts to seize again.
Oh God. Okay. We'll give another. Leveracetam. Another 2 grams of leveracetam.
2 grams of leveracetam is getting loaded.
Okay. Is this that the BP of the patient?
Yes.
Okay. Can you please start the patient on inotropes for the time being? Noradrenaline 8/50.
Okay. Noradrenaline started.
Okay. At 4 ml per hour. Okay, fine. For the seizure, leveracetam has been given?
Yes.
Okay.
3 grams by now.
Okay. Has the seizure stopped?
Yeah.
Okay. Can we please go ahead? Okay. Has the BP improved? Okay. Can you please ambu the patient?
Ambu is ongoing.
Okay. Okay. Let the saturation improve. Let the BP improve. After that, we will intubate the patient. Is everything ready for the intubation? Is there any improvement in the vitals?
This is what you see.
Okay. Can we please increase the noradrenaline? Increase to 6 ml per hour.
Okay.
Fluids are still ongoing. Fluids are still ongoing.
Okay.
Okay, still there's no improvement?
That's what you see.
Oh, okay, fine. Okay, we would like to increase to 10 ml per hour and start the patient on another inotrope.
Okay, your patient starts seizing.
What am I supposed to do now? I would give another dose of propofol, please.
Okay, how
and
much?
start the patient on infusion as well.
How much of propofol?
20 mg per kg.
Okay.
Has the patient stopped seizing?
After propofol, yes.
Okay. Is this still the vitals of the patient? No improvement?
Yes.
Okay. We've started on noradrenaline, vasopressin. IV fluids are still ongoing for the patient?
Yes.
Okay. Fine. Okay. We would. We are still giving boluses, right? How much fluid has gone? Approximately 2 liters.
Yes.
Okay. Can we give? We can still give another 500 bolus, please.
Okay. Going.
Is there any improvement in any vitals?
What do you want?
BP and saturation both.
BP is 70/40.
Okay. Saturation.
Saturation has come up to 80.
Okay, fine. Can we increase the NORAD again to 15 ml per kg and vaso also to 2.4 ml per hour? Sorry, NORAD to 10 ml per hour and vaso
That's
to 2.4.
already going on.
Okay, so 15 ml per hour and vaso to 2.4 ml per hour.
Okay.
Is there any change in any parameter?
Not yet.
Okay. Can we please put an OPA for the patient till then? Okay. Is there any improvement?
She has a gag and she vomits.
Oh God. Okay. Please give her a left lateral position. Okay. She vomited because of the gag reflex. Is what you said? Okay. Can we please get an NP as well? And can we please load a 2 mg of ondansetron and give it to the patient?
The patient has started to seize.
We've started on propofol infusion. We can increase the dose. Can we please increase the dose to the?
Okay,
of the
dose has
infusion?
been increased.
Okay, is the patient
She's
still
still
seizing?
seizing.
Okay. We'll go ahead with another drug. We'd like to give. We'd like to start on ketamine infusion.
Okay. Ketamine infusion. Time's up. What is going on?
Horrible.
I think too many things going on at one point of time. Did you check the electrolytes?
For this patient,
What
right?
was that?
Yeah, hyponatremia and hypokalemia.
And?
So we have given D25. We already
Does
gave.
that strike something?
3% initial solubility.
Okay. Anything else?
Adrenal crisis.
We have to
Hydrocortisone.
Yeah. We debrief on that.
It's going to kill.
Can we have a photo, please?
Sorry?
Y'all can line up yourself for a photo. किसी को भी नहीं आ रहा है मैं प्रसाद को बोल रही हूँ वाइटल्स थोड़ी देर और
तू 6 महीने पे क्यों लेके आ रही है 6 मिनट पे उसको इमरजेंसी क्यों करवा रही है अपना डिसाइड हुआ था 10 मिनट के बाद जब 5-6 मिनट बचे रहेंगे तभी तो 6 मिनट पे उसको करवा रही है इसलिए देखो टाइम नहीं मिल रहा फिर मतलब यहाँ पे टाइम ज़्यादा जाए
बट कोई देख क्यों नहीं रहा है
क्या
एड्रेनल करो
What do you feel? Don't worry, don't see the monitors. How are you?
Good.
Okay, so you have a 40-year-old male who was brought to your emergency complaining of convulsion. He was immediately taken in your resus bed, IV and midazolam 5 mg. Now the brother has called you because the patient is desaturating.
Okay. So, team, we have this 40-year-old male who's come with a history of seizures. He's already been given 5 mg of midaz.
Start the timer.
He's desaturating is what we've got. The news. So let's just sanitize ourselves, wear gloves. Let's quickly assess the patient. Sanket, Dr. Sanket at the airway, please. Dr. Simonthini, can you assess the breathing for me? Dr. Aishwarya, please establish IV. Okay, I think IV is already in place.
Yeah. Whatever you need to ask, I'll answer.
Dr. Ravindra, please be at the defib.
He's just been given midazolam 5 milligrams.
How is the airway? Is the patient talking?
Just been given midazolam.
Alert, conscious? No.
Just been given midaz.
Is there a pulse? Can you check the pulse?
Yes, pulse
There
is
is a pulse. Saturation is 90. Dr. Sanket, please go forward with the oxygen mask and start O2 at 4 liters per minute. How is the breathing, Simantini?
Breathing at a rate of 14.
Meanwhile, Aishwarya, can you get me Okay, is the IV secure? Can we send for some blood test?
Okay.
Can we get a blood gas with lactate, electrolytes? Do we have any history? Oxygen started?
So his relative should be here in next 5 minutes.
Okay. Patient is not actively seizing. Patient is still drowsy. Team, what can we do next? So first dose of, can we get the sugars?
Sugars are 150.
Sugars are fine. Electrolytes, ABG is still
You're
going to
waiting
take
for the
some
blood
time.
gas to come. Should take another 2 minutes.
How is, yeah, we want to check for the pupils and assess the patient again.
Pupils are 3 mm equally reacting to light.
Equally reacting. Is the patient conscious? Is the patient reacting?
He's just been given midaz
Again, okay.
2 minutes back.
Okay. What next, team? Okay, so we'll go forward with the neuro examination, GCS, post-ictal state. We have established the IV, given some midas. Yeah, we would want some more history. Why was he admitted
Yeah, so
here?
the brother should be here in some time.
Okay.
You have already intimated him.
Okay. Till then, I think we'll plan for a EEG and maybe we can plan for an imaging. We would also like to communicate to the neuro team and inform them. Yeah, how is the temperature? Is there any fever?
Temperature is 98 Fahrenheit.
Okay. Breathing was equal. Per abdomen, we'll just do a quick system examination
He
also.
doesn't seem to be wincing in pain or anything.
Okay, peripheral pulses are equal.
Yes.
Any rashes on his body?
No rashes,
Has
obviously.
the relative arrived for the history?
There is another patient being wheeled in by the triage nurse. He seems to be worried about the patient.
Dr. Sanket and Simantini, can you please go and assess? Meanwhile, this patient is holding SATs, not actively. So we'll go forward and start an anti-epileptic medication.
Okay.
Can we give levetiracetam 1 gram?
Okay, started.
Okay, anti-epileptic started.
She's
we'll
talking,
plan for
60-year-old female.
Okay. Meanwhile, we would plan for an EEG and want to do a imaging.
Okay. Patient is in the EEG now, should be back in some time.
Okay. I think you can be here, continue the bag valve.
Yeah, she's talking to you. There's some generalized weakness, nausea and vomiting.
Okay.
My name is MahaSimWar.
Has the ABG arrived for this patient? No, not yet. Are we missing on something? Neuro patient
Okay.
post-ictal med.
Vitals, you have
ABG,
attached
nothing is
monitor.
available.
The vitals are loading.
Okay, this patient's heart rate is dropping. Is there a pulse? Check
No,
a
this
pulse.
is the vital of the second patient being attached to the monitors.
First patient, is there a pulse?
Yeah.
Okay. We'll give some IV fluids. Can we, we'll start 1 pint of IV fluids for the first patient.
First patient has gone for EEG. You asked for
Okay.
a EEG, he's been shifted to EEG. Should be back in 5 minutes.
Okay. Meanwhile, at the EEG, we would like to start him on some IV fluids. Can we get some? Can we shift the patient back to ER?
Yeah, once EEG is done, definitely.
Okay, we would want to stop the EEG and we would want to
Okay,
bring
EEG
him
stopped
back.
and the patient is returned to ER.
Okay. Can we get a point of care ultrasound?
Okay,
Just to assess
you're getting the
heart
ultrasound
and-
machine. It's busy somewhere.
Okay.
How much? Given 200 ml bolus.
What can we do, team?
No.
This patient. Heart rate is dropping.
Given.
What are the focus findings?
Machine is not available yet. It's busy somewhere. ECG is the same rhythm on the screen that you see.
Have you started some
Yeah, she says that she's on something, but she hasn't taken since 2 months. All her relatives keep cursing her. Why didn't you?
is the heart rate of the patient. What are the vitals of this patient?
Stable.
Okay, this patient is stable. Okay.
Okay.
Can we get the vitals? It's fine. This patient is fine. I'll go and see that patient.
Okay, Romaninize
Sorry to interrupt. Can you just tell me what is happening here? Okay. And how old is the patient?
60.
60-year-old on some medication. Okay.
Yes.
Yeah, are her sugars fine? Is she on any medication?
You will get a point of care ultrasound.
Okay, her BP is crashing. You have to. Okay, so.
Given.
This is this patient.
Yeah.
Fast is fine, abdomen is fine. We have given a 1 pint, we can give a 1 more pint of fluid. Okay, there is a tamponade. So we will plan for pericardiocentesis.
Sorry? EDM nauseous since 2 months, increase since 2 weeks, unbearable since 2 hours.
So we have a course, we plan for cardiac tamponade. We will plan for pericardiocentesis. Yeah. Do we have a specialist team or can we? So we will go forward at ultrasound guided. We want to go with pericardiocentesis. At the Ziffy sternum, we would introduce a large bore cannula. We would want to get the pericardiocentesis.
No, she is conscious enough. She is talking to you.
Yeah, and under ultrasound guidance, we would want to. Yeah, please. Relative and patient also. Yeah. So ma'am, your BP is falling down because there's fluid around your heart, and we would want to do a procedure that would relieve your heart of this tension, and we would want your consent for that. We will be giving you some small medication to anesthetize you, and then we would want to do this procedure. We will be giving you one injection which will be injected from your tummy, and we would want to drain out the blood that is collected around your heart.
Patient is refused for the procedure.
Okay, is there a relative?
Should be there in next 7 minutes.
We want to call the cardiac team and...
Cardiac team is during a bifurcations last year, will not be available for next half an hour.
Okay, meanwhile, yeah, we would want to start the patient on oxygen and NORAD support. Can we go for
starting NORAD.
Yeah, has this patient's relative arrived?
Not yet.
Okay.
But the patient seems to be getting more alert.
Okay, so patient is...
Patient is getting more alert, patient 1, starting to shout.
Okay, so rather than just ask him, this patient.
कौन लेके आया मेरे को यहाँ पे? कौन लाया मेरे को यहाँ पे?
Patient 1 is relative has arrived.
भैया देखो मेरे को क्या कर रही है?
Patient 2 is seizing. Patient 2 is seizing.
4 and 0 Razapan. Start IV bolus.
क्या इंजेक्शन दिया मेरे को? सीनियर डॉक्टर से बात करने को
Has the
कैसे क्या लाया मेरे को यहाँ पे? क्या हुआ यहाँ पे? नहीं मेरे को घर पे जाना है। देखो हालत देखो पेशेंट का कितना सीरियस है।
Patient 2 is still seizing.
We go forward and take second anti-epileptic medication.
Still seizing.
Still seizing. We'll go with rapid sequence intubation and Sandeep kindly intubate this patient and connect him with the ventilator.
कुछ भी नहीं हुआ है मुझे घर पे जाना है।
Still seizing.
Is the intubation done? This patient. Which patient is seizing?
Bed
Bed
2 is
two
seizing.
is seizing. Bed 1 is stable.
One finger in the mouth opening. Laryngoscope is not
We will give some anesthetic medications. Can we go with ipomidine, some rocuronium, some just check the suction, oxygen, given intubation.
mouth opening, 3 fingers.
Okay.
Cannot visualize the cords.
Okay, difficult intubation. Can we get a bougie? Can we get a bougie?
Yes.
And we will try with the bougie. Again, we will intubate.
Bougie is not going in. Desolution intubation.
Okay, desolution intubation. We'll again come and try. Okay, continue patient.
Patient is still seizing.
I'll try intubation once more. Second attempt of intubation. Then we'll go with an advanced level. Subrocular device, LMA or something. Is there an LMA?
Yes, there is element.
Has this patient's relative arrived?
Not yet.
Is the LMA in place?
LMA is in place, but check the SpO2.
Okay, LMA in place. Can we connect an ETCO2?
Yeah, ETCO2.
LMA inflated. LMA inflated.
Check the ETCO2 value also.
Okay. So hypoventilation. Can we continue back valve mask?
Yes, you are right.
With the LMA in place.
आपको पता है मैं कौन हूँ?
How was the breathing of this patient?
Your paralyzer is purely back mask, but very poor chest rise.
Do we have a chest X-ray?
Yeah, they are just with the machine
Okay.
in next 2.5 minutes.
Okay. Do we have the VBG of this patient?
VBG, yes. Can we have the VBG which was sent
Is there a pulse?
pre-paralysis?
For this patient, is there
Yeah.
a pulse? There is pulse.
Yes, there is
Okay,
pulse.
there is pulse.
45. This is your blood gas.
Okay.
Patient is still seizing.
Patient is still seizing.
Still
Give a
seizing.
paralytic. We'll give in. Okay. We'll phosphonatoin. Second.
Okay, how much?
Uh, 1.5 gram.
Okay,
Phosphonatoin.
fine. Giving phosphonatoin.
Airway. Can you show the focus of the lung again?
Yes, focus please.
Was there a
There was
history?
poor chest drive.
Okay.
History is that she came in with nausea, vomit, and distress. And there was she's not taking a medication that she's supposed to be taking.
So pericardio to hai. Okay, there is tamponade. And the lung?
Lung focus please. Next.
Intubation is not
Next.
successful. Yeah?
Thanks.
Lung sliding is present. So airway is fine. I think our priority should be intubation again. Okay. So bag valving also there is no rise. So we'll third attempt of intubation also failed. One more
No,
attempt.
you're not. It's a esophageal intubation
So
again.
we'll go forward with the.
The patient
surgical.
seems to be pretty fat with short neck.
Okay, then we'll go forward with surgical. Yeah, cricothyroidectomy. Ash ho raha hai na.
There's no crick set.
Then we'll
There's no
continue with
surgical
bag
crick
valve.
set.
We'll continue bag valving the patient. Doctor, yeah, just continue ambuing the patient. And
The relatives come.
yeah, any relatives?
They are there. They should be here in 30 seconds.
Okay. And has the seizing stopped?
Not yet.
Not yet.
Still seizing.
What else?
We'll sedate her.
Sedate. So, yeah, we would want to sedate the patient.
Sorry?
Midas or Fenta infusion, we would want to ask for
Okay,
a Fenta
started on
infusion.
Midas and Fenta infusion.
And bag valving.
Time's up.
Okay.
Thank you. What do you feel it was? What was this patient? Your clinical assessment. He absconded, that's a different thing.
So, yeah, we were guessing.
I just need your guess whether right or wrong it's a material.
Post-ictal, he was in post-ictal
Post-ictal,
state when he
alcohol.
came. Okay.
Withdrawal,
Yeah.
intoxication.
Intoxication.
Withdrawal, okay. This
withdrawal.
patient?
This was cardiac tamponade.
Tamponade, okay. And anything else?
Breakthrough seizure is not compliant with her medications. She's probably on antiepileptic.
Which medications?
Antiepileptic. Maybe that's why she's starting.
Okay, fine. We'll debrief later on. Thank you. Thank you. Ravish, photo.
Oh man.
Hello. Hello. Yeah. Hi team. So we have a patient who is 26-year-old, had a anterior shoulder dislocation. It was reduced using ketamine. And the saturation dropped after that, so the nursing staff has called you to see.
Okay.
The patient is here.
Hi, good morning team. I'm Dr. Nikita. I'll be the team leader for the day. Dr. Vishal, you will be the in charge of the airway. Dr. Shiksha, you'll be taking care of the breathing and disability. Dr. Rizvi, you'll be taking care of circulation and exposure. Dr. Franklin, you will be administering drug. Let's start with the primary survey. Let's speak with him.
Sir, क्या नाम है आपका? Is my patient talking in two sentences?
You'll have to speak with him. Okay. Okay. Let's connect him on a oxygen with NRBM. And move ahead with the breathing. Check for the bilateral air entry.
Yes, you do.
What is the saturation right now?
It's
After the oxygen, it's on the monitor.
okay. It's 97. And the RR of the patient is?
14.
Okay. Moving ahead with the circulation.
What is the capillary refill time of my patient?
Less than 2 seconds.
What is the heart rate of my patient on the monitor?
There on the monitor.
All right. What is the blood pressure on both arms?
That's what you see. It's same.
Okay. Okay.
What is the rhythm of the
Coming up.
Okay. Let's secure an IV cannula 18 gauge, preferably in the cubital fossa, and give him a 500 ml of fluid right now. Moving ahead with the disability. He's breathing.
Do we have spontaneous eye opening? Sir? Reacting to pain?
He's responding to deep pain,
Okay.
Is it speaking?
mumbling words.
Obeying commands, sir. Can you show me your tongue? Can you show me
Yes, he is.
Okay. Please check for the pupils immediately.
Bilateral equal.
Okay. The sugars of the patient would be?
70.
Okay. We have an 18 gauge IV line already, Dr. Rizvi. Okay. Let's give him a D25 or 100 ml right now. And moving ahead with the exposure.
98.7 degree Fahrenheit.
Any pain score that he can elicit?
You can check.
You can ask him about the pain. He does have a pain? No? Okay, fine. So can you ask him any kind of drug allergies that he must have had? Do we have any relative along with him?
No, you don't have.
Okay. So I'll just move ahead and take a history of present illness. Can I get a history of present illness for this patient?
What do you want to know?
I want to know the entire medical background of the patient and how did this happen?
There's no medical background, not known.
Okay, and how did this event happen?
So he was playing cricket, he was bowling, and then he had a shoulder dislocation.
Okay, does he have any kind of drug allergies?
Not known.
And after that shoulder dislocation, he was taken to a hospital, it was reduced, he was given a ketamine as a procedural sedation.
Yes.
Okay.
So team, there's another patient who's pretty weak and lethargic. She's there.
Okay. So Dr. Franklin, can you please calm down? Dr. Vishal, you be with the patient. If there is any instability in the hemodynamics, you can please let me know. Okay. I'm trying to assess the patient. Is the patient talking to me? Is the patient responding?
You can talk to her.
Hi, ma'am. How are you? What's your name?
Oh, I feel terribly weak. I've been vomiting.
Okay. How many episodes of vomiting has happened?
I cannot keep anything. It's been 4 episodes since morning.
Okay, let's connect her on the O2 with 15 liters of O2 via NRBM and secure an IV line for the patient. Give her an ondansetron 4 mg. Connect her on a liter of fluid. I'll just move ahead with the breathing part. How is the chest rise equal?
Yes, the chest.
Okay,
rise.
and how much is the respiratory rate for this patient?
It's 20.
Okay, and the saturations?
It's coming up.
Okay. And I'm moving ahead and checking while the saturations are coming up. I'm checking for the capillary refill time of the patient. How much is it?
It's around 5 seconds.
Okay. And the heart rate of this patient would be?
It's coming up on the monitor.
The blood pressure? It's 144.
It's getting recorded.
Okay. Okay. She is in pain. Let's give her an injection morphine 1.1 mg per kg. Let's load all of that and give her 2 mg stat right now. We will reassess the pain score after that. And moving ahead with the disability part, I'm checking for the eye opening. There's spontaneous eye opening?
Yeah.
Okay. The verbal response, she's able to communicate with me?
Yes, she is.
And motor response, she's been able to move all her forelimbs?
Yes.
Okay, fine. The sugars of the patient would be?
50.
Okay, let's give an injection D25, 100 ml to this patient. I'm checking for the pupils. Bilaterally, is it equally reacting?
Yes,
and how much? What's the size of the pupils?
2 mm bilaterally.
Okay, fine. The temperature of the patient would be?
35 degrees Celsius.
Okay, let's warm this patient up a little. Okay, and moving ahead with the pain score. After giving morphine, has the pain decreased?
She never complained of pain.
She said she's feeling terrible.
She's feeling weak
Okay.
and lethargic.
Okay, okay. On exposing the patient, do I see anything specific? Any
What are
kind
you
of
looking
rash, any ecchymotic rashes?
No
any
rashes.
Any pedal edema?
No pedal edema.
Okay. Can I get a history of present illness? Someone is there along with her?
She's talking to you.
Okay. Hi, ma'am. I'm Dr. Nikita. I would want to know what exactly has happened. Can you please give me the events? What has happened?
So it was all right 2 weeks back when I just started some abdominal discomfort, loose motions and vomiting.
Okay.
I thought I was getting better, but I've been just puking in the last 2 days.
Any history of fever so far?
I had it for the initial first week. After that, none.
Okay. And when was the last period, ma'am?
2 days back.
Okay. Fine. I would want to get a secondary survey done.
Okay.
Yeah. Dr. Shiksha, can you please come down and help me out with the secondary survey of this patient?
Do we see any head injuries, scalp
No head injury.
She
looks weak.
Okay. And any bleeding from nose, ears?
No bleeding.
Mouth?
No.
Neck masses?
No neck mass.
On observation, the patient, what do I hear? Chest has some possibilities.
It's clear? Clear, equal. Okay, this blood pressure which is there on the monitor, is it for this patient?
Yes, it is.
Okay, we have rushed a liter of fluid for this patient. Can we get an EVG on her?
It's coming up. Okay, next 30 seconds.
We have given a liter of fluid to the patient already, and we have covered the patient up. We are trying to warm. We have connected the warmers, and please continue with the secondary survey meanwhile, and we will reassess the blood pressure.
Yes, you do. No murmur.
Abdominal examination soft or distended?
Yes, it's soft, not distended.
Any tenderness?
No tenderness.
Organomegaly?
No organomegaly.
Hernial orifices are normal?
Sorry?
Hernial orifices are normal?
Yes.
Any fetal edema?
No fetal edema.
Okay. On the neural examination, the tone of the muscles normal, able to move all
Yes, they remove all full limbs.
Latitude of 3.1. Okay. Fine. So let's reassess the primary survey quickly. I'm trying to talk to the patient. Is she talking to me fine right now?
Yeah, she's become weaker now.
Okay,
Can we have the next set of vitals?
Sorry?
Next set of gas.
The next set of vitals, the heart rate, the blood pressure?
Yeah.
Okay. So the patient is tachycardic. I want to know more about this. So breathing, the respiratory rate of the patient would be?
22.
Okay. And after giving a liter of fluid, has the blood pressure come up?
BP is come up to 70 to 50.
Okay. Let's give another liter of fluid to this patient. Okay. We'll also have to get, what was the age of this patient?
She's 26.
She's 26. Let's put in a Foley's catheter. We'll have to get a UPT done also on this patient. Okay. Let's move ahead and do that. Can we get a UPT done on my patient?
Yes, sure.
Okay.
She's not passing urine though.
We'll put a catheter, ma'am. We'll have to put a catheter and take
Foley's
some
is getting
urine
ready.
sample. Yeah, we'll have to get a urine pregnancy test because you are fertile in age. So do we get a permission for that? Do we get the permission?
Yeah, but the Foley's catheter is getting ready to be
Okay.
put.
We have hanged another liter of fluid meanwhile. The
Okay.
examination of the abdomen was fine. There was no...
Yes, but I think we should do a focus to see the IVC.
Let's do that. Okay, that's not a problem. Can we
Focus
get
for
a
the
service?
IVC?
Okay. Meanwhile, Dr. Rizvi, is the patient fine over there?
Yes, we usually reassess the primary survey. Can we get a fresh set of vitals for this patient?
It's stable.
No change in any circulatory parameters?
No.
Any drop in the GCS?
We have given 2 liters of fluid to this patient, right? Let's hang another liter of fluid. That will be 3 liters quickly. Okay. She's tachycardic. She is hypotensive. There was history of fever a week back, and she was complaining terribly. Generalized weakness was there, for which we have addressed. Okay.
Your patient starts seizing.
Okay. We are turning the patient on the left lateral position. Dr. Franklin, please immediately load midazolam 0.5 mg per kg. And let's give that. We have given the midas, has the...
Midas not reacting, still seizing.
Okay, let's give injection max self 2 gram. Let's give injection max self 2 gram to the patient. Okay, let's give... Please give him... Okay, we have given a max self to the patient. And we have given a max self to the patient. I have given a Noras to the patient. Has it improved after that?
Yeah.
Okay. Has the seizure stopped?
Yes, it has.
Okay. Moving back and doing some general suction containing with the oxygen of patient. Give her 11 Russ at 20 mg per kg right now. Okay. Okay. Let's give him a right now. Stat 0.3 mg IM on the left thigh. And please do that.
She started seizing again.
Okay. Turning around. Turning around the patient. Give her another dose of midas to the patient. Yes, give a second dose of midas. Give her a 3 mg like that. Okay. We have given another dose of midas at this point.
Seizure has stopped.
Okay. Moving back. How is the patient after this? Is she completely altered and drowsy?
She's not talking to you.
Okay, I'm checking for the response. Is she responding?
She's not responding.
I'm checking for the pulse.
You have a pulse.
Okay. The airway is compromised. Let's quickly intubate this patient right away. Please get the ambu. Dr. Shiksha. Is the patient fine over there? Okay, Dr. Shiksha, can you please calm down? And please do the ambu for this patient, Dr. Shiksha, this side. Okay. Prepare an injection propofol 1.5 mg per kg with injection rocuronium 1.2 mg per kg. Let's intubate this patient. Okay. The patient is not responding. Are we able to? Okay. We have given the sedation and paralysis. We are inserting the ET. Are we able to intubate this patient? Not yet. You're not able to see the movement. Okay. We are giving a birth maneuver. Okay. Are we able to see? No, she started seizing. Okay, fine. Let's lower her with injection. We have given injection propofol already, okay? So we are turning her again to the left lateral. We have already sedated and paralyzed this patient. Still seizing. Okay. Let's give her another dose. Give her phenytoin 20 mg per kg. This is a status epilepticus. Give her that. Has the seizure stopped? After? We have administered injection phenytoin 20 mg per kg at this time. Okay. She stopped seizing. Okay. Move back and we have already sedated and paralyzed this patient. Are we able to maintain what is the saturation at this point? That's what you see. Saturation is 85. Let's put in an LMA at this time because are we able to put an LMA? Yeah. Okay. And we are oxygenating again, pre-oxygenating again. Let's hang another liter of fluid. That's a total 3 liters of fluid, Dr. Franklin. Yeah. So let's do that. We have given the labs are here. Okay. Potassium is 7.5. Okay. And RBS is 40. Dr. Franklin, we have given injection B25 to this patient. Let's repeat another B25 injection. Hypoglycemia has been flagged. We can give, and we are giving injection calcium gluconate 10 ml to the patient. Let's give the calcium gluconate to the patient. So, how much is calcium gluconate? 10 ml is something that we have given. Yeah. I think that we'll be able to do. We have put in an LMA. What is the saturation at this time? 99%. And we have given almost 3 liters of fluid. The BP is still 60-40. Yes. Let's start with a small dose of NORAD at this point, 0.05 micrograms per kg per minute. Let's start with that quickly. Yeah. And we will again the patient is seizing, okay? Turning the patient to the left lateral position while the oxygen is going on. And let's give another dose of propofol, 1.5 mg per kg. We have given another dose of propofol. She stopped seizing. Maybe I stopped to 50-30. Okay. We have given 3 liters of fluid to this patient. Let's give sorry. We have started her on NORAD on a small dose as well, and we have given calcium gluconate to the patient. We have corrected the hyperkalemia. We should give injection glucagon to this patient, 1 gram, 1 mg, 1 mg of glucagon can be given. This will be a refractory hypoglycemia that we have been seeing. It has not improved even after giving almost 200 ml of D25. Yes, the same. So we have given an injection glucagon as well. 1 mg. Is the patient doing fine over there? Time's up. What was it? This was one of the things because the sugar was hypertension. This also could be I was what do you think was it? Diagnosis? This patient was a young patient. She was hypertensive, she was weak, she was complaining of abdominal pain. So this was a septic shock basically that we were dealing with. But then she was also seizing. She had a refractory hypoglycemia. Even she was not responding to the D25 that we were constantly giving. We had the diagnosis, because of which she was getting, there was septic shock because of which she was getting hypoglycemic seizure. There was some other electrolytes. The potassium was on the higher side, which was addressed with the calcium gluconate as well. And there was another electrolyte that we had to look at. Sodium. Does it click anything?
So seizure is something that we should
that we have corrected. We have given almost 3 liters of fluid to the patient. That was a normal survival. Right. Yeah, but we'll debrief that. Sure. Thank you.
So the 5 teams you all want to play or no?
Yeah, obviously.
The 5 teams that didn't qualify.
Where is your team?
Yes, no.
Yes, call them the crush.
Okay, put the team leaders put their hand up if you're playing. One.
Seriously?
नहीं ठीक है, I mean it's up to you all. Yeah, otherwise we can move on to the finals.
No, we need one more at least. One more.
They're all here. Okay, let me. Okay, tea is ready. So why don't you grab a quick cup of tea? I'll ask you the question again. Take 10 minutes. If you want to do it, we'll do it. Otherwise, we'll move to finals. Okay? मैं क्या करूँगा?
एक ही परफॉर्म कर लेते कोई नहीं
हाँ ठीक है, we'll give you all a
एक
chance.
मिनिमम रखो 50%.
Yeah, we'll give you all a chance. Okay, get a cup of tea quickly. We start again in 10 minutes.
What the hell? Why are other people not playing? At least one team motivated. Like it's okay. It's fine. We'll do better next time.
शुभम, संकेत किधर है? संकेत को लेके इधर आ। शुभम, वीना,
check. Hey. 6 6 1.
वीना,
Tick.
पीछे जाना। तू आ। What?
कुछ रहेगा तो फिर उबर करके
I don't know. ABL I think. Radiometer ABL.
हाँ कर रहे हैं वो लाइन अप करना एक 5 मिनट दे दो वो हो जाएगा ये देखो क्योंकि वो भी करना है स्कोरिंग भी करता हूँ वही स्कोरिंग का ही कर रहा हूँ आउट पे कर रहा हूँ
कोई चाय कॉफी अंदर ला सकता है कोई नहीं बात दो टीम ऐसे ही सिनेरियो बनना
Hello.
के 5 सबको. तो अभी you को समझ में नहीं आया. पाँचों को संदीप सर का ग्लोबल एंटर किया है इसमें. प्रसाद ने भेजा.
एनिमेशन येते का? एक माझे
your mind. Yeah, one is, yeah, you can also change your mind, but the other way. So, how many teams want to play out of the 5? One team. Pakka? I don't know. You all are all looking same to me. Sorry. So that's why I'm just looking around, just giving you. Sorry. So just one team. So with your own, yeah, we can make. नहीं बाकी सब चले गए क्या नहीं रे एनीवे ठीक है जो है नो वंस पुटिंग द हैंड अप सो अक्षय यू लेट मी नो व्हेन यू आर रेडी हाँ okay so we have the results. So again, a request that whoever's in the room other than the 2 teams, please stay back. Please encourage, please watch the finals. Trust me, Akshay and Induja put in a lot of effort for the whole day, particularly for the final. So you will certainly look at something hopefully very useful. So, I really don't know which are the 6 teams, but anyway. Again, in no order of the score. First team, KDA 9. उठो मोबाइल छोड़ो बाहर जाओ सेम पैटर्न बाबा नहीं जाना है तो एनी टीम इज रेडी टू टेक योर प्लेस राइट ना एक सॉरी जस्ट होल्ड ऑन हेडसेट लगा के जाओ सबको हेडसेट मिलेगा अभी Actually, we don't know who's going first. I'm creating a lot of confusion. Just go out, I'll come and join you. Sorry. Second team. Those who voted. Any guesses? Kims. अच्छा इनका स्कोरिंग शीट
अभी स्कोर की क्या जरूरत है, वैसे ही 2 ही है।
हाँ 2 ही है अभी तो।
परफॉर्मेंस के बाद हमें रिजल्ट सुना देंगे।
हाँ अभी जरूरत नहीं है अक्षय, 2 ही तो टीम है। 2 ही तो टीम है।
क्लोज कंपटीशन क्या बोलते हैं कलीग्स के बीच में एक और मनन
Going through frustration, clean bandit, China ball, and Marie thing make them air. She works the nights by the water. She's gone astray, so far away from her father's daughter. She just wants a life for a baby. All on her own, no one will come. She's got to save him. Daily struggle. She tells him, ooh, love, no one's ever gonna hurt you, love. I'm gonna give you all of my love. Nobody matters like you. Stay up there. She tells him your life ain't gonna be nothing like my life. You're gonna grow and have a good life. I'm gonna do what I got to do. So rock-a-bye, baby, rock-a-bye. I'm gonna rock you, rock-a-bye, baby, don't you cry. Somebody's got you, rock-a-bye, baby, rock-a-bye. I'm gonna rock you, rock-a-bye, baby, don't you cry. Rock-a-bye, rock-a-rock-a-rock-a-bye. Rock-a-bye, rock-a-rock-a-rock-a-bye. Single mom, what you doing out there? Facing the hard life without no fear. Just see and know that you really care. Cause any obstacle come, you well prepare. And no mama, you never shed tear. Cause you have to set things year after year. And you give the youth love beyond compare. You find the school fee and the bus fare. Already pops disappear. In a wrong bar, can't find him nowhere. Steadily your workflow, everything you know, so you're not stop, no time for your dear. Now she got a 6-year-old, trying to keep him warm, trying to keep out the cold. When he looks in her eyes, he don't know he is safe when she says, ooh, love, no one's ever gonna hurt you, love. I'm gonna give you all of my love. Nobody matters like you. So rock-a-bye, baby, rock-a-bye. I'm gonna rock you, rock-a-bye, baby, don't you cry. Somebody's got you, rock-a-bye, baby, rock-a-bye. I'm gonna rock you, rock-a-bye, baby, don't you cry. With a bang, 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 alright then. Rock-a-bye, rock-a-rock-a-rock-a-bye. Rock-a-bye, rock-a-rock-a-rock-a-bye. Rock-a-bye, down by the cry. Lift up your head, lift it up to the sky, yo. Rock-a-bye, down by the cry. Angels around you, just dry your eye. Now she got a 6-year-old, trying to keep him warm, trying to keep out the cold. When he looks in her eyes, he don't know he is safe when she says. She tells him, ooh, love, no one's ever gonna hurt you, love. I'm gonna give you all of my love. Nobody matters like you. Stay up there. She tells him your life ain't gonna be nothing like my life. You're gonna put you in the worst mood. P1 cleaner than your church shoes. Really point two just to hurt you. All red lamb just to tease you. None of these toys on lease to. Made your whole year in a week too. Yeah, main bitch out of your league too. Side bitch out of your league too. House so empty, need a centerpiece. 20 racks a table come from ebony. Cut that ivory into skinny pieces. Then she clean up with her feet. Smile, I love my baby. You talking money, need a hearing aid. You talking about me, I don't see a shade. Switch on my side, I take any lane. Switch on my core, I kill any pain. Look what you done.
Check. Mic check.
I'm a motherfucking star.
Hello.
Look what you done.
Prasad, timer 25 minutes. Yeah. Yeah. So welcome to the finals. So it is colleagues against each other, Manan versus Deepak. Good. So going to give a scenario and then let's see how things play out. So it's 9 p.m. You have just resumed your duty. And what happens? Handover. Yeah?
Yes.
So you have handover of 3 patients happening. On bed 1 is Raju Rastogi, 40-year-old male, complaining of palpitations. He's vitally stable, but he's planned for a ward admission after HS troponin I report. I think typical how we get handover patients. Yeah. On bed 2 is Farhan Qureshi. He has pneumonia. He's been symptomatic since 5 days. He's been advised ward admission. He's awaiting antibiotics to be given. On bed 3 is? On bed 3 is? Come on, are you asleep or what? On bed 3 is Ranchod Das Chachad. He's a 40-year-old male. He's having upper GI bleed, varical bleed. BP is 80-50. Heart rate is 130. ICU admission apparently is done, but you're not happy shifting with BP 80-50. You have asked for blood and terlipressin. So this is the handover that has been given to you. Your timer starts.
Okay, Dr. Shivanshu?
Yes, sir.
Reassess bed 1, trace the troponin report. Dr. Akash, bed 2, reassess the patient, vitals, antibiotics to be given, trace the labs, and then we'll think about shifting. Dr. Amlu, Dr. Siddha,
Hello, sir. I'm
Dr. Aditya, bed 3, reassess,
I'm Dr. Akash.
to see if intubation is needed for the patient, terlipressin, trace the labs.
So,
Talk to the blood bank.
Like, are there any symptoms?
So if you need any updates, you being the team leader, you will talk with me after discussing with your team.
Is it towards the left side or the right side?
Dr. Amlu, talk to me. How's the airway looking?
Besides chest pain, any sweating,
palpitations,
breathlessness, headache.
Okay, A is okay for now, breathing.
Palpitations and chest pain.
Patient
Since
second
when? 1.5 hours.
You need to discuss with your team leader. He will communicate with me.
Reassess, I'll talk to you.
Okay.
I'll give you the update.
Okay. What, can I get the ECG?
How is the chest rise? Bilateral equal?
I have the ECG.
Trachea central?
Yeah.
Are the monitors attached for Mr. Rancho?
What's your
I've
name,
told
sir?
you the vitals.
Can you show
same.
me your tongue?
Any other sounds?
Okay. I want to see the pupils.
Is the blood
Can I know
arriving
the
anytime
troponin
soon?
levels?
It will take another 5 minutes is what the blood bank said.
What
Can
is
see
the
me?
Have you given him
CRP?
a terlipressin 1 mg for now?
It's coming from the pharmacy.
Okay.
Okay.
Any
What is the
allergies here?
CRP?
Any rashes?
In situ or is it
No.
reactive?
What has
5
happened to you, sir?
seconds.
IV is secured.
What has happened to you?
Is he on PPI infusion for now?
Yes, bolus given, infusion
Fever
given.
and?
8
So
mg
are
per
you
hour
taking
infusion
any
we've
regular
started.
medicines?
Is he on
Then
maintenance fluids? Or
Yes.
is he sudden and onset, gradual
So we are
peak?
waiting for
sugar?
terlipressin and blood.
Previous history of any
How
cardiac?
is the
He
disease
started
of the
like
patient? Is he
while
okay?
having
Is
some
he
cardiac
okay?
issues
Is
in a
he
family,
blood
anyone
pressure
having the
is
same
okay?
complaint?
Is
Is it the first time?
Is the right
No.
shoe
Do you have
easy
any
to
family
fit?
history
Yes.
of travel present?
Nothing at present.
Okay, so
You
no
have any
active
cough,
blood.
cold?
All he needs to be
Of,
given is
cardiac
terlipressin for
issues
now
with
and
like
then
heart attacks?
start
Do
blood.
you
Any
have
labs for
any
this
issue?
patient?
No.
Labs
Balgam?
we are
Any
yet
risk
to trace.
factors?
We haven't
हाँ,
released yet.
कौन सा
We are
कलर का
double
बलगम है?
checking.
No issue.
Okay.
So we have
Thank you.
got the
खून
circulation.
जैसा कुछ आता है क्या? अलग
Complete
सो
the
इन्फेक्शन
secondary
जैसा
survey.
लग रहा है. उसके
Dr. Akash.
yeah.
What is the CRT?
Tell
The
me
primary
about the
survey
patient.
like airway looks patent, breathing is fine, circulation CRT less than 3
Can I know
seconds,
the
BP is
troponin
fine,
levels and
and
ECG?
disability
It's
is
not come yet.
obeying commands and all. This is 15 by
Until
15,
then,
and pupils 2 mm
assess the
bilateral
heart
and
rate
exposure
and-
is null. The sample history is complaints of having fever, cough and cold. With,
So case of
so look,
pneumonia.
LRT, yeah, LRT.
So have you given the antibiotics?
Yeah, we are giving right now.
What are we giving?
Can you come
Piptas
forward a
will give.
little bit, sir?
Any
Take deep
comorbidities?
breaths.
No comorbidity. Sir.
Okay, a monocyst to ceftriaxone 2 grams for now.
Okay.
And we'll put him on a macrolide, azithromycin 500.
Okay.
And ready to shift the patient.
Okay, ceftriaxone,
Keep the blood
monocyst is given.
Dr. Shivanshu,
Yes,
what is
sir.
the update?
So we don't have, this patient has chest pain since 1.5 hours and along with palpitations, no breathlessness, no headache. He has no risk factors.
I think
and,
your phone is
his family
ringing.
history is
The team
positive.
leader's phone is ringing. You need to pick it up.
Where's the phone?
Hello?
Very
Hello.
good.
Say
So
hello.
we can reassess the vitals
Hello?
of this patient.
The X-ray has been done.
Hello, am I talking to Apollo Hospital?
No X-ray.
Yes,
So
may I
while
know
we're
who's
shifting,
this?
we'll do the
I'm
X-ray.
an
also.
NMMC official calling.
So we'll shift in
this
sometime.
is,
Let the
EY
antibiotic get
Patil
over.
Akash.
And your
Dr.
And
Akash, 1
there
minute,
is
I
an
can't hear you.
explosion right now. Some
Can
50
can you
patients
please
have been
repeat?
rushing
I'm
to
so
your
sorry. Can you
emergency
repeat?
department.
Hello? Hello? Hello?
Hello, is this Apollo Hospital?
Yes, yes. Please continue. I'm
Yeah,
Dr.
I'm an
Manohar.
NMMC official calling up. So there was a concert here at EY Patil Stadium. There's a sudden explosion here and some around 50 patients are expected to be here.
Okay. No problem. We are ready.
so is a mass casualty, Dr. Man.
So we'll have to call for help.
Yeah, we'll call
the
for help and
intensive
ICU.
team, PICU, ICU, people, staff, and activate the hospital code for mass casualty.
Yeah, code orange. Code orange is activated.
Keep our crash cart ready. Ambulance, your airway trolley, everything ready. Can you shift your patient to the?
Yeah.
Can you shift
Yeah.
him to the ward?
Yeah.
Okay.
Patient.
Yeah. Bed 1 can be shifted to the ward.
Bed 2.
Yes.
Okay. Is
He's vitally
blood
stable.
available for Mr. Ranchod Das?
Shift. Dr. Afnaz.
Do we have
Shift.
troponin for this patient?
Yeah, it's negative.
Okay, we're shifting him to the room.
And this
We'll
also
see you
shifted. Bed 2
upstairs.
also shifted.
So can we reassess the vitals and
Blood,
BP
terlipressin.
is 100 by 60.
Okay, no active blood in the from the right
Nope.
tube. BP is holding on. We'll shift him to the ICU.
we
Okay.
can open the right.
Thomas,
No,
sit
RT is already
liquid.
in. Please shift. We need beds. We need our resources.
Yes.
Okay.
Shift.
From behind. I will give you the...
So we are waiting for the
Please
patients.
check the airway trolley, ambu. Everything is working.
Airway trolley, cash card, everything is ready, Dr. Man.
Okay, once a patient comes in, Dr. Dr. Aditya, you will triage the patient. Okay? Airway, breathing, and we'll assist him
Yeah,
with the
okay.
procedures.
Yes.
Is the ambulance here?
Aaron, in two.
All walking
Super
patients
team.
on my right and those who are on stretchers kindly assemble on my left.
Okay. Once the patient comes, you'll need to tell them.
Okay,
No
has the
problem.
patient?
Not yet.
So there was sudden explosion, inhalational injuries. You might have to intubate them early.
Okay.
Ja, ja, ja.
Check our airway trolleys, bougies, ambu. Everything is.
We'll put the protection kit.
And yes, let's ensure our safety first, guys. Your PPE,
Mask
your
and-
gloves, mask. Do we have additional help? Has the additional help arrived?
Not yet.
Ja.
No problem.
We'll call it again, sir, Dr. Man.
That's okay, we already informed. Okay, bed पे ले लो, यहाँ पे ले लो, please. Okay, let's reassess. Let's start from the beginning. Dr. Amlu, airway.
Are you okay?
He's talking to you.
Next patient.
Okay. Any secretions are present? Any
No,
grunting
little,
sounds?
little bit of
Carbonaceous material.
secretions.
So we'll do the suctioning. After doing the suctioning, and attaching the monitor.
He's okay, he's just talking.
So I'm attaching to the monitor.
Okay, monitor is getting connected, vitals are on, written over there.
We need
Where
two
pain
white
in
bore
lower
IV
limb?
gauge.
Yeah, you can take her in.
Put him on 1 liter
But there is no
RL for
bed right
now.
now.
Okay.
Pain in lower limb.
And saturation is 92. I'll put on nasal prongs.
आप इधर आ जाइए.
For now, a face mask.
Face mask.
Face mask, 1 liter RL, we reassess.
कोई बात नहीं,
Moving
ठीक
on,
कर देंगे.
circulation, any
कोई
obvious
दिक्कत नहीं. क्या हुआ?
CRT less than 3 seconds.
CRT is 4 seconds.
4 seconds.
equal, no advantage.
और कोई इंजरी आई
Is
है?
trachea is central.
Trachea central.
Any
Yes.
substernal retractions?
धुआं आपने अंदर लिया था कोई धुआं नहीं.
Substernal
कोई
retractions?
दिक्कत हो रही है?
Yeah,
चक्कर आ रहा है?
Then
For now,
on
a
auscultation
tourniquet.
findings.
Tire tourniquet for this patient for now.
Equal are entering,
IV
equal are
access.
entering,
I'm
equal are
taking 18
entering,
cones,
equal
white
are
for IV
entering.
cannula.
So everything
Dr.
looks
Aditya,
fine.
please
On-
help Dr.
I'm
Amlu.
starting with
I'm here.
Any tenderness is any bleeding tendency is fine.
Nothing in the chest.
Okay, so
Only the
Mainly
only
the
the sharp
abdomen.
nail in the abdomen.
Penetrating wound, abdomen.
So you're not
Stabilize, arrange for blood.
Okay.
Send,
cotton
type
ball.
of screen,
NS.
reserve blood, blood
Is the
pressure
distal pulse
after
of
1
this
liter
patient
of
is
fluid.
present?
Pulse is present.
Pulse
One
is
lit-
present.
Yeah.
After giving morphine, how is the pain? Morphine
He's still saying
How
4
bad
out
is the
of
pain,
10.
sir?
Okay, we have taken care of the pain.
Okay.
So we are sending
Do you have any
CBC,
pain somewhere
You've
else?
got a stretcher
Triple
there.
H,
Can you try to move?
ABO blood group type and
Thomas can
screening,
help you
Are
transfer.
you having any
and
pain?
also calling the blood bank to
Over here, are
send
you
for the
having pain?
blood.
Okay, O negative
here?
is on its way.
Over there is
What's
Okay.
the blood pressure
no
after
pain.
fluid?
इधर.
It's about 100 over 60.
So it looks fine. Like map.
Any
ठीक है,
other
इतना ही,
injuries,
ठीक है, कोई बात
long
नहीं,
bone
सब ठीक हो
fracture,
जाएगा.
No,
deformities?
no other injuries.
How is the GCS of the patient? Is a
He's still
spontaneous?
talking to you.
Heart
Okay,
rate has
sir.
come down.
Heart rate is 110.
Okay, it looks fine.
Still
Doctor.
will put him on blood, involve the surgeon.
Yeah, I'm calling the
We need
help.
to, and try not to mobilize it.
Yeah, I'm not.
We need to shift him for the OR immediately.
Okay.
Okay?
Okay.
I'll be back if you need me. Hello, hi, what happened? I'm Dr. Manan.
Yes.
Okay, Dr. Shivanshu.
Yes, sir.
Assess and let me know. I'm here. इधर ले लीजिए यहाँ पे
ऐसे याद रखिए. और कहीं आपको कोई दर्द हो रहा है?
How is the response of this patient? Is the patient is speaking in full
He's
sentence?
still talking to you, yeah.
Yes.
Let's do one thing. Do we have another stretcher with us?
No,
So
that's it.
applying
Cleaning कर दे
Philadelphia
रहे हैं.
collar for
Okay.
now, just
Dr.
stabilizing the
Amlu.
cervical spine.
Dr. Amlu, we need to shift
Dr.
him
Manan?
back. We have a resource patient.
Dr. Manan, blood is available.
Blood is available. Let's
What
do
do you
one
want to
thing.
do with
Shift
this
to the
patient?
OR. Start CPR.
Okay.
Patient
Yeah.
is
We are
shifting.
calling for
थोड़ा
X-ray
bleeding हो
also.
रहा है.
X-ray right
Okay.
lobe.
Shift him.
Yeah, patient is
Also is
shifted.
happy to take them to the
Shift him
ward.
to the OR, man.
Okay, we are applying the skin traction.
Correct,
here.
correct.
This patient is gone.
Checking for response.
So this structure.
You are shifting this patient.
ले लो इसको.
1 sec.
Checking for response.
There's no response.
Checking for pulse.
and
No
breathing.
pulse.
So we will connect.
Connect
One
monitor,
more
start
patient.
CPR.
attached. IV access.
I will take care of her.
12, 13, 14,
What
15,
happened, ma'am?
16,
Can you
17,
sit
18,
here?
19, 20,
You'll have to wait.
22, 23, 24,
Wait,
25,
wait,
26,
wait,
27,
wait,
28,
but we'll have to
29,
wait.
30.
Waiting area
I
is
need
the
I need one person to ambu.
Ambush going on. Thomas is here.
Okay.
He's doing the ambush.
So that is to 2. We used to do that is to 2.
Okay. Initial rhythm.
Initial rhythm in the monitor.
आप इधर
So we will continue CPR.
Continue CPR. Dr. Aditya. 1 mg adrenaline every 3 to 5 minutes.
6,
I'm
7,
here,
8,
call me if
9,
you need
10,
me.
11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You just breathe aram se.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25,
Yeah,
26.
you're getting good
Aditya?
exercise.
Next, yeah.
Just think about advanced airway and sometimes continue.
CPR. Yeah.
2 minutes up.
2 minutes up, sir.
2 minutes are up.
Checking the pulse. Checking the pulse.
Keep under your tongue. Just
Sir, checking the pulse.
No pulse.
On the rhythm.
Dr. Shivanshu.
Monitor.
Asystole.
So we'll continue CPR.
Waiting area.
And we'll prepare for the advanced airway.
most probably she can.
You've intubated the patient.
Intubated.
0.5 clonas.
So
You'll have to wait.
after intubating, we should do for.
No, no.
We're intubated. Once in 6 seconds.
Intubated.
So what dish thigh are you having?
1, 2,
Both.
3,
Okay.
4.
After intubation rescue, but first we not one breath.
Yeah, we are doing it,
Five
doctor.
HL5D.
Okay,
Dr.
I'll be here in
Amlu,
10 minutes.
Please take him.
waiting area.
Is there any relative available?
Ma'am, you can come. Please take
0.5
him.
clonas.
We already given.
Yeah, we'll help her out.
One breath.
What happened
Can you
exactly?
move?
नहीं नहीं
Okay,
कर
sir.
दो.
Hi. Excuse me.
4, 5,
Is there any relative available
9,
for the history?
I'll giving you
Is there relative available for the
Is
history?
relative available for
Can I
here?
give?
They didn't tell you where to go. Where is she going?
Please have a seat.
This chair.
So now you
Please
are
have a seat here, will come.
we will give a compression dressing. We will compression.
Dr. Amlu, once you are done,
Is the
2 minutes are up.
Stabilize the hand.
Checking the pulse
No pulse.
on the rhythm.
Okay.
Flat line.
We'll send
So
you
continue
for
CPR.
in a while when the pain subsides.
So IV adrenaline is given every 3 to 5 minutes. Okay. Yeah. Alternate cycle we are giving.
Anywhere,
There is no
no pain,
pain.
no pain.
It's a compression dressing
We
given.
look for the
Over
flat
this
line protocol.
we reassess. Next patient, please take on that.
I'll be
Bed
back.
number
Let
5.
Dr. Manan?
know the pain
Dr. Manan?
subsides.
Yeah, bhaiya.
Okay.
Since we are continuing having flat line, can I check for the like increasing the gain, anything monitors are connected?
Check all the leads are connected. 5H and 5T. Dr. Shivanshu, can we discharge your patient?
We need an X-ray for the patient since he's unable to move his shoulder.
Dr.
Okay,
Shivanshu,
fine. He's not a priority right now.
Okay, sir.
Switch.
1, 2, 3, 4,
can able
5,
to stand.
6, 7, 8,
Send him for the
9,
X-ray.
10,
Talk to the
11,
technician
12,
if there's
13,
send him for the
14,
X-ray.
15, 16,
Yeah, they are available. You can walk to the
20,
X-ray.
21, 22,
X-ray जाने दो.
24,
He's in X-ray.
26, 27, 28,
sir, is 2 minutes up?
34, 35, 36, 37,
What do you want?
39, 40,
Then
41,
battery.
42, 43,
Okay, is stretcher
44,
What is the
45,
saturation for now?
Burning sensation.
49,
No back pain.
92% right
Do we
now.
have additional stretcher?
Yeah, stretcher's coming.
Okay.
5, 6,
I'll
Dr.
start with
Sanak,
the
there is
minor
burning sensation of both types.
and RBM.
Power 5/5.
Diabetic?
Are you diabetic?
15
No
liters O2
diabetic.
connected.
Okay.
एक हम
तेरे
आगे
पास।
लगा रहे हैं आपको
Give.
Yes,
Once
sir,
every
5
6
for now.
बिल्कुल भी घबराना नहीं है।
Waiting area.
2 months हो गए सर पूछो ना
2 minutes up. 2 minutes up for the patient.
आपको
The bleeding has stopped for this.
आपका नाम रियांश है। हाय मैं
Now
डॉक्टर
also-
आदित्य हूँ। कब से आपको तकलीफ हो
Now
रहा है?
also
सांस
you have the
लेने में?
burning sensation.
यहाँ से खाली एक मिनट
Dr.
बैठ
Shivanshu?
So you
Yes,
can
sir.
wait there. There is a waiting area. There is a mask
two minutes.
camera.
ठीक है ठीक है चलो
the patient.
Dr. Amlu, I want you to dispose that patient.
उठेंगे थोड़ा आराम से।
Bleeding has not
Doctor,
stopped.
is 2 minutes are up?
रखिएगा।
If primary closure
Where do you
needs
want
be
him to
done,
go?
what
So
is
I
it?
will take a suture 3018.
Okay, suturing done. Where do you want him to
the
go?
2 minutes up
Suturing done. Where do you want him
I
to
will
go?
give tetanus and antibiotics. Then we will
Prepare
Given.
for discharge.
Given.
Prepare for
2
discharge.
minutes check for 2 minutes check for pulse
Dr. Aditya,
Checking
where are
for
we with the
pulse.
patient?
IV access.
Do we have the pulse?
ECG ongoing. Patient is
Do we have the
vital,
pulse?
vitally
Keep the
his,
crash rod
BP is
ready.
90.
Yeah, we have kept the
Do we
cash
have
card
a pulse
ready.
for him?
No pulse.
No pulse.
I would
Checking on the rhythm, monitor.
Ace is still.
Oh, continue
Downtime?
CPR.
20 minutes done? 10 minutes
So we
done?
are sending
8
some
minutes done.
8 minutes. More 10 minutes?
and declare. Okay.
I would like to start IV.
So we have sent electrolytes,
in.
VBG.
IV
I will keep
in,
the crash
portable
card ready.
fluids, arrange for portable
If required,
X-ray,
you can
ECG, labs, take a short focus history.
Normal
We'll
saline is
discuss.
started.
Dr. Amlu,
So I put the crash
So-
card here. I want
Sir,
for this patient,
we have sent the
talk to
VBG,
him.
electrolytes,
If
is any
possible, OPD follow-up.
Potassium is 5, sodium is 134.
potassium is fine.
पहले ही आपको सर्दी
And
Asystole, continue CPR, artery 3 to 5 minutes.
Okay.
If he is okay, OPD follow-up.
छाती भी दर्द नहीं होता
so you can follow up in OPD.
One more patient is in.
अस्थमा का कोई प्रॉब्लम
So you
Hi,
are
hello, tell me what happened.
so after next day you can follow up in
There are twisting injury.
आपकी फैमिली में
Okay, ice pack for him for now. I'll come and check back on you. We'll get one X-ray done.
Okay, ice pack kept over there. It's on his ankle.
कुछ ट्रिगर होता
I'll take care of the pain. How bad is the pain right now?
है can I get
No
a
problem.
progress
2 minutes are up.
Pain management.
Checking the pulse.
No pulse.
Done.
I would
On the
like
rhythm.
Ace is still.
Continue.
Give
What do you want to see?
where is the pain?
Adrenaline is given every 3 to 5 minutes. 1 ml.
Yeah, ejection fraction.
There is a
65.
65
हाँ.
IVC is
Either
collapsible
No, normal.
where is the
Dr.
Normal.
card,
Is there-
pulmonary
is
focus.
there
Dr. Manan.
Diffusion card.
10 minutes are up.
10 minutes are up we have given adrenaline again and
10
continuing
minutes
CPR.
up. We continue for 20. We declare.
20
It's
minutes
normal.
more.
It's
Okay.
breathing, moving and
Stabilize
breathing.
this
Last cycle of
until
CPR,
the X-ray,
no ROS,
I
we'll have to
put the
declare.
ice pack.
Okay.
So how much out of
ठीक है, we'll have to declare. We have no other option. Mortuary.
Okay.
Talk to the relative once they are back.
Dr. Shivanshu, talk to the relative.
Check the response.
X-ray.
Checking
Equal,
response.
equal.
Checking response.
Do you have a pulse?
So after giving morphine, your pain is stabilized.
Sorry, equal.
Okay, no cramps.
Checking response.
उस पे क्या लिखा
So
है?
अभी
No
अभी
pulse,
No breathing. So attaching the monitor.
CPR start करो. Like to wait for 5 minutes and then
Monitors
Okay,
attached.
oxygen is on, saline
तो
is
बात
on.
किया?
Okay.
ESS, we have 5 minutes.
5 minutes.
Checking the monitor.
Asystole.
So assuming CPR.
X-ray.
X-ray,
3,
then we'll
4,
see.
5. Take the IV cannula.
120 over 80.
Help him out, we need to dispose this
11,
patient.
12, 13,
IV cannula
14,
secured.
15, 16,
Initial
17,
rhythm.
8. Asystole. We are doing the CPR
Continue.
and we are taking the IV cannula.
Help from
No,
me.
ma'am.
Does he need air protection?
No edema,
What is the
nothing.
saturation SpO?
98%
28,
on
29,
air, on
30. 2
oxygen.
rescue
We
breaths.
can shift him
Yeah.
to
Where you want to shift him?
4, 5, 6, 7,
What is
8,
available?
9, 10, 11, 12, 13,
X-ray
14,
is not
15,
done.
16, 17, 18,
Can
19,
you
Not
20,
done.
I would like to
21, 22, 23,
X-ray
24,
will
25,
come after
26,
10 minutes.
27, 28,
We have
29,
another
30.
patient over here.
Okay,
Keep
उठ के चले जा.
Done. Two rescue breaths.
Bleeding from here.
1, 2,
From head.
3, 4,
From the side.
Drowsy headache and we need a stretcher.
I will.
We need a stretcher.
let me know.
Yeah. I need help. Wait.
Let me know when you're switching.
इनको what
21,
shift
22,
करेंगे?
23, 24, 25, 26,
चलो
27,
take the
28,
patient, next
29,
patient
30.
here.
Switching. 1, 2, 3, 4, 5, 6, 7,
Possible head injury.
Is that
might
2 minutes
require
are up?
airway protection.
13.
2 minutes are up.
16,
Checking the
17,
Pulse check.
checking the
No
pulse.
pulse.
Continue. Down time.
Asystole.
Rhythm
Yes, sir.
on the monitor.
Asystole.
Continue the CPR.
sir.
Just give the compression. What happened?
1 mg
Is there any response?
adrenaline is given.
15, 16,
And we are
He's
collecting the
drowsy.
VPG and electrolytes and checking for the
Already
fat.
sent.
We
No
already
speaking,
sent?
only
Ah,
morning.
Okay.
They need cooling of secretion.
So,
No
Correctly?
secretion.
we will
No.
prepare for the next
Yeah,
cycle. We will
okay
prepare
for
for the
now.
advanced airway.
I'm going to breathing.
Trachea is central.
Central.
Air entry, chest movement.
Chest
Any obvious
is
external
equal.
injury, percussion.
14, 15, 16,
Any obvious external injury is present.
21.
No, normal breath sounds, normal percussion.
CRT bilateral pulses.
You can feel all the pulses, CRT 2
Can
seconds.
you wait for the waiting room? We'll come.
There's one more patient.
Manan, there's one more
Okay.
He has already been advised.
You
to
wait
start
here.
off with the fluid.
She might require intubation for low GCS.
इधर से आए, इधर से आए.
So GC.
19, 20,
So Dr.
21,
Sumanshu, please
22,
take care of that
23,
patient.
24,
ठीक है,
25.
let's
Do
stabilize
you require
this.
You can
rescue
come
breath?
sit here.
So GC
That's
is
one
only
phase.
one V2.
Yes,
So we'll prepare for the advanced airway.
This patient.
Sir,
Dr.
Pupil
Madam,
right is
we'll
blown, left is
prepare for the
reacting.
advanced airway.
Dr.
2 minutes are up.
Checking the pulse.
No pulse.
Rhythm on the monitor.
This is
Which
still.
side?
We are preparing for the advanced
This
airway.
side
You
would
continue the
Blood
CPR.
Right
pressure
side
for
is
this
blown,
patient.
left is
Huh?
reacting.
Blood pressure for this patient.
180 over 100.
ठीक है, let's take advanced airway.
So advanced airway is
30
done.
degree propped up.
15,
Mannitol.
17, 18,
Fentanyl is a
19,
pre-medication to
20,
decrease the
21,
ICP.
22, 23,
Dr. Manan, I need your help.
26, 27, 28,
Dr.
29,
Amlu,
30.
vitamin,
Two breaths.
Sucol,
Has the intubation been
tube.
done?
Yeah, we are done with the
2
intubation.
minutes are up.
We get a single
Checking the
ICP for
pulse.
the patient.
No pulse.
On the rhythm.
So Dr.
Pace is
Sumanshu,
still.
please
Continue
help
the
me with
CPR.
the patient.
Do you require any help?
Any
What is the
antibiotics
downtime for
available?
this patient?
What do you want to do? Intubate?
Yes.
He's
More than 10
intubated.
minutes, Dr. Manan.
Okay.
I'll start
So
with
wait,
patient.
So airway is
10
secure.
minutes.
Dr. Manan,
Declare.
We are declaring.
there is a
Can you talk to the relatives? We are declaring
transfer
patient
an IV
dead.
line and
Hello?
start with
The call. Can I ask the
He
relatives
is
to
high.
please?
Hello?
Relative?
Yeah.
She's her
You
relative?
can give
Hello?
medical aid if BP is
I don't know.
high and he's
Okay,
bleeding from
we declare the patient innocent for the mortuary.
Hello, can you hear me?
क्या हुआ? Mortuary?
हाँ.
उनके रिलेटिव को बुलाना एक्सप्लेन करना है पहले
For now,
Relative नहीं है
mortuary,
इधर.
नहीं है
mass
इधर.
casualty
Yeah,
will
mass
be
casualty.
sorted out
Can you
later.
hear me?
Okay.
क्या करना है?
Dr. Manan,
We have
advanced
secured
airway
Mortuary.
is secured.
Manan, there is a
Advanced
call
airway
for
is
you.
secured.
What do you need?
So we have to shift to CT brain.
Hello?
CT brain? Okay.
Yeah.
CT is ready.
Hello?
So can we shift the patient?
Yeah,
to
we
CT?
can shift
What
the
were you doing
patient.
when it happened?
Dr.
Rupali?
Amlu,
Hello?
do you need any
Mannequin
Yes, how
लेके
can I
जा
help
CT
you?
में.
Yeah, I'm calling
After
from
the
Millie
vehicle
Hospital. I'm
exactly
She'll take
going
it.
to
the vehicle
Susanna.
exploded and you were thrown and
I'm
you
a
crashed into the vehicle.
55-year-old male. He had an
Okay.
anterior
Did you
wall
experience
STEMI.
any vomiting or
We've
nausea?
thrombolized him with
Any
tenecteplase.
Are you waiting?
I want to transfer
Are you
this
waiting?
patient to your
I'll
hospital
go and
for
see
a
this
senior
patient.
cardiologist.
Currently, we
For
have
a
mass
CAG.
casualty situation. So you will have to contact other hospitals. in
Hello,
this
my
area.
name is
What
Dr.
about my
Akash.
patient?
What has happened to
He's
you?
having a heart attack.
I understand you have already thrombolized the
Scratch over
patient.
face. Yes, yes,
You
yes.
stabilized
You lost your
him.
kid.
He needs
Exposed.
further
Acha,
care.
so-
So you're saying
I'm
you
out of
don't
beds,
want
I'm out of
you don't want the
resources.
patient.
What
I cannot accept a new patient right now at this point.
I'm out of bed. So my resources are strained right now.
You know the cardiologist that I'm sending this patient for.
That's okay, but I
He's a
cannot
very
accept
senior
an
cardiologist.
I'll talk to the cardiologist.
You sure you don't want to deny this patient?
Yes, please. We'll have to contact other hospitals in the area.
All right.
If any position opens up, I will call you. If bed opens up, I'll give you a call.
Right now it's stable. I want
You're
to
taken?
for a CT scan.
What are you doing for this patient, Dr. Amlu?
Already taken.
This patient is in CT.
CT. Okay.
Dr.
New
Manan?
patient?
Dr. Manan?
We want to shift this
Yes.
patient to
She's
CT.
a 30 years old female. She lost her child recently.
Anxiety. We
Yeah.
have
So
given her
she's
anxiolytic.
already taken 0.5 mg
She is
pronazepam.
okay.
She's
You
okay.
feel she needs further assessment, any suicidal tendencies, evaluate her properly. She
Okay,
needs a
sir,
psychiatric evaluation. If
Can I
no,
shift this
she
patient
can
to
be
CT scan?
discharged.
Okay.
With CT.
Just make sure any
brain.
person,
CT brain.
any
CT brain.
family member
Yeah.
is available with her 24/7.
You can walk to the CT.
Okay.
Why do we need a
Sidha
CT
baat.
for
So
this
sad
patient,
person
Dr.
score we
Amlu?
need to do.
There was one episode of event.
So we need to do the
amnesia,
sad person
no
score.
recollection of the prior events, no EMT bleed or EM, but he was having a severe EM.
So did you
You would have
like
done a
attend
CT
any
after 6
suicide
hours, that is
attempt
okay.
recently?
Okay. Okay, no problem. Any other patients? Please.
Yeah, we are assessing it. We'll do according to the sad person score.
Okay.
So while you're doing this, your unit head comes down fuming. How can you refuse a patient of heart attack? And what is this code orange you activated? I wasn't even told about it anyways. So he's asking what happened exactly. I'm just hearing people running here and there. He wants a debrief what's happened.
Okay, so we got a call from the local authorities saying there was a sudden explosion, and we received
Sad
almost
person
10
score,
to 20
less than 6,
patients.
not suicidal tendency.
We triaged them, we stabilized them, we shifted half of them. We are in the process of stabilizing other patients. Our resources are maxed out. We had called for help. We are still awaiting help. So we're not in the capacity to accept a new patient, and hence we had to deny a new patient. But we did tell them to stabilize the patient and try contacting other hospitals if they can accept the patient.
Okay. Anything else you want to tell me?
Bed number 4 has been discharged because according to the sad person score, your score is less than 6, so there is no suicidal tendency.
So how many were dead?
We lost 2 patients, 10 minutes of downtime, CPR
Okay.
drugs, SPR, as per ACLS protocol.
Anything went to the OT?
We
one
shifted
penetrating
one penetrating
injury.
abdominal wound to the OT. We stabilized him, and the existing patients which we received in handover, we have.
And anything went to the ward?
One patient.
One patient, one is LRTI went to the ward, and even the troponin, which was normal.
Chest pain, palpitation.
So I need a list of the patients that came. Who's giving it to me?
I'll make a list, sir.
So one patient, troponin, normal
Usually
chest
shifted
pain,
to ward.
palpitation shifted to ward.
Second were complaints of fever with fever, cough and cold. So shifted to the ward after giving the antibiotics.
One
We
GI
stop.
bleed.
Thank you.
Good job, right?
वोटिंग मीटर्स वोटिंग मीटर्स नहीं है बाकी है उधर पीछे वोटिंग मीटर्स है फ्यू मोर आर नीडेड एक्स्ट्रा है उधर उधर मैं कैसे वोट
Sir,
करूं
हमने खा किया before time. Sad person scan.
We're just waiting few more voting meters are coming then we'll vote. So, oh yeah, we need to give the headsets to the second team.
Yeah.
You can tell them the scenario also. ये पांचों हेडसेट बाहर 5 को देना है ये निकालेंगे अभी वो देना है थैंक यू दिया इधर एवरीवन's got a voting meter या प्रसाद वोटिंग रहने दे वो एक्चुअली कि बाद में लाएंगे हाँ बाद में लाएंगे फर्स्ट में नहीं था ना
मैनेकिन तो लाके रखो इसको आने तो वापस वही साइकिल रिपीट होगा अफनाज और
वोटिंग हो गया प्रसाद
और एक मैनेकिन ले लो बेड 3 पे रखने के लिए प्लेन
वोटिंग ए मैक्सिमम F0 क्या गलत दे दिया ओके
ये सचिन को देना
अक्षय पूरा रीसेट हो जाएगा फिर
Yeah.
एक्टर्स को ये बंद करके रखना जब खोलेंगे तभी
Rishabh?
5 headsets?
Yeah.
लगा रहे हैं ना?
Rishabh and
पांचों लगा लो.
Naz, come.
ठीक है, then we'll start.
Assume your places.
किसको बता नहीं देना.
Ready? Okay, ready? Battery.
हेलो.
Yeah.
चला रेडी?
Yeah.
पीछे हिंदुजा को पूछ.
Ready. Ready.
प्रसाद चेक कर कीर्ति से. टीम रेडी है तो बुला ले. म्यूजिक ऑन कर पहले. अंदर ही I'll give you.
Finally.
माइक्स लगा रहे. That's why.
Okay.
मेरा फोन डिस्चार्ज हो गया तो अभी चार्जिंग पे रखा है बस.
और थोड़ा जोर से बोलना होगा पहले. you, Deepak?
You're good.
Manan said you ran away. He's the better of the batchmate.
I will not.
Okay. So again, simple scenario.
Yes.
And let's see what happens. So it's 9 p.m. You're coming on duty.
Okay.
You're getting a handover of 3 patients. You have on bed 1, you have Raju Rastogi. He's a 40-year-old male. Palpitations, vitally stable, planned for ward admission, awaiting troponin I.
Okay.
Okay. On bed 2, you have Farhan Qureshi. He is 40-year-old male. He is diagnosed with pneumonia. He's been symptomatic for 6 or 7 days. Ward admission stable enough, awaiting antibiotics.
Okay.
And on bed 3, any guesses who you have?
Baby Alan.
I know, you are concentrating on what's coming. Okay. Ranchod Das Chachad. He is basically a 40-year-old male with upper GI bleed. Looks like a varicose bleed.
Okay.
BP is 80-50. Heart rate is 130. ICU admission. But you're not happy shifting on BP of 80-50. You might get a call from Mario saying, why did you shift a patient in hypotension? So you are waiting for blood and terlipressin.
Yes.
So all yours, your timer starts.
Okay. Team, we have 3 patients on the waiting for us to see. Okay. Dr. Yash, you can take care of the patient with palpitations, waiting for the troponin I.
Okay.
Okay. Dr. Avinash, you can take care of the patient who is waiting for
Hello,
pneumonia.
sir. Myself, Dr. Yash. May I know your
waiting
name?
for ward admission, you can take care of the patient.
How are you feeling now?
We 3 will take care of the patient who is in bed 3. Okay.
Yes.
Since
so
when?
If you need any information from me, I'll communicate directly with you.
Okay.
You will have to coordinate with your team members
Yes.
accordingly.
Okay, can I get the ECGs done of the bed 1 because the patient
Dr.
has already been
Sonia,
here
take
since
care
long?
of the primary of the patient, please.
Yes.
Okay. Vitals?
Hello? Hello?
Okay.
Is the patient talking to me? Is the patient talking to me?
Is the patient talking to her? Yeah. Hi, sir. I'll be taking care of you. What's your name?
Are you on any medications?
Now it's increased. Initially,
Since when your palpitations are there?
I'm asking his name. How is
1.5
he?
hours. Before that,
So
what
his
you were
name
doing?
is Ranchod Das Charger. GCS is 15.
15.
Okay,
Talking to
then?
you.
Fine. Proceed with the primaries of the patient, please.
Sir,
Okay,
I'm your
do
doctor,
you
Dr.
smoke?
Sunila. I'm one of the
Alcohol,
doctors who will be
anything?
taking care of you.
Okay, last.
Can I
last
have a
time
set of
when you
vitals,
take
Dr.
difficulties
Kevin,
are right
at
now?
next
breakfast, when did you take
monitor?
your breakfast?
Can you
Can I
tell
have
me
a set
your
of vitals?
names?
Okay.
was it bad that day?
Yeah.
Did after medications or anything you feel better?
Monitor attached.
Can I have the vitals for bed
Taking
3?
any medication? Palpitation still there?
Are
Or
there
is
any
it-
Results
gurgling
80-50, heart rate is 130.
130. 80-50, 130 heart rate. So the patient is in shock.
Yes.
Probably hemorrhagic shock because of the varicose bleed. Okay. We have the blood products on the way.
Yes.
Start with IV fluids as of now. Ringer lactate, 500 ml IV bolus.
Yes. Any gurgling sounds?
No.
No. I'm examining the chest.
Dr. Deepak,
Inspection,
bed 1 is stable.
bilateral and
So
is present.
patients are
Yes.
any other lactate?
Bed 1
Okay.
is stable.
Stable.
Auscultation, any added sounds?
No.
No. Cardiac sounds, S1, S2 heard?
Normal.
No. Okay. Neck veins distended?
No.
No. Okay. Circulation, feeling for all 4 pulses, radial and
Present,
dorsal venous?
feeble.
Present, feeble. Yes. Capillary refill time?
Can we get the vitals for
For
bed
5
2?
seconds.
Yes.
Bed
It's
2 is
increased.
vitally stable.
Yes. Okay.
Vitally stable.
GCS, patient is responding,
15.
eye opening. GCS is 15. Yes, pupils I'm checking. Bilateral equal and reactive. Blood sugars of the patient.
Then it will start.
Blood
Deepak,
sugar.
you're getting a call on the team leader's phone. You need to receive the call. Just say hello and you will receive it.
Hello.
Blood sugars of the patient.
Hello.
Hello.
Yes.
Yeah,
Dr.
this is
Deepak.
the NMMC official speaking.
Patient is on ringer
There's a concert going on at EY Patil Stadium.
Yes.
There has been an explosion. 50
Okay.
patients are being rushed to your emergency department.
Okay. Thank you. So team, we have a mass casualty scenario.
Yes.
50 patients are being rushed to the department.
Yes.
Dr. Yash will take care of, first try the patient, take care of the patients. All the ward patients who can go to the ward, please arrange the nurse to
Okay.
shift the patient to the ward.
Can you shift this patient
And
to the
this
ward?
patient
Yeah.
needs active resuscitation. Is the
Can
blood
you shift the
products
bed
here?
to the ward?
Yes.
Is the blood products available right now? With
You
me?
have given terlipressin. BP
Yeah.
is 170.
70.
Okay.
Okay.
Are the blood products available?
Blood products for massive transport
Yeah, so it will take time.
time. Okay.
But BP is 170.
So can I have intensivist to shift the patient to ICU?
Yeah, you can shift the patient to ICU.
Yeah, shift the patient to the ICU.
Yes.
Yeah, the ambulance is here. We'll wait for the.
We should triage the patients when they
Yes.
come.
Yes. So where will be the triage?
Since it's a mass casualty, we can expect a trauma. It's a trauma
Yes.
case.
We will
So
trauma case, we will prepare everything and keep. Dr. Avinash will be taking care of the airway for the patient.
Yes, sir. I will be ready with suction. All airway devices like NRBM, O2 mask, nasal prongs, and all advanced airways like ETT, IGL, LMS, and ETCO2. And we will be ready with ventilator. I will be checking it. Is it working or not?
Yes, Dr. Yash will take care of the primaries of the patient and triaging of the patient.
Yes, I kept all personal protective equipments ready, C-collar ready, a spine board ready, pelvic binder ready, and intonic weight also kept ready for the use.
Dr. Kevin, you should take care of the IV of the patient and see for the circulation part, please.
Okay, Dr. Deepak. All equipments for intravenous access and intravenous access will be kept ready. All emergency drugs, in case of a drug-assisted intubation, will be kept ready. All IV fluids, including pre-warm salines and every IV fluids, will be kept ready. In case of a cardiac emergency, defib will be kept ready along with CPR stool.
Yes, Dr. Silla, you have to take care of any emergency procedures as and when required.
Yes,
Okay?
I'll keep Ral's tube, Forest catheter, Reboa, chest tubes, and any other emergency procedures ready, including portable X-ray and focus.
Okay,
Will
fine.
be on.
So
ready.
team, we should be ready for the mass casualty. Let's wait for it.
The patients are not here yet. Maybe we can discuss the triaging of the patients.
Yes. So we'll divide the patient into red, yellow, and green.
Okay.
Red
Yes.
patients will require urgent care. Yellow patients we can wait for some time, and green can be waited so that we can admit the patients in ward.
Yes, and black will be.
Black will be tagged if the patient is dead on arrival or we can't actually do anything much with our resource limited settings. We are okay.
Yes.
Yes, मैं और दे यहाँ पे. Bed इस bed पे ले जाओ. Bed 3 पे. Dr. Ash, take care of the patient. Take care of the primaries of the patient.
Yes.
Looks like a stabbing injury to the chest.
Yes.
Penetrating abdominal injury.
Okay. So Dr. Deepak, bed 3 is penetrating abdominal trauma, which is an unstable one. Okay, going with the primary survey.
Dr.
Hello.
Kevin, attest the vital
May I know your
monitor.
name?
Dr. Avinash, proceed
Hello.
for the airway.
He's talking to you. He's called Rajesh.
Okay, airway is patent. Will you open the mouth, Mr. Rahul? Am I see any obstruction, any foreign body?
No foreign body.
Am
You
I-
can take the patient
am I
to bed 2.
am I hearing
Dr.
any
Sulda,
stridor
take care of the
gurgling?
patient, please. Proceed to the primary survey.
Am I hearing
You have
any
one more
stridor-
stretcher
Patient on the
there.
bed.
Am I hearing any
Can
stridor
That's
gurgling?
stretcher.
No strider, no gurgling.
Okay, examining the neck.
Okay, Yashasvi, the
Shubham,
pain
पीछे से
in
लेके
pain in
आओ.
lower limb, unable
Neck
to
is
move,
okay,
pain
applying the
patient,
C
heart
collar.
rate will be
Please
110.
take
Collar
the
is
patient
on.
to the bed.
60.
Okay. Dr. Kevin,
I
I
think
want
this
you to
patient
attach
can
two
be taken on a
whiteboard
chair.
cannulas and start on fluids.
Cannulas are in.
Okay,
Mr.
check.
Inside bilaterally.
Take the samples
Mr.
for
Smith,
routine
is she
investigation
talking to
blood.
Samples taken
Yes.
for
Dr. Sulda,
Inform blood bank for
Are you having
MISU transfusion
Dr.
protocol.
Sulda, we have a bed
Massive
here.
blood
Please take the
transfusion
patient.
protocol initiated.
Okay.
I want Dr. Kevin, you give 1 gram of tranexamic acid. State.
Ingestion 1 gram of tranexamic acid given. IV stat.
Okay, monitors
patient is
attached.
vitally stable,
Can I see
but
the vitals of the
Please access the
patient?
patient, please.
Yes.
Okay, this one.
Dr. Kevin, we have
Started
one more
on
patient.
NRBM.
Take it to bed 2.
This is the patient.
Yes.
The
Airway is
patient
patent.
take to bed
Patient is
2.
vitally
Equal air
stable.
entry.
Okay, heart sounds.
Chest equal air entry.
Heart sounds normal.
Okay, circulation BP is 80, 60. All fall pulses peripheral.
All peripheral present.
Sugars,
Just let me know what's
Sugars
happening.
152.
pupils,
Yashasvi, 32-year-old male
Pupils
has
equal and
pain in the
reacting.
lower
temperature,
limb.
Are you feeling
It's
very
Semblance of
temperature,
normal pain.
exposure.
He's unable
Okay,
to
exposing
move.
the body
and
with
vitals
patient's
are
No
consent.
other injuries.
No other injuries. Okay.
And the patient is talking to me.
Okay,
I
excellent.
want
Primary
adjuvants to
survey.
primary survey,
Can
EFAST
you
and
expose
chest
the
X-ray and
patient?
PBH.
They'll come in 10
Airway is
minutes.
patent,
Okay,
understanding
attaching
the
the
chest.
pelvic binder
Is there bilateral
with internal
equal air
rotation.
entry? Am I
Binder
hearing
is
any
on.
added sounds?
Okay.
Can you please give
Yes.
tranexamic acid
Okay,
1
I'm
No
checking.
pulse, no breathing.
Post
Radial
that,
pulses?
can I see the vitals
Can
again?
you
can feel all pulses.
over the
Yes,
right
thank you.
forearm.
Okay.
There is no
Now,
pulse.
capital
How?
infill time?
Which?
Sorry?
How many times the
Capital infill
patient?
time? This is
2
normal.
seconds.
We'll provide a
2
splint to
It's
the
been
patient.
30
Now,
minutes.
blood sugar
Okay,
is-
please tag it
145.
black.
Can I, as it's a mass
The patient has
casualty,
no
can I
pulse,
talk
no
with the
breathing.
surgeon to
It's
shift
30
this
minutes.
patient to the
There's
OT?
no
Yeah, he's
active
ready, you
resistance
can
acid
do
now.
Okay, pre-op investigation was already sent. Sending the patient to the OT.
I will
Dr.
What are we
Deepak,
doing?
Is that okay?
Attaching the black tag is 30 minutes
Okay,
ETA.
mortuary is outside.
Dr.
Yeah.
Deepak, I had
Do I
shifted
have
the patient to
consent
the
to
OT.
expose the patient?
Yes.
Pre-op
Yes.
investigation
With the
was done.
patient's
We had stabilized and we had sent for
Your
OT. You
privacy
want me
and
to see any
exposing
other
the
patient?
patient?
Yes, please help Dr. Sulya.
Okay, Dr. Sunila, what care I can do?
This vitally stable patient who's come with the pain in the lower
Dr. Kevin,
limb,
you needed
and
help?
patient is now I'm doing the exposure with the
Just tell me what is the
patient.
case
Okay,
is.
Dr. Sunila, if all persons are feeble, we can admit to the ward and let what people see because 50 patients are expected.
Yes. If there's a fracture, I would like
Okay,
to
fine.
stabilize that and
You
shift
have to do the hemorrhage control control?
Yes,
Is, with the tourniquet,
sir,
is the bleeding
where's the
happening?
pain?
Yes, I've
Only the
started,
left
I've
leg is
given
hurting.
splint.
Only the
Okay,
left leg
bleeding
is
is
hurting.
Dr.
Is there any
Avinash,
blood
take,
pooling?
please take
No
out the
blood
patient.
pooling.
There's no blood pooling.
Your test
The
pelvis.
pulse is present?
Present.
Yes.
You can take on the bed.
So
by that time,
you're not
we'll
unable
arrange
to
for an
move. Is there a
X-ray
fracture?
as
Any
per-
step?
The
forward
left
from
thigh
the-
looks
Arrange for
deformed
X-ray and give
and
an
swollen.
orthopedic score.
Left?
Thigh.
Any arterial
Yes, but
injury?
the baby
Left
is
thigh.
We will
The
splint
The
and
left
shift the
thigh
patient
looks
to
deformed.
ward.
Okay, we
Constant
will give
left
Thomas
thigh.
splint
This
and
is the
at-
left thigh.
Yes.
Come here.
Left thigh. Okay.
Yes. We will splint. Is the Thomas splint available?
Thomas splint
Yeah,
available?
it's available. कहाँ गया?
So what happened?
Okay,
It's
we will
there,
apply.
it's
We will
there, it's
apply.
there. You
We have
applied it.
applied
We apply
Thomas
Thomas
splint.
splint.
Applied.
Okay.
PB
Pelvic
pelvic
binder.
binder attached. Pelvic binder attached.
Binder attached.
Internal rotation of the limbs,
Done,
please.
done, done, done.
Okay.
Already done.
Yeah, you
We'll
can send
get the ortho team on call.
What happened?
Yes,
Doctor
yes,
team
yes.
is available. What do you want?
Shoulder.
Can we
will
shift
just
the
hand
version
over
You
to
are
them?
suspecting
Yeah,
shoulder
you can
injury.
shift the patient.
Is the
We are done internal
contour of the left arm intact?
Yeah,
Is he
mannequin
able to
attack.
move the arm?
No, sir. There
He's not able to move the arm.
Please get the
RM
ortho
is
team on
restricted
call.
due to
We'll get
pain.
an
You
X-ray
can
done
give
on the
an
way and admit
injection
an ortho in the
morphine
ward.
4 mg IV stat
Thank you.
and reassess the patient, please. You have any allergies? Please ask for that.
That patient has been stabilized. So
Okay.
Dr.
Any
Avinash,
other
can I
thing?
help you?
Yes,
Ma'am,
please.
I'm Dr.
Dr.
Sunila.
Deepak,
Can I
I'll
speak
send the
to you?
patient for
Let
X-ray.
me help you.
Dr. Sunila, please take care of the mother.
Okay.
what's going on this?
I understand, ma'am. You cannot find your kid, is that right? Is that
Dr.
right?
Yash, you
Okay,
can
I'm Dr.
help Dr.
Sunila.
Avinash in
I
answering
can
the
help you
question.
find your kid. Can you tell me when you last saw your kid, please? Can you tell me when you last saw your kid?
Having any other side pain?
I understand. Would you like to sit down so that we can settle this? I will. Yes, I will help you find your kid. Is that all right? Can I help you? But I need you to talk to me for that. Okay? Can you tell me when did you just come to the hospital? Just
Dr.
now?
Sunila, you can take the patient on a bed if she is uncomfortable.
Dr. Deepak, only isolated limb injury. We can do ketamine and reduce the
Some
shoulder.
deep breaths
Yes.
with me. Inhale and exhale.
We can attempt reduction of
He's
the
on a
exhale.
chair at the
Do you think
moment.
now you can
We
talk
can
to
shift
me?
the
Are you
patient
ready
to that
talk
side.
me?
We'll order X-rays if
Are you ready
it
to talk
is
to me?
Chest
Okay.
X-ray.
To confirm,
I need-
you need to
I would like you to sit
do
down if
shoulder
that's
X-rays,
okay.
chest
So we can
X-ray,
both
X-ray
work on
BBS.
this
Okay,
together
take the patient to the
and
bed, please.
and
Okay,
find
can we
your
send that to
child.
investigation?
Dr. Kevin, the next patient is here. Please take care of the patient.
Yes,
Here or
Mr.
you want to send them?
X-rays, X-rays we want. We want to
Okay.
reduce and then.
Okay, X-ray will come
Can
in
you tell
10
me
minutes.
where you lost your child? I don't know. Is it a boy? Is it a girl? What is the age of the child?
Since when?
What is the age of the child?
Okay, what happened
6
exactly?
years old. Is it a boy or a girl?
Dr.
I
Sunila,
understand it's very
Okay,
she
so
looks
patient
in
airway is
physical
patent,
distress. Please
checking for breathing,
have
chest
her
rise
on
is
a
equal.
seat, please.
Equal.
And we will
Bilateral
forget
air
the
entry?
bottom of the side
Equal.
pulses.
Okay, all four
Is that
pulses.
okay? Yes,
All
please come with
present.
me, Mr.
Okay.
This is Gayatri, right? Is that your name? I'm good. Thank you.
Exposed
It's
with
okay. Come.
chest checking for blood sugar levels.
145.
What's
Pupils.
Let's get
Sorry?
to the chair and we
Pupils.
will find
Equal
the
and
child.
reacting.
Okay,
So you were telling
with
me
patient's
that you have a
consent
6-year-old child
and
and
maintaining
you cannot
patient's
find the
privacy, I'm
child. Is that
exposing to
right?
see the thigh.
Okay, can you tell me
No
if it's a boy or a girl?
No injuries. Where exactly
girl.
burning sensation
and,
is there?
And can you tell me anything more? How
Okay,
he could
doing
see?
the rock roll.
You
Is
cannot
any
breathe.
painful?
Okay.
No.
Can I start
No,
your
Anywhere?
oxygen? Do you think that will
Dr.
help you?
Avinash, check for the
Anywhere?
X-ray. It's available
That
now.
will help
Is
you?
X-ray available, sir?
Anywhere
X-ray is
painful?
not available yet.
Anywhere
I'm going to
painful?
check
You
your
can
vitals, okay?
No pain.
apply a
Okay.
shoulder
Okay.
mobilizer.
Vitals
Shift the
check.
patient to the
Rock
ward,
roll.
please.
I'm checking
I am
the
doing
vitals of the
for
patient.
rectal examination with
Arteries
using
90,
lignoc and
you
jelly.
are at 70, respiratory 25,
Dr.
salivary
Kevin,
20%.
at-
Patient
address
is
the
How's the
patient.
for rectal
But
examination?
she seems to be having
How's
a
the for
panic
rectal
attack.
examination?
Normal.
Okay.
Ma'am, to find your child, I
Dr.
need
Avinash,
you
can
to
you hear
work with
me?
me. And for
Still,
that, I
there is
need
a
to
burning
help you
sensation.
calm
Brother,
down
exactly
first
other than that,
because
no
you are
response.
Pain
having
is
a panic
settled.
attack
Do you
right
have
now.
sensation
Pain
here?
is settled.
Checking
You
for
can
blood.
attach
You
the
have
shoulder
feeling
mobilizer to
sensation?
the patient to the
You
ward,
can
You're
get
able
please.
to find your
Chest
child
rise.
that you're
Chest
having a
rise is
panic
there.
attack.
I want to
You
shift this
understand?
patient to the ward.
Okay. So
Yeah,
we need to
ward
find
is
your
ready,
child.
he can go.
Okay.
Nikhil,
I
you
will
can
alert
What
the
boy?
security
Can
services.
you help me to shift this patient?
Yeah, shifted to the ward.
Can I start your note too?
BP is 90, 60.
Do you have anyone with you, accompanying with you in
start fluid resuscitation according to
Dr. Sunda, you can proceed the primary survey. The patient is a primary survey.
I am putting IV for large
Is a primary survey
This is
educated?
a young mother who is saying that her child is missing. She is not able to get any because of the child, and it's a 6-year-old
Yes,
male
fine.
child.
One more patient
She's having a panic attack.
Panic attack. Go check. Do an ECG, do an ABG. Doctor, let's take care of the patient.
Can I get a stretcher for this patient? It's an ankle twist. It's an orthopedic emergency ankle twist. Might be ankle dislocation. Can I get a bed for this patient?
That's all you have. What you have over here?
Okay, what boy, can you shift the patient to that bed?
I would like to get an ECG and an ABG. And I would like to get the psychiatric.
That's the only bed available.
We can take the patient on the floor, do it there.
Okay.
The psychiatry team and
Psychiatry team.
for counseling to
Not
help.
available. It's 9 p.m.
Down.
It's a patient's bilateral air entry clear.
Right side,
Dr.
there's
Sunda,
reduced air
see
entry.
if the patient has any systemic involvement or not. Otherwise,
Checking
you
for
send the
pulses.
patient to the
We
ward.
don't have a bed to do an ECG right now.
Dorsal speed is
Normal,
present in ankle
present.
dislocation.
Slightly stable.
Okay.
But
For
you
pain, I am
don't- we-
Ankle is not dislocated.
Yes.
What sound am I
Even
hearing
actually
on
the patient.
It's a hyperresonant.
Inserting the IV.
Can I see the
One more
patient?
patient.
Yeah.
You pain medication.
I would like to give the
No
patient
pulse,
an
no
ankle
breathing.
X-ray.
clonazepam.
X-ray.
This
X-ray
is
right
30
ankle
minutes, no pulse, no
epilateral.
breathing. Dr.
Authorized. X-ray right foot in the oblique.
Monitoring the black tap.
If you take it, then we can
You
work
get
on
a hint.
control side. Would you like to take that? Just a small tablet.
Can I
Do you have any drug
Angle.
allergies?
Reverse it.
It's not a dislocation. It's just a twist sprain.
It's
Are you
just a
feeling better now?
Yes, sir.
There is pulsation.
Pulsation,
No
there is-
better now?
neurological
No,
deficit.
neurological deficiency.
Apply a
Yes, sir.
splint, shift to what?
Yes, apply a tablet is being asked for the X-rays.
Okay.
Pain medication given.
Photo or any
Okay.
other details, I will share with the security.
Saturation is
You don't.
getting
Any
Can I
phone
know
number to
about
call
the
you
bed tree?
later?
Dr. Avinash briefed
Are you
Dr.
willing to
Deepak
get
about this
admitted
case.
so that we can sort
This
we
is
can help you.
36-year-old male came with complaints of difficulty in breathing.
We need
As
to
of
find
now,
the
we
child.
give
Yes, I
primary
understand.
survey.
I
Primary
understand.
survey, there
Ma'am,
was
I will give you
right-sided
some time,
pneumothorax.
and then I will be right back with you. I will alert the
So we
security
have did
services.
bilateral
Is that
ICD
okay?
insertion has been done.
Yes.
Pelvic binder has been attached.
Would you like to get admitted?
Then we have started patient on
No.
IV fluid
Yes.
correction
So
also.
please
which
stay
patient
here.
is improving.
And if
Okay.
you need me,
Responding
please
to
give
the
me a ring.
treatment, sir.
Yes. You have you done an e-fast to the patient?
E-fast is done but still pending. sir.
Machine is not available.
Machine is not available.
Portable chest X-ray is available
Port-
post ICDD.
No, they are not here yet.
Okay, fine. How is the vitals of the patient right now?
Right now, patient is improving, but we will recheck the
100
vitals.
over 70, heart rate is 120.
120.
Sats are
Start with the
98.
ringer lactation.
Saturation.
Tranexamic acid 1 gram. Give, see the patient.
Okay,
Sir, the patient does not wish to get
Take your bed
admitted,
one.
but
Okay,
I have
okay,
given
okay.
her
Can I shift the
symptomatic
patient to
relief.
that
I
side?
would like
Yes,
people here under observation
Okay.
while I alert the security for a missing child.
Okay.
Okay.
Receiving the
Yes.
patient with manual
Dr.
inline
Deepak,
stabilization.
symptomatic
Dr. Kevin,
she has
will you
been
help me
treated
with this
caprospam.
patient? This patient
He's
looks
ready to
sick.
wait here until I alert the
Dr.
security
Avinash,
and
take
they
care
can
of
start
airway.
the
Come
control
here.
child.
Yes. Keep her in observation
Yes.
so that we can see.
Oh, will you?
monitor
Hello, may I know your name?
Yes. She's connected to the vitals monitor.
He's just moaning.
Okay, is morning. Am I opening the mouth? Am I seeing any obstruction, air, pulling of secretion, vomiters?
No vomiters.
Okay.
afternoon,
Gurgling
sir.
sound strider.
So have you
No
been taken
strider,
care
no
of?
gurgling.
Okay. Dr. Avinash, patient saturation is
You
90.
still
Dr.
having
Kevin,
pain.
attach on
May I know
NRBM
your name,
mask.
please, sir?
NRBM mask.
This is your trauma case now.
Yes,
Can I
trauma.
Have
see
you
vitals
given
on the
the
monitor?
manual establishment
Done,
survey
done,
call done?
done.
NRB 50
Is
liter.
that right?
Is the
Checking
hemorrhage
your nose?
controlled? Is it
And you have to
Yes,
see
his
your
hemorrhage
ankle,
control is
that right?
already
hemorrhage
done.
controlled?
Okay.
Yeah,
You
it's
seem
under
to be
control.
vitally
It's not
stable now,
bleeding.
meaning
Okay.
your heart rate,
Dr. Kevin,
BP,
attach,
oxygen, all good.
check the IV patency and
You're
you
having a lot of pain.
1 gram
Have
of
you taken any
IV
medication
was
so far?
tranexamic acid.
It is
Given.
pain.
Tranexamic acid
Yes.
given.
I can
Okay,
help you. Have
GCS
you
is
gotten an X-ray?
Dr.
E3,
Kevin?
V4, V2 with
No.
saturation fall.
I need
So
to check what
we will
medication
plan
has
for
been
drug
given to
assisted
you, and then I can
intubation.
give you another
Okay.
dose. Is that
Sir?
okay?
Yes, we will go with drug
Yes.
assisted.
Incubation, you can sit here. You can see the patient. That's taken care of.
Uh,
Shift the
we are-
patient to the ward.
we-
I want to say that the patient
Okay,
is still in
then
pain.
attaching
Can I
the
get another
pelvic
medication?
binder.
Yes, you can give
We want
medication
post
to the patient.
intubation
Please
EG
give
and
both
chest
dose.
X-ray.
I want
Chest
to
X-ray
give
will take 10 minutes.
Okay.
Give main medication.
Okay, this is
Tell
normal
the
post
staff,
intubation.
shift the patient
We
to the
want
ward.
one CT
Dose
head.
is heart rate 120.
Inhalable anesthesia.
Yes,
You
sir.
have
What
your
happened to you?
is that right?
98.
Start the IV and shift
In
it to
exposure,
ward.
any other
We will
bleed?
take your
No
X-rays
other
and
Okay,
send you
just
a
the head
paper
with isolated head injury. Okay, we had initially stabilized the
Yes,
patient.
I
Now we
think
want
we-
CT head with
please
C-spine. Chest X-ray
Sir, I'm
PBH.
Dr. Sunila.
From our side, all
Kevin,
investigations
what's
we
the
had
patient?
sent.
CT or X-ray?
CT head with C-spine. LS CT head with C-spine.
Okay. CT is available.
Okay, we will shift the
Thomas
patient.
CG में लेके आए.
We are
I've
decomposed
heard
the
that it was a
patient now.
With I want one staff nurse to accompany the patient.
One side is 130.
Staff
You
nurse,
can
we
ask
had
for
intubated the
intensive
patient.
assistant, the patient
You
will
just your role is to make sure that tube
intensive
does
care
not
unit.
get dislodged during
Okay,
CT
sir,
scan. Okay, please make sure
Take a
that.
look at that. Is that
X-ray
okay?
shows
Yes.
pneumothorax
Is
is
there a-
Dr. Deepak,
Can I get
we had shifted the patient to CT scan.
Yes.
With everything making sure.
Okay.
Explain the staff.
Please stable, meaning
You should not get dislodged during
They are
CT scan.
available. They are happy to take it.
Okay.
You want me to see that case?
Please, please reassess bed one
Yes.
and
So,
discharge
why
the
don't I
patient
get
if
the
required.
surgery on call?
Dr.
Okay,
Sunila,
and
you want me
get
to
that
help you
stitched up.
anything?
But I hope you understand. I'm good, thank
Kevin, how's
you.
your
But I
patient?
hope you understand that it's a very
The
busy
patient
time
we
for
have
us. So
shifted
is it okay for
ICU.
you to wait for some time?
Patient has been
Is
shifted.
that
So as
all
of now,
right?
Dr.
Yes.
Deepak, we
I
have
will
one
be,
unstable patient patient, we are shifted to CT head. I am suspecting some IC bleed would be there because pupils are reactive. GCS was fall, head injury is there. We had done everything. Just waiting for the CT report.
For the basic investigations, I just want routine CBC.
We have shifted one more patient
That's all.
with ICDT patient.
No other
has been
allergies?
shifted
Do you
to
have any
ICU.
previous comorbidities?
Does the patient back from the city?
Do you have any pain? Do you want any pain medications? You are in pain? Yes. Would you prefer an oral? Are you
She
okay
was
with an oral
suffering from
analgesic?
a panic attack,
Please
loss of
prescribe to
child.
the
She
patient
was
tab
keeping her
paracetamol,
observation.
650 mg. Okay, start. Anything else that I can
But
help
we
you?
can,
No.
we have a on-call psychiatrist here? No.
It's 9 p.m.
Can you also please clean the wound? Dress it for now
We can
and give an
shift the
injection
patient to the
TT.
ward.
Thank you.
She's stable.
Yes. So I've seen
She's
a patient travel.
She's not happy to go to the ward. She wants to know where her child is.
Dr. Sunday, you can take care of the patient, please.
Yes.
Meanwhile, if we can contact PR.
You can take care of her.
Yes.
Meanwhile, we can
Mrs.
contact
Gayatri,
your
I'm back. How are you feeling now?
He can find a child or not.
Are you
Yeah,
feeling
there's
it
one
like
more
you
patient
can
in
give
the-
me more details about your
Take the
child?
patient
I
to
know
bed.
that you're concerned about
Reassess
your
the
child.
patient.
Reassessing.
Yes.
I'm starting 3%
Yes.
NaCl,
Can you
100
tell me
ml over
if
10
this has
minutes.
ever happened? You're feeling
Okay,
like
can
you
I
can't
see
take
the
a
CT
breath,
film?
right?
It's
And
an
you're feeling like
extradural.
your heart
Okay,
is
but
very,
Dr.
chest is very
Deepak,
heavy
it's
and your
EDH,
fingers are
C-spine
numb.
with whole
I
spine
would like
screening
to
is
get
normal.
No fractures.
blood
No
sample.
fractures.
Okay, is that all
Okay.
right?
Reassessment.
It will
Okay,
help.
reassessing vitals.
No? Okay. I think what is
Reassessing.
happening
Reassessing
is
the patient
that
vitals.
because you're
Which
missing your
vitals?
child,
ABC,
you
reassess from
are
ABC,
having
then
a
vitals.
panic attack
Okay,
because
checking
of
for
this
airway is already
breathing
patent.
too
We have
fast,
secured the
and
airway.
calcium
Breathing part,
is
bilateral
not
chest rise.
Equal.
all
All
bound
four
in your
pulses.
body, which
Present.
means that you're
Okay,
getting the
GCS.
numbness. Okay, I would like to
GCS,
reassure
you've
you
sedated
that
or
you're
not
not in
sedated?
any
DHC
danger,
drug is
but
free.
I want to help you feel better.
Dr. Kevin, be available
Okay,
for the
if
next
you-
patient if there is time. Be available.
It will take time. What I need for you
Dr.
is I
Deepak,
will
you have
start
a
you on
call
O2 if
coming
you're okay
from
with
some
that.
nursing home.
Oxygen?
I wanted
Yes.
neurosurgery
Yes.
opinion for this
Yes,
patient.
I
We
am
are on
Dr.
the way.
Deepak.
Okay.
You're getting a call, so we'll be quiet for a minute.
Hello.
Yes, ma'am.
Yeah,
I'm Dr. Deepak.
Susanna calling from Millie Hospital.
Yes.
I have a 70-year-old male who had an anterior wall STEMI.
I can't hear.
We can't hear you. Sorry.
Louder,
I can't
louder.
hear.
I have a 70-year-old man
Mike.
who has an anterior wall STEMI.
Okay.
So we thrombolized him with tenecteplase.
Okay.
Hold on, hold on.
Just not. Okay, fine. I can
Mic
hear.
1, headset.
Everything's off.
Hello.
Ah.
Yeah. So I have a 70-year-old male with anterior wall STEMI.
Yes.
We have thrombolized him
Yes.
with tenecteplase. I would like to transfer him to your hospital for a senior cardiologist.
Ma'am, we are dealing with a mass casualty as of now, but I would like to see the patient. You can shift the patient to emergency.
Okay, so I'll transfer the patient.
Yes.
Stroke MI.
So the neurosurgeon is here.
Okay. Hello, sir. Myself, Dr. Yash. We had received one patient with a head injury. We had
Ma'am, I'm
intubated the
sorry that
patient
I
as
left you
patient
for a
GC
while.
was less
So
than
what's
9,
happening in your
pupils were
body, did you
non-reactive.
understand what I tried to
We had done
explain to
CT,
you?
CT
If you can
suggestive
try
of
and take
EDH.
deep
We had given
breaths
pause,
sometime,
we had given
this will help
anti-epileptic
the calcium
LAVP
go
and we
back
had
into
given
your blood and your
anti-arrhythmic
numbness will go away. Do you
3%
trust me?
NaCl. Now it's
Okay.
zero.
Yes, and then we can look for your child.
What do you want me to
together,
do?
Okay?
So I want your expert opinion. What
I
would
will
be the
back-
further
be
line
back
of
with you
management
soon.
from your
Is that
side?
all right?
Craniotomy.
Okay. But if
Okay,
you
sir.
would
Can
like
I
us to
shift the
already-
patient to OT?
give you
Can we shift
child
the
Yeah,
support.
you can shift.
I had
Would you
already
like that?
ordered
Yes.
pre-op
Okay.
investigation. Can we shift the
2
patient?
liters of
Yes.
oxygen and an
Shift the
antibiotic
patient.
salad.
So as you are shifting the patient for craniotomy, your phone rings up and you see Dr. Mario calling. And he says, Dr. Deepak, what mess have you created? Why am I getting calls from everyone right now? What's happening in the department?
Yeah, I can talk to him. Yes,
Yeah,
sir.
talk.
Yes.
I mean, you talk to me, not to him.
Yes, yes, Dr. Maria, I'm Dr. Deepak, now on
Yeah.
for duty. Yes, tell me, sir.
So what happened? I mean, why is so much chaos going on? Did we have too many patients? What was going on?
Sir, we had a mass casualty.
Mass
like,
casualty?
Yes.
And why didn't you inform me?
So we had people on the floor, so we tried to manage with this.
How
If
many did you have people on the floor?
we
And how
had,
many patients
we
did
had
come?
5, it was almost 50.
50 patients and 5 of you. I don't think that's the right thing to do. Did you call anyone for help? Okay, what were the patients?
Sir, one of the patient was having head injury, which was shifted for CT and was found to have SDH and was shifted for neurosurgery
Okay.
consultant ICU admission.
Okay.
Then we had minor scratch injury patient, which was shifted to ward for suturing.
Okay.
Then one ankle dislocation, one
Okay.
patient with pneumothorax, bilateral chest tube insertion was done and
You
shifted
said
to
you had 50 patients. This is just 1, 2 you're mentioning. So what happened to the rest?
all the patients were triaged according to the priority and was
Okay.
treated, and all the green area patients were shifted to wards for observation. Yellow patients are on observation.
Okay.
Currently we
And
have
how many were dead?
I had 3 dead patients who was in arrest on arrival, and ATA was 30 minutes. So
Okay.
non-salvageable was sent to mortuary
Okay.
with black tag.
Okay, fine.
And-
That's it. Thank you.
Photo, ले रहा है? Ravish, photo,
Sir, come here, sir.
scoring sheets.
Scoring sheets and inputs
Oh.
from judges.
हाँ. ये सब एक ही बाजू में कर देना, पीछे तो जाएगा नहीं. So if you can just return the headsets. and have a seat.
Thank you, sir.
Voting, Prasad.
Just asking judges to do it.
Scoring to karna.
Yeah.
I'll get them to speak. Hinduja kare.
What was the final? Less? More? So let's hear from the judges what they feel. Obviously semis and final. What was good, what was better, what was best, and what can be made better. We'll start with you, ma'am. We gave them chances in the morning. We'll come back to them. Don't worry.
Wow, what fantastic performance by all teams. I must congratulate all teams. You know, the semi-final ones, I was not there for the previous teams, but we were just looking at them when we were traveling, and all teams have performed really well. Even more so, I would want to congratulate the team, Apollo team, Dr. Jagasia, Dr. Devdar and their colleagues to get this all together. Because believe me, you're going to participate, but when they form the cases, it's not only the questions, but they also have to think of the answers that they would get. And most of the times, it's not just a single answer. It's like a branch tree, right? So the people who are getting the case together, they have to put in much more efforts than the people who are going to perform. So a big applause for Apollo team. All teams performed fantastic. For the semi-finals, I would just say concentrate on how you're going to intubate a status epilepticus patient. You have to be very clear about your drugs, right? When you're talking of either ketamine or propofol, what are the side effects of these drugs? What are the indications? Which patients you would use them? You have to be extremely clear when you're talking about giving drugs. For the finals, wow, it was as if we were in the ER, and I was a third party looking at what was going on in our ER. And this goes on really, this is a usual scenario, right? And it was an awesome experience because I have learned so many things about what exactly goes wrong when we are dealing with this kind of a situation. So we run disaster codes, mostly for NABH purpose, really. But when I looked at whatever was going on, we've had similar situations when we've had food poisoning cases coming, when we had acute gastroenteritis, a series of patients coming in, and the kind of overwhelmed that we were, and what we could have done better was reflected in what I saw in these performances today. So it was an excellent performance, but go back to your management of disaster code, right? When you declare a disaster code, there is a medical management part to it and an administrative part to it as well. So don't forget the administrative part because you are the incident chief till someone comes over and takes over from you. A team of 5 or 6 people on the floor cannot manage an incoming inflow of 20 patients, right? So I know you just had to verbalize those things. When you actually do it, it really becomes a very hard thing to do because you have to keep everything in mind. That's why we have these job cards in place, right? I'm sure all of your ER departments will have job cards for disaster management code. And all the best.
Thank you. Thank you for the kind words, ma'am. Shweta, ma'am.
I'll keep it really short. The thing is, it was just like a wow. I have nothing else to say because the performance by the teams and the cases as the whole scenarios unfolded, it was amazing to watch, and I'm sure the people who were performing, it was extremely challenging for them as well, because we could see some of them really sweating, so the whole thing, that is how the intensity of it was. So I think it was a perfect thing to actually simulate. It was like we were actually in the ER. So I think that's the best which could have happened. And I think if you want to take it notch higher next time, I don't know what are you going to do next time. So wonderful performances by all the teams. Whoever wins is one thing, but whoever participated had the guts to actually come and perform here in front of so many audience and in front of the online audience which is present. So a big round of applause for all the participants and all the teams.
Sandeep sir, few words from you.
Emergency medicine is where humanity meets its rawest age and we hold the line. It's it's a final test of our temperament and how we deliver. Many people say what we are doing means what is our specialty. We are specialists of resuscitation. When resuscitation comes, nobody should hold our hand, and this platform is the opportunity to sharpen our skills. And I thank you, Nitin. I thank you, Akshay. I thank you, Hinduja, for organizing such a wonderful conference, and give big applause to them. And both finalist teams did fabulous. They did very well, and no words to describe. Means I enjoyed thoroughly. Thank you.
Ketan sir, Pritam.
हम लोग अभी तक स्कोरिंग कैलकुलेट कर रहे थे. There are 3 judges, 3 global scoring and voting.
So I think for Team Apollo and Nitin sir has given us is the closest that we can get to the actual scenario. And this is the time and place where we can learn, and when the real life scenario comes, we can do a grade higher. So very well done by all the teams, and it was truly a great experience and learning experience to see every one of you do and work hard. Thank you.
Thank you. Thank you. Anyone wants to share some feedback, insights? Enjoyed, not enjoyed? कम था, ज़्यादा होना चाहिए था. Stroke STEMIs now. Yeah, Mario. Good.
So this was the best SimWars in recent times. The last scenario, there's no words to compare the realism that was there. The pressure that the residents and the team was into was uncomparable. And kudos to the Apollo team. Great job. And to all the participants who participate today. Everyone did a wonderful job. Congratulations.
Thank you. Thank you.
So the voting has to be added, but can you guess the difference between the 2 teams?
0.1.
1 mark. Voting add हो रहा है अभी, so I just found out. So the 3 judges and the global मिला के 1 ही mark का फर्क है. We're just waiting for the voting. वो हुआ ना last round में tie हुआ. We had to use the first round.
Tiebreaker. One more sim.
हो गया?
One more sim. I'll be the patient. Any inputs from students? It's only seniors talking, I feel. Anyone from first year? We have your registration. It will take us 2 minutes to pull the data. Bolo. So one thing I liked about him, in the last 5 minutes, when I asked whether you have a list of things, he very proactively said, yes, I will make it right now. Because that's the most tedious job. So And that too a first year saying, yes, I'll make a list of patients who came to the year. Yeah.
Good evening, I'm Dr. Aditya, first year DNB from Kokila Pain. This is my very first SimWars, and I really want to thank the team for organizing such a wonderful event, which really makes me go back and reflect and relearn whatever things I've been doing so far. And it was a wonderful experience. Thanks to everyone, all my team members and the audience and the fellow competitors. We had a wonderful time. And this is something which I'm going to cherish for throughout something like really. Thank you so much. That's all I can do.
Did Manan bribe you or at gunpoint?
So we've got the results. If I can request the faculty to come on stage. आ जाओ. And both the teams.
है बहुत जगह है यार. अभी तो इतने पेशेंट्स आए. बहुत जगह.
क्या हुआ?
बहुत जगह है. चलो, wear your jackets also.
Ravish
should have made a poster.
ऊपर ही ठीक है, नीचे ऊपर ठीक है.
बीच में लाइटनिंग और ऐसे इधर उधर जाओ.
ट्रॉफीज उठा लेना.
इतना जल्दी कैसे आए?
ट्रॉफीज ले लो ना साथ में. So one team can come this side. One team can be there. एक बोलेंगे तो दूसरा समझ में आ जाएगा. So the winners, Kims. So we can start by felicitating KDA. Runners up का एक और ट्रॉफी है ना? हाँ, runners up ट्रॉफी है ना? So you can आ जाओ.
Get your money up. I put money down on all of us, on my people now, on what I love. Ooh, baby, it's dangerous. Your problems are just not the same to us. We're dealing with things you ain't seen before. We're feeling the weight of our ancestors. We're healing with ways that don't last too long. Don't have the time and it obvious. Don't help for the weak, but the liquor strong. Plenty here, boy, for all of us. Now bring out the drums in this bitch, and my homies got rich doing shit that they said wouldn't work. Bring out the guns in this bitch, hit a load up a clip, I'm gon' shoot up the place we don't care. I see the bums that be wishing we end in the ditch, and the plan.
So we've got a prize money for them as well. इनको थोड़ा पीछे लो.
Where's the party tonight?
पीछे वाले आगे आ रहे. मैं पीछे जाता हूँ तो आगे. नहीं अरे हाँ. हिंदुजा भी है ना? क्या इधर आ, उधर आ. प्रसाद भाऊ. हो गया रविश. We have the winners. पहले ले लो फिर बुला लेते. पहले ले तो लो. उसके बिना कहाँ जाओगे? अरे बुला लेंगे. पहले ले तो लो. बहुत भारी है, बहुत भारी है. रख लूं? वो नकली है ना, वो थोड़ी बैंक में जाएगा. बस हो गया अभी. हाँ, we'll take a group pic. How will we? We'll come down. They can all. पहले इनके साथ. तो आगे आ जाओ. संदीप. इनके साथ ऊपर चाहिए, फिर नीचे जाओ. पहले आगे आ जाओ. अक्षय, प्रसाद. You all are still here. ए, चल चल. हाँ ठीक है. You all can kneel down. आ जाओ. आ जाओ, आ जाओ. Good idea. आ जाओ. आ जाओ. So they can come in. सबको शिफ्ट करना. So you all can stay. You all stay on top. Faculty will come down. So can all of you please come on stage and take a group picture? आ जाओ, आ जाओ. ऋषभ, फिदा, come on. Thomas. हाँ, सागर का भी करना. You're leaving? Okay. See you. Thank you. सागर का करना है. Faculty is down. Faculty is down.
You have few years to come down.
No, no, you can be down. No problem. सागर का देना है. हिंदुजा नीचे आ. जाओ, जाओ, जाओ.
सागर को फिर तुम दे दो.
नहीं, देते ना अभी. रूपाली, इधर आगे. अक्षय पीछे. प्रसाद, जाओ ना ऊपर. जल्दी जल्दी जल्दी. नीचे नीचे. ऊपर ऊपर ऊपर. चलो चलो चलो. एक तो अंदर आ. तुम लोग आगे हो ना. तुम लोग आगे आ जाओ. श्वेता. रविश, क्या हुआ? नीचे अगर किसको. हाँ, रविश. प्रसाद है. ब्रीदिंग भी बंद है. थैंक यू. बिठाना वापस. Vote of thanks. हाँ. Can you guys have a seat just for 2 more minutes?
Please have your seats. Just 2 minutes.
First things first, I'ma say all the words inside my head. I'm fired
He's
up.
good with the camera angles.
ये सब बाकी है
Faculties.
भी बुलाते हैं वोट ऑफ थैंक्स करा ये बुला रहा
पहले वो बुलाते हैं, लास्ट में वोट ऑफ थैंक्स करते हैं। और इसको कब पहले सागर
तो पीछे से लेके सागर को बुला रहा
Okay. So again, we felicitated Preetham, we felicitated Bhusare sir. One more person is here. I keep on jokingly saying or seriously saying I have 3 mentors in my life. One is here, one is at KDA, third is sitting. So Dr. Sagar Shah, been with him for more than now, what, 10 years? Yeah, 10 years. Still doing our stupidity time and again. So again, people who have worked with him know how strict he is. He will take your case. Yeah? So, you're felicitating? Okay. Sandeep sir, if you could please felicitate. And you want to speak something?
Hello. Actually, what we are seeing today is on a real, means in simulation what we are doing, some of our emergency physicians doing in the real life, and we are taking this opportunity to appreciate their efforts. Because you know that 10 years back, 15 years back, 20 years back, taking a career in emergency medicine is not a simple decision. That was some outstanding, out of the box decision. And not only taking the decision and staying in emergency medicine itself is one big effort. And to appreciate this, their indomitable spirit and resilience, we are giving a token of appreciation to few of our senior emergency physicians who contributed in growth of emergency medicine in Maharashtra and Western region. In that note, I am calling Sagar Shah to please come and take this honor.
Can I request Akshay to felicitate Sandeep? Chal.
Thank you.
Ravish.
Thank you.
Thank you, Sandeep. Akshay, you need to stay there.
मेरा नंबर लगा के
Can I request Dr. Gauri Ranade on stage, please?
Thank
you so much for coming all the way.
Thank you, ma'am.
Akshay, one more. Dr. Shweta Tyagi, please.
Thank you, ma'am.
Thank you so much for coming down all the way.
Thank you.
Can I request Dr. Hinduja, please? Felicitate Dr. Ketan Patel. Thank you very much. You spent a night in Mumbai for us. And Dr. Ankur Masani, please.
आप दो, मैं बोलता हूँ, आप दो।
क्या?
प्रसाद। मैंने मना किया। Someone who's imported from Nashik, please. Dr. Prasad. And Dr. Hinduja. So last but not the least, vote of thanks. Need to thank few people, lot of them actually. I think starting with Hinduja, great support for organizing, thinking cases, thinking out of the box. Rupali, she's always been supportive in any event of the emergency department. Kirti, where is Kirti? Yeah. So she always takes care of back end most of the time. Yeah.
Anyway, sorry.
Yeah, no issue. So obviously these three important people, and last but not the least, the front man. You know who's the front man? People who have seen Squid Games will realize, but not in that way. Yeah. So obviously when we plan of it, there are a lot of things which are impossible to execute. You need to talk to him. Then we execute it smoothly. So thanks a lot to Nitin sir also. So hopefully this was helpful for you guys. Like I said at the start, the idea is not to win or lose, the idea is to learn. One team will win once, next year they may not, obviously, yeah. So I hope this was a great, I would say, learning curve flattened rather than steep, yeah. So all the best, and I hope you carry this to your department and keep on practicing time and again, okay? It was lovely having you guys. People especially who are not participating but still turned up, great.
Thank you.
Thanks a lot. We appreciate you. Take care. Bye-bye.